shows that all types of face coverings are, to some extent, effective in reducing transmission of COVID-19 in all settings. This is through a combination of source control, which limits the spread of the virus from a person, and through protection to the wearer. Laboratory data shows that even non-medical masks, such as cloth masks, made of 2 or 3 layers, may have similar filtration efficiency to surgical masks. As ever, Mr. Speaker, we are guided by the advice of our scientific and medical experts. We will keep these measures under review and will take further action if necessary. Now, I must make progress. The self-isolation regulations were introduced to provide a legal requirement to self-isolate for individuals who have been notified that they have tested positive for COVID-19 or that they are a close contact of a positive case. On the 16th of August, thanks to the success of the vaccine rollout, we were able to introduce a number of exemptions to self-isolation for close contacts, including for those who are fully vaccinated or under the age of 18 years old. Given the greater threat that may be posed by the Omicron variant, we have reviewed the application of these exemptions. This latest amendment to the self-isolation regulations is targeted at helping to slow its spread. From 4 a.m. today, all individuals notified by NHS Test and Trace or a public health official that they are close contact of a confirmed or suspected case of the COVID-19 Omicron variant will be legally required to self-isolate for a period of 10 days, regardless of their age or vaccination status. I've been very generous up until now. Anyone who has been notified as testing positive for COVID-19 regardless of the variant will continue to be legally required to self-isolate. We appreciate that self-isolation is not easy and that it places a burden on people, but we also know that it is highly effective in limiting the spread of the virus. The Canal model estimated the impact of testing. I really must make progress. Tracing and self-isolation on COVID-19 transmission from June 2020 to April 2021. During the period of the study, the model found that testing, tracing and self-isolation had a critical impact on identifying cases of COVID-19 and reducing onward transmission. The model found that between 1.2 million and 2 million infections had been directly prevented as a result. Additional assistance is available to those that are being required to self-isolate through the range of financial and practical support measures that the government has put in place. Mr. Speaker, I am confident that these 2 sets of regulations represent proportionate, precautionary and targeted action on the face of a new COVID-19 variant, the risk of which we do not yet fully... Order. In fairness, I think the Minister's been very, very generous with their time. And what I would say is, I'm sure we have got some capacity to put more speakers in if they require. Minister. Together, the impact of these regulations should combine to help slow down the spread of the Omicron variant and give us valuable time to assess how effective our vaccines are as a shield against this new variant. We are committed to reviewing these measures in 3 weeks' time, when further scientific analysis should help us determine whether these measures are still needed or whether they need to be extended or strengthened to support us in our wider fight against COVID-19. I hope colleagues will join me in supporting these regulations and I commend them to the House. Yeah.
The question is that motion number 3, as on the order paper, I now call Shadow Minister Alex Norris.
Thank you, Mr. Speaker, and it is a pleasure to speak for the opposition in this important debate. The Omicron variant is a sobering reminder that this pandemic is not over, and we need to act with speed to bolster our defences to keep the virus at bay and to keep each other safe throughout the difficult winter ahead. On these benches, we were critical of the government's slow response to the Delta variant, slow to protect our borders, slow to act to reduce transmission in the community. So we welcome swifter action with regard to the Omicron variant, and as my honourable friend, the member for Tooting, said in this place yesterday, we support the measures laid out in these 2 statutory instruments, one on face coverings, one on public health restrictions. It is right, of course, to be acting urgently, given the seriousness of the threat, Mr. Speaker, but it is sad to be debating these after the fact. We need to build public confidence in whatever measures we bring in, and it is always better to do beforehand rather than afterhand to show that this parliamentary scrutiny really matters. I will give way.
Parliamentary scrutiny point. I'm very pleased to hear him say that. He will know that yesterday I asked the government for assurances that if they were to extend these measures or to want to strengthen measures after the House has risen for the Christmas recess, that I felt the House should either continue sitting or be recalled. The Leader of the House, in answer to my question, suggested that it would be up to the House. Can I ask the honourable gentleman speaking for the opposition if he agrees that if the government brings forward strengthened measures or wants to extend these after the House has risen, does the opposition support the House being recalled so that we can debate the matters, vote on them in advance, or is he prepared to give the government a blank cheque?
I'm grateful to the honourable member, right honourable member, for that intervention. My predecessor as Member of Parliament for Nottingham North had himself a strong period around recalling Parliament in 2003, so he would smite me down if I dismissed him out of hand. He's trying to draw me on a hypothetical, which I'm not going to do that. However, what I would say is, when we were getting through the backlog of such SIs over the summer, I said to the Minister then, the Honourable Member for Bury St Edmunds, that I would have met at any hour at any time to get through some of them, because they were weeks and weeks delayed at some point. So I haven't changed my view there, though I suspect I will give way to them.
I thank the honourable member for giving way, and specifically on that point that my colleague just raised. Representing the party that he does the Shadow Minister therefore think that we should come back before Christmas, or maybe after Boxing Day and before New Year, if the House is to be recalled?
The honourable member for Lincoln's question makes me think that he's got some plans booked. If the honourable member is trying to book a weekend away, I would not let me set those dates for him. So turning to the regulations, starting with the Health Protection Coronavirus Wearing Face Coverings England Regulations 2021, number 1340, it is right to reintroduce masks on public transport, in shops and other settings, including banks, hairdressers and post offices, for those who aren't exempt. This is a measure that should never have been abandoned, and whilst mask wearing in public spaces forms part of the government's Plan B, it was always on our bench as part of our Plan A rather than an emergency measure, as was encouraging working from home where possible. I will give way.
I'm grateful to my honourable friend because I'm slightly confused by these measures, because surely within any indoor setting the risks are the same, and whether you're on public transport, in a shop or some other indoor space, the risks still exist. So could he tease out maybe why there is an inconsistency within these regulations?
Yeah, the honourable member for York Central makes a very good point that I will cover shortly, but I would say that yes, of course it should apply to public transports and shops, and also I would say to the House of Commons chamber, but I'll get to that shortly too. I'll give way to the member.
Thank you very much. I thank the honourable member for giving way. Last night I walked past the Shadow Cabinet room and there was quite a party going on inside the room last night, and I popped my head round the corner. There was lots of drinking and shuffling going on. You know, that's fair enough. That's the rules at the moment. Knock yourselves out, it's nearly Christmas. But why is it okay to come into the chamber and tell us all one thing in front of the cameras and do something completely different behind closed doors?
If the honourable member is seeking to redress grievances relative to what parties he has and hasn't been invited to within the Labour Party, I'm afraid I'm simply the wrong person to address those concerns to. But I would ask that the Minister, in order to build confidence in this issue, publishes the guidance that she and her colleagues have relied on, that say that public transport and shops are areas of likely transmission, but hospitality, for example, is not. Because again, we do need to build confidence in that way. Regarding public transport, Mr. Speaker, anybody who's taken on journeys on public transport in recent months will have seen firsthand a lack of compliance, and that's of course just the Prime Minister. But beyond that, all of us will have seen that on the tube or similar on our commute. I'll give way.
Just on the enforcement point, and I like him, have probably travelled on the tube in recent months and seen a lack of compliance. But the enforcement on the tube is, of course, handed over to TfL officers. Does he think that the London Mayor should be doing more to enforce mask wearing on the tube?
I'm grateful to the member for working for that intervention. I mean, we obviously will now see how these regulations are effective. They've only been going, 9.5 hours. But I do have reticence, as I'm going to get to very shortly about members of staff whose primary job has not traditionally been to enforce such measures now being put into that place. And I think that gets to the point that the Honourable Member for Sheffield Central was getting to. So on enforcement, I will give way.
Thank my honourable friend for giving way. The issue surely is that enforcement is impossible when people can just claim an exemption. And you're not allowed to ask, why have you got an exemption, can you prove it? Right from the very beginning, shouldn't we have had a system in place where if people wanted an exemption, a medical exemption, the Minister called it, then there had to be medical confirmation that someone was entitled to it because they had a medical condition which meant that wearing a mask was actually damaging to their health.
I'm grateful for the Honourable Member's intervention. I mean, we're certainly after the fact now on that. You know, I do think we have to protect the principle that those for whom it would be a detriment to their health, that we don't expect them to wear masks. I think that is the right level of proportionality, but we're reliant on good faith and people therefore not abusing that, and I would be very disappointed to hear in the cases that he has raised. But I particularly want to raise with Ministers the point around shop workers. Our hard-working shop workers have given so much to us over the last 20 months. They've kept open the vital community assets that have meant that we've all been fed and watered. And in return, they've faced increasing violence and abuse. It should be very clear, and I hope the Minister will make it clear, that they are not being asked to police this. And that instead, she will give perhaps a bit more detail, because colleagues clearly wish to hear it, about how she thinks enforcement will act in practice. The largest number of infections, Mr Speaker, are now in those aged under 20, with the peak at approximately 10. This is a big part of continuing transmission, but the changing policies and the drifting policies on masks has created confusion across schools, colleges and universities. Could the Minister confirm the new requirements across all settings? I'll give way.
For giving way. I'm very pleased that the compulsory mask wearing hasn't been extended to the hospitality sector. I think it would be deeply damaging for those businesses if that had been the case. Could the Honourable Member confirm the position of Her Majesty's opposition on this issue? Because I think I heard something yesterday, perhaps something slightly different just now.
I'm grateful to the Honourable Member for Ipswich for that intervention. It's hard given that it's not on the face of these regulations. So what I've asked a minute or so ago is that the Minister be clear about why that differentiation was made, and then all honourable and right honourable members will be able to make a judgment as to whether that was a wise or not wise decision. I've given way to the member for Lincoln. I'm not ruling out doing it again, but I'm not going to do it immediately. So to move on to ventilation, which links to education settings, Mr Speaker, throughout this pandemic, we on these benches have called for a radical upgrade in the ventilation of public buildings, particularly schools. And we know that that's not something you can just click your fingers and do. It's more expensive and much harder to do and more time-consuming than asking people to wear a mask. But it is a particularly effective intervention. 18 months into this pandemic, could the Secretary of State, could the Minister update the House on how many public buildings now have proper ventilation systems as a result of decisions taken during this pandemic? I'll give way.
I'd be grateful for the honourable member opposite. Has the opposition done any costing of how much it would be to implement ventilation en masse across the educational setting?
I'm grateful for the honourable member from Bosworth for his intervention. I mean, first of all, he slightly goes further than I did in saying that it should be rolled out immediately across all schools. Of course, there would be significant financial implications. It would, of course, be very good for British business too. What we're seeing, I think it's very clear to foresee through this pandemic that in the future, better ventilated public buildings would be a significant part of building regulations in general. What I'm seeking to get from the Minister is any sense that any, never mind all, have been done at all. I'll give way.
Well, to the Minister for giving way. Can he cast his mind back to the debates we had on smoking in public places? And what he's suggesting is properly engineered extraction ventilation. Then we kind of dismissed that during those debates, though many of us would have liked to have seen it as an alternative to an outright ban, because of the sheer engineering cost of doing that. And what is he proposing simply opening windows? What exactly is he proposing when he says we need to improve ventilation? Because at one extreme it's going to be murderously expensive and virtually impossible, and at the other it's simply opening the window.
I'm grateful to the Honourable Member from South West Wiltshire for that. I can't cast my mind back to that debate because I believe I'd just started secondary school when that had taken place. However, I can foresee the issues that were raised. I mean, I wouldn't actually do down the idea of opening windows. That in and of itself would be a good thing to do, and I would support that. What I'm saying is that there are certain places where that will work less effectively than others, and we ought to have some sense of, certainly building by building, what might be an effective measure. As I said in my prefacing remarks, I don't think this is something that you could just click your fingers and do easily, but I would like to get a sense that we've tried to do any at all, and I've yet to get that, and I hope the Minister will disabuse me of that, but I will give way.
I'm grateful to the honourable gentleman for giving way. I raised the issue of ventilation last summer because we've known for a long time that COVID is airborne, and wrote to the Chancellor on 2 occasions asking that he at least remove VAT to help businesses and public bodies who pay VAT to actually afford it. Sticking 20% extra on the cost of a ventilation system seems quite weird in the middle of a pandemic.
Yeah, I'm grateful to the Honourable Member for Central Ayrshire for that intervention. I mean, it gets to the root of it for me is that we've been talking about this for a long time. What I'd really like to hear from the Minister in closing, Mr Speaker, is whether or not any action's been made, any progress whatsoever in this area. So turning to the regulations number 1338 regarding self-isolation. So these regulations govern new rules around self-isolation after contact with a person who is suspected to have contracted the Omicron variant of this virus by removing the exemptions to self-isolation. Now, this will be frustrating. We saw this in the summer, Mr Speaker. It will be frustrating for those who would otherwise be able to avoid self-isolation requirements through being vaccinated, but now will have to stay at home for a full period of time. However, it is right that as we wait to see how our vaccines and antivirals respond to this new variant, that we prioritise caution and seek to limit community transmission as much as is humanly possible. But I hope and I think the Minister may have got this sense from colleagues, the eagerness to know more in this, but I hope the Minister will tell us when she thinks she's likely to have enough information about this variant that she can return to Parliament to say whether the government feels that this regulation ought to remain. But there is, of course, Mr Speaker, a significant gap in the fence of these regulations. This gap has existed throughout the entire pandemic, and it is bewildering that we as an opposition are still having to raise this, and that relates, of course, to fixing sick pay. What we have learned throughout this pandemic is that the overwhelming majority of the British people want to do the right thing to protect themselves, their family and each other. But where this falls short is when they're forced to pit this against their need to feed their families. Sick pay, both in rate and availability, has proven insufficient to protect families against this horrendous choice. So these regulations will be weakened. They'll be weakened when people ignore their symptoms and go to work, weakened when people say they're self-isolating and are not, and weakened when people turn the app off to avoid being a close contact. Surely ministers have learned this lesson over the last month. I'm surprised that we didn't hear more from the Minister on that. Moving on to travel, and the Honourable Member for South Dorset raised the regulations relating to red list travel. Now, my understanding is we're not talking about those today because they were laid via the negative procedure, but elements within that relating to testing will have an impact on regulations 1338. Last week, we suggested that the Secretary of State begin PCR testing for those entering the country, so I'm pleased that the Government has listened and has included day 2 PCR tests in the measure that announced yesterday. But there are still holes in our defences on international travel, and I'd be very keen for the Minister to say how she and her colleagues have reached the decision to only introduce day 2 testing and to not reintroduce pre-departure tests. I'd be very keen to know the scientific basis behind that. And we've heard, Mr Deputy Speaker, many reports of private tests not being followed up, especially those perhaps that were by those offering the cheapest prices. What is the government doing to enforce this and to make sure that if we are bringing back day 2 PCR tests, which we support, that is actually effective? So bringing this to a conclusion, Mr Deputy Speaker, because I'm conscious of how many colleagues wish to speak in this debate, this is a concerning moment in this pandemic. What we've learned over the last 18 months is that it's vital that at moments like this we act decisively. We are pleased to see these regulations come forward. Indeed, in the case of mask wearing, it was premature to have stopped at all. But there is much more to do to avoid being back here in the coming days and weeks. Working from home where possible, fixing sick pay and improving isolation. The actions, improving ventilation, I apologise. The actions we need to take are clear, Mr Deputy Speaker. It's time for the government to meet the moment. Thank you.
Sir Graham Brady.
Thank you, Mr Deputy Speaker. I shall be brief in my contribution to this debate. I have a number of concerns, though, about these regulations and, first of all, about the manner in which they've been introduced. And I'm glad the honourable gentleman opposite made this point at the opening of his remarks. Why? Why on earth did we have regulations come into force at 4 a.m. today when we're now at 20 to 2 in the afternoon debating them? Surely it would have been possible to have a debate yesterday or indeed to delay the implementation of regulations until this afternoon. And I think it does indicate a rather casual attitude that persists in government to parliamentary scrutiny. The important questions that my right honourable friend from Forest of Dean has been making as well about the question of what will happen if these regulations are renewed after the 3-week period when the House isn't sitting. And we still have no clarity as whether the House would be recalled or not, whether they would simply be extended for a period of weeks without the House having the opportunity to comment on it. Of course.
It's also worth just saying, well, one of the things you get from ministers when you press them on these things is around parliamentary time, but he will know, looking at yesterday's performance, is the House normally sits until 10 o'clock on or 10:30 on Monday. The House actually got to the adjournment debate at about 7:15. So there were hours yesterday when the House could easily have debated both of these measures, which means we could have debated them before they came into force, which invariably, even the opposition agrees, is invariably the better solution when it's at all possible.
Absolutely. And as a former Chief Whip, my right honourable friend, I think, knows very well, there is always parliamentary time available when governments want to do something. And it's only when they're reluctant to do something that parliamentary time becomes elusive. The further question as to why it is that only one of the instruments before us has got an expiry date on the face of the legislation. Surely it would have been better to put an expiry in place which would have required some positive action to renew or extend if it was deemed necessary. I think there are also some very serious concerns about the efficacy of what is being proposed. I think we know enough by now about COVID that we can see which interventions are ineffective, Mr Deputy Speaker. We can see that even full lockdowns possibly delay the spread of COVID. They don't eliminate it. And in this instance, I'm intrigued to know from the Minister if the government's research were to find that this new variant is effective in evading the vaccines, what action exactly do they propose then? Surely not to return to a full lockdown, knowing that would simply defer a problem for a period of days or weeks or months. Happy to.
Fred, if he recalls, the reason for lockdown was to reduce a potential impact on the National Health Service. Would you agree with me and everybody who's opined on the subject that there is no conceivable way in which our NHS is going to be overwhelmed by this? That would be a remarkable thing, since 90% of us have antibodies right now. Therefore, a justification for a lockdown falls away completely.
I'm grateful to my medically qualified friend for that intervention. Of course, he's right, that is unlikely. There would have to be some evidence of a very different kind of variant of COVID for it to pose any kind of threat of that sort. But of course, he's also right to point out, when we first went into a lockdown, that was intended to protect the NHS for long enough for us to increase capacity in the service for a 3-week period. And that first lockdown then spread into 3 months. And this, I think, is the most important thing that this House should be guarding against, the mission creep that allows government simply to introduce restrictions, then further restrictions to extend them, just to get into the habit of regulating what we do. And this is really my most important concern of all. In the summer of 2020, the Prime Minister said that it was time to move on. It was time to start to trust people to make decisions for themselves. I rejoiced at that and thought what a wonderful thing it was that we were moving to a point where we would advise people, we would inform people, we would make sure they had the best evidence to make decisions in their own lives. But now we see the first instinct of government when we don't even have any evidence that the Omicron variant is worse in its effect, and there is some suggestion from South Africa that it might be less severe, but the first instinct is to introduce further compulsory measures and regulations, obviously relating to face coverings in some settings, but only until the 20th of December, relating to self-isolation and the measures which affect the travel industry, and particularly the move back to PCR tests at day 2. Of course.
We're about to have another pandemic as we approach Christmas, to the huge disadvantage of enterprises across the country. And it fundamentally undermines the other main effort of the government to increase vaccinations. Because one of the advantages of being vaccinated is that you don't have to self-isolate if you're in the company of someone who's infected. But if you take that away, you're removing one of the incentives, the principal incentive, to get vaccinated.
My friend is absolutely right. And I think it's a very serious concern that we might be entering a world where we lurch from one set of restrictions to another, where no business or no individual can really get used to the idea of the freedom that they're able to exercise, or what the restrictions might be that are enforced at the time. And it really does concern me, as we all now, I think, recognise that we're not dealing any longer with a pandemic. We're dealing with an endemic virus which is going to be with us for many, many years, probably forever in some form. We will have further variants that emerge. They might emerge every couple of months, they might emerge every year. We tend to have a new flu strain on an annual basis. Some of them are much worse than others. But surely we need to get back to an assumption that people will make decisions for themselves and have control over their own lives. We can't move, as we appear to have done, to an environment in which government simply assumes that it can instruct us, and it can do so whenever there is the first small evidence from anywhere in the world that there could be a new strain which behaves in a different way, that we'll have new and potentially swingeing public health measures put in place. I really do ask ministers to consider what the implications of this are, what the implications are indeed for looking at other diseases, and whether we're going to start treating other diseases and viruses in the same way, where we just assume that the best thing to do is to compel people and instruct them of what actions they need to take. Make it work.
My honourable friend, he's just started to explore that issue of what happens when there's a variant. What we're seeing from the government thus far is a load of new measures. Possibly then the pharmaceutical company saying, oh, we can make a new vaccine for that within about 90 days, and then we'd have many, many months to get in everyone's arm. And having done that, and going back to a sense of freedom, another variant would emerge and we'd be on that track all over again. Has he considered the madness of that type of policy?
I think we should all be afraid of the madness of that kind of policy. And the difficulty is that maybe 18 months ago, when some of us started raising these concerns, it was possible for some people to suggest that we were being fanciful. We've now lived it for 18 months, and we can see this reaching ahead. We can think back to when the Coronavirus Act was renewed again last, taking us through to the spring of next year, and the assurances that we were given that that was going to be the last time, that we wouldn't need this kind of legislation again. But now, again, we see the government's immediate assumption that what it should reach for is new controls, new compulsion, new rules that will be inflicted on the British people. And I think we need to move away from that, move back to a world where we trust people, where we engage with the public, where we recognise that government is there to serve the people, not the other way around. Whitford.
Thank you very much, Mr Deputy Speaker. I first of all would like to just say happy St Andrew's Day to all Scots across the parliamentary estate, whether born in Scotland or adopted Scots like myself. Obviously, we're here to talk about this new variant of concern, Omicron, and it's quite clear that we're in the early days of this and we need more research. But it is a heavily mutated variant, and looking at the mutations, it includes mutations that do suggest increased transmissibility and also mutations that are associated with immune escape. And that's what's causing the concern. We see cases surging in South Africa, but we do not yet have proof that those surges are directly related to Omicron. One thing that has emerged from South Africa is evidence of reinfection of people with previous proven COVID infections. And that's something that we haven't seen so often during the pandemic. Just to respond to the member for Altrincham and Sale West, I would have to say he talks about people's freedom to choose what they do, but the person they might infect actually has the choice removed from them, particularly people who are immunosuppressed or who are vulnerable. It is a network, and if you've ever seen that little GIF where someone drops a ping pong ball onto mouse traps, you will realise the way things spread. You may have a choice. I, as an immunosuppressed person, may therefore not.
Giving way. Isn't exactly the same thing true of flu?
The thing is, we don't suffer the same deaths, hospitalisations or outcome from flu. Well, we don't. If you look at 170,000 deaths over the last 18 months in the UK, we certainly have bad flu winters where we can get up into the teens towards 20,000, but we've never got close to 170,000 over 18 months.
And I know the Honourable Lady has a great deal of medical experience, but obviously she's referring to a period when we didn't have vaccination. Am I not right in thinking that in a vaccinated population, the case fatality rate of COVID is not actually remarkably different from that of influenza, once you've got a vaccinated population?
Well, we are actually still seeing hospitalisations and deaths in people who are doubly vaccinated. The reason we're delivering boosters in all 4 health services is because that immunity is waning. What we're concerned about with Omicron is if it is able to immune escape, it could push us backwards. And therefore, we simply don't want it to become re-established and undermine the achievement that vaccines have made. And things like masks and hand washing, which were reviewed in the British Medical Journal that the member for South West Wiltshire referred to, it showed that masks had as big an impact as hand hygiene. So surely we should be doing both. And both of them have no major economic impact. You're not talking about locking down, you're not talking about shutting businesses, you're actually talking about everyone trying to protect everyone else, actually so that they can continue to be active and continue to be out in society. Now, it's important to remember that even if our current vaccines were shown to be less effective against Omicron, that doesn't mean they would have no impact. And it's important to realise that we already see that impact on Delta with regards spread, where actually the reduction is only about 50%, but it has markedly reduced hospitalisation and death. And we therefore would be still hoping for that with Omicron. So pushing vaccination, encouraging people to get boosted remains as important as it always was. And Delta is still by far the most dominant variant circulating in the UK. There's no evidence as yet of differing symptoms or severity, but one of the weaknesses of the data we have from South Africa is the initial outbreaks were in students, and therefore young people already tend to get milder infections, and we don't yet know what Omicron will be like in an older or more vulnerable population. We do have one advantage in its diagnosis, and that's that the S gene, which is one of the 3 genes that's looked for in common PCR tests, is missing in Omicron. And that means rather than having to wait for genomic testing, which takes quite a long time, you get a heads up or an early warning on that PCR test that you've got this subgroup with S gene dropout, which means the chances are it could be Omicron. These patients could be warned. These samples can then be sent for full genomic testing. In Scotland, it's a retrospective review of recent PCR results looking for S gene dropout that's identified the 9 patients in Scotland. And I assume similar work is happening in the other nations across the UK. In contact tracing of the 9, there's no evidence of connection either to COP26 or even the South African rugby game. But of course, tracking continues. This does mean that PCR testing is even more important. Lateral flow tests, which we're all doing, hopefully, on a regular basis before coming here, of course can't detect variants. It's a simple yes-no that you do yourself. There's no access to take further analysis. And of course, lateral flow tests had been allowed as part of the travel testing. In the Netherlands, they tested 600 passengers arriving from South Africa and found 1 in 10 had COVID. Now, that's an incredibly high incidence, much higher than what we have anywhere in the UK. And 1/5 of those were already Omicron. So Omicron is not just in Southern Africa, it's not just in the UK. Because of the use of lateral flow tests, it's probably already more widespread than we think. I therefore welcome that the government has returned to day 2 PCR testing rather than lateral flow for travellers and is quickly re-establishing quarantine. But they should have a PCR test before they travel. It's rather, shutting the stable door if you find someone's positive when they've just spent 8 hours on a plane with hundreds of other people. I'm happy to.
I thank the Honourable Lady for making way. Is she not concerned, as I am, that there is too much emphasis on PCR testing for tracking variants of concern? During a 3-week period in July, there were 500,000 PCR tests, 7,000 tested positive for COVID. Only 5% of those 7,000 were tested for variants of concern. So it's not quite the silver bullet on variants of concerns that she might hope it would be.
Well, I wasn't claiming it was, because genomic testing takes a couple of weeks, generally, and therefore, actually, you're too late to isolate. What I'm saying is that in this variant, as in Alpha, but not in Delta, there is this missing S gene, which means that on that initial test, which is taking 6 hours or the next day or whatever it is, you're already getting a heads up that you're dealing with a case of Omicron. You then can go on and do the genomic analysis, but you're already able to reply to that patient and say, we think you have this variant. You need to isolate thoroughly, and you need to isolate longer. I will.
I thank the Honourable Lady for bringing her medical knowledge to the House. It's very, very interesting, particularly on the SG gene. I don't know what magic goes on within a lateral flow test. We put the drips on one end and one band hopefully appears and not 2. Could a lateral flow test be adapted to be specific for this type of variant?
I think you'd be talking about redesigning for a whole new antigen. It's actually just one of the advantages that we get from PCR. PCR is looking at genes. That's basically what it's doing. I'm not going to talk about the whole big long name of what PCR stands for, but you are looking at genes, and we're given this little advantage that is a benefit to us that we already get that heads up. I don't think it is feasible in any reasonable timescale to change lateral flow tests. So I think we're lucky that this one has S gene dropout and we will get an early warning. But one of the issues about only focusing on a day 2 PCR and that if you are negative you're then released, unlike what's being discussed for domestic isolation, is that the incubation period of COVID generally is much longer than 2 days. It has generally been reported as an average of 5 days and can extend up to longer than that. So that there's a real danger that if you have arrived in the UK and you may have had contact, you get a negative PCR day 2 and you go about your business, but actually it's false reassurance. And that's why the Scottish and Welsh governments have asked for a COBRA meeting to debate the evidence that is there on a 4-nation basis and discuss about having at least 8-day isolation for travellers with a day 8 test being negative required before people could release. And the Prime Minister should listen to that, Because one of the issues we had in Scotland when we tried to maintain stricter and broader hotel quarantine is the majority of long-haul passengers arrive through hubs such as Heathrow. And therefore the devolved nations have no ability to impact on that. And we should be looking at trying, indeed working with the Republic of Ireland, to have the whole common travel area safer from the point of view of how we move about inside it.
Thank you very much to the member from Central Ayrshire. Just before she finishes, I'd just like to ask from this side, which obviously isn't as sparsely populated as the opposition benches, which I do welcome those that are here. But I presume, in speaking on behalf of the Scottish Nationalist Party, and considering what's happening later today, I presume your party is going to be, sorry, the SNP are going to be supporting the government when that vote comes forward at the end of this debate.
Well, this debate, and this is the reason why my colleagues are not here, this debate is largely about the regulations within England, and therefore, we don't normally vote on English matters. We haven't normally voted on your COVID regulations. But the one aspect is this around testing and isolation of travellers. So we support it. We just think it should go further. Now, with regards to domestic precautions, Scotland never got rid of mandatory masks. Basically on public transport, in shops and in schools. And what we haven't heard the Minister refer to is, are they planning to reintroduce mask wearing in schools? Because at the moment, with vaccination and its impact, what we're seeing is that the bulge and peak of cases is moving down and is in younger and younger teenagers and primary school children among those who are unvaccinated. So if it's not masks in schools, I would come back to, is there a plan to install CO2 monitoring? Is there a plan to install ventilation? How do we actually reduce the incidence in schools? I'm happy to give way.
She maybe just answered some of the question, but I just wonder if she might set out what her assessment of the impact of mask wearing in Scotland on case numbers. And is the case of the younger children, is it not just testament to how well we've done at keeping them apart and proof that we cannot hide from the virus when we do come back together?
Well, at the moment, it's very difficult. Cases go up and down and we swap positions. At the moment, Scotland has the lowest incidence at 349 per 100,000. Northern Ireland has the highest at well over 600 per 100,000. But obviously, we have whole baskets of measures. So it is harder, other than in the review that the Royal Society published last June and in the BMJ paper of just a week ago, to pick out exactly which measures are having the impact. The BMJ found masks and hand hygiene were equal in their impact and actually bigger in their impact than physical distancing. And therefore, to me, they enable people to engage and they enable people who are vulnerable to feel safe and come out, because otherwise those who were shielding are going to be stuck in their houses all over again. And while mask wearing wasn't mandatory in England, it still remained in the guidance of this government if in a busy public space. And I'm sorry, I have to say that that guidance has been undermined by the demonstration on television every day of members on the government benches. Initially, when we came back in the autumn, there were approximately 5 people who wore masks. Then it more than doubled to 14. And after it was being pushed, is about 2/3. But that means about 1/3 of members of the government on the day when mask wearing in busy places is actually meant to be promoted are still not wearing masks. And people will be led by example, not just the Prime Ministers, but every other. I've given away a lot, and there's lots of other people who are waiting to speak. And as for the nonsensical claim by the Leader of the House that you cannot catch COVID from your friends, I have to say words fail me. And that, as you can well believe, is not a common occurrence. It is clear that actually the commonest spread is within households. So if the Leader of the House thinks that husbands and wives and children are not friendly with each other, I really worry about his home circumstances. Now, it is early days, but we should be following a precautionary approach. As Dr. Ryan of the WHO has always said, go early and go hard. In the last 3 waves, the government often delayed making decisions until the problem was proven. I welcome the changes they are making to try and be ahead of the curve this time. But as well as masks, they should advise those who can easily work from home to do so. They should be promoting the hands-face space again to push that to people who've maybe got a little bit complacent. And they should be looking at how to support the installation and improvement of ventilation. COVID is airborne. If you remember before the smoking ban, how smoke used to hang in a pub. If any of you ever worked in pubs, as I did as a student, that was still hanging there the next morning. That is the issue around poorly ventilated spaces. And we've seen it in this House in the outbreaks associated with committee rooms. And just finally, to finish, Mr. Speaker, the arrival of such a variant was inevitable. Basically, last spring, we heard warm words about a global response to a global crisis. But while over 85% of adults in the UK have been doubly vaccinated, it's less than 4% of those in low-income countries, including many who have not been able to vaccinate their healthcare workers. Okay, briefly.
Thank you for giving way. The evolution of an immune escape variant, which maybe Omicron is, does that occur because of a vaccinated immune population or because of a naive population?
Well, I think its emergence in southern Africa would suggest that it is from a naive population. But one of the issues around our complacency and reliance on vaccination here, while allowing very high case numbers, is using Darwinism, you can actually be pre-selecting for vaccine-resistant variants and mutations, because those are the ones that will get a grip. The ones that are vaccine susceptible will not, because we are so vaccinated. So actually allowing high spread, which means common mutations, is a problem wherever it is. But in the naive populations in the global south, there is a real danger. They don't have testing, they don't have the materials, they don't have genomics, and they don't have vaccine. And therefore the danger is you get a variant that's building up and then eventually will come to Europe, will come to the UK. And sending occasional batches that are almost out of date, as we heard reported recently to the APPG on coronavirus, doesn't allow governments in the global south to prepare and use those vaccines within their date. The UK is still among the countries blocking a TRIPS waiver. And we must realise it's not just a matter of sharing some leftover doses. We need to massively increase global production. And that means sharing intellectual property, sharing technological expertise. Because if anything, this variant should be a reminder that no one is safe until everyone is safe.
Steve Brine.
Thanks very much, Mr. Deputy Speaker. Well, 'tis the season to be jolly, Mr. Deputy Speaker, but as my colleagues and yourself know, I am always jolly, but it is not particularly jolly at the moment. It is. I didn't hear it, and I shall pretend I didn't. It's always a pleasure to follow the lady from Central Ayrshire, who I remember shadowing me well when I was in the Health Minister's seat, and she makes very many good points, as always. Her point about vaccinating the rest of the world is absolutely right, and I agree with her completely, but we certainly shouldn't throw away IP property, because that will leave absolutely no incentive for us to produce what we have produced in this country, which is what has saved so many lives around the world. But she's absolutely right. We should be doing more through our overseas aid efforts to help the rest of the world. Could I just start by saying, Mr. Deputy Speaker, that I think it was bad enough when the Coronavirus Act extension was nodded through without a vote. There's been lots of excitement and flurry recently about members of Parliament and the work that we do. The fact that there is one Labour backbencher in the House, there is one Liberal Democrat, albeit 1/12 of the parliamentary party, and a DUP member, and I understand why the SNP are not here in force, because they rightly don't vote on these English matters. I think this is something the public should be concerned about, because we are impacting on their lives today, and it is a disgrace that this House is so empty. Is anybody, other than the Minister, going to speak in favour of these regulations today? The thing is, Mr. Deputy Speaker, is that in the House of Commons, in my experience, and I've been here 11 and a half years now, you don't just have to win the the vote, you have to win the argument as well. And yes, of course, the government are going to win the vote today, because the opposition, who always say, how high do you want us to jump when the government propose new restrictions on our lives, and pretend to ask difficult questions while just voting for them anyway, and they'd said they were going to vote for them before they'd even seen these regulations published today. Frankly, I think that is a derogation of duty for Her Majesty's opposition. OK, now I'll try and be nice. So listen, I know Jenny Harries well, and I worked with Jenny Harries when I was a health minister from the UK HSA. I'm sorry to return to this, Mr Deputy Speaker, but for the benefit of the ministers on the bench, she did say on the media this morning that the people should not socialise, quotes, when we don't particularly need to. She also urged people to decrease social contacts. Now, I understand that Downing Street have had to dismiss and distance themselves from those comments this morning. Rightly so. Jenny Harries is a very careful and very professional public servant. As I say, I know her well. She doesn't just say things on the cuff without thinking. So if that is not the government's position, and I understand the minister is quite right to say, I would have said it myself. She cannot speak for others and she can't comment on what others say. But she can say what she thinks and what the government's position is, which is the duty of the minister at the box. If the government doesn't agree with that position, then it should have been said at the box this afternoon, and ample opportunity was given for it to be said. So, look, the fact is, if that's the policy of the government, then we are in completely different territory, and the regulations that we're debating before us here today, I don't even know where to start with them, because they're the fly on the back of the rhinoceros. So, the isolation regulations that we're looking at today and the face mask regulations. Let me just start with the face coverings, number 1340, which does expire on the 20th of December. I mean, I have to say, I don't much like it. I think it goes against the individual choice that the Right Honourable Gentleman from Moultrie and Sale West talked about. But, I mean, it isn't a huge imposition on my life to wear a mask when I'm in the chamber, and I choose to do so. It isn't a huge imposition on my constituents' lives, many of whom I see wearing masks in all sorts of settings, including outside. That's their personal choice. If I'm honest, that regulation doesn't bother me greatly. The isolation regulations, numbers 1338, that bothers me a great deal more. Because, you see, if we're talking about, let's say, a class of 30, if one child in that class of 30 is suspected of or confirmed as having the Omicron variant, this is section 2, A. I know, how are the public meant to follow this? If one child in that class of 30 is suspected of being a close contact, then presumably the other 29 are out. Yeah. We're not just looking at a pingdemic in our economy and in our businesses, we're looking at a pingdemic that's going to devastate education again, Mr Deputy Speaker. And after everything that we've learnt, and I've felt in my own family, after everything that we've learnt, are we really, seriously going to do that to our children again? And I will give way.
Thank you. I'm grateful to him for giving, my honourable friend, for giving way. On the face of the explanatory memorandum to these regulations, it tells us that it gives provision to NHS test and trace to notify individuals that they're a close contact. In actual fact, when you get into the detail of the legislation, it doesn't just give that provision to NHS test and trace, but also to anyone in a local authority involved in communicable diseases. Now, one of my own children was sent home before the school holidays, was confirmed by the head teacher as not a close contact, but was sent home to isolate for 10 days, which had significant impact on the rest of the family, as you might imagine, based on the advice of a Director of Public Health that the whole year group should isolate. And does he share my concern that this is locked down by default through activist Directors of Public Health and others?
I don't think I would call DPHs activists, although I understand that some of them play it very differently to us. At the end of the day, what I would say to my honourable friend, through you, Mr Deputy Speaker, is that it is the job of this place to get legislation and regulations right. And if we draft them as such that they are so wide and so loose and so flexible that any Director of Public Health could be activist, if they were so minded, then that lays at this door, not at that door. So I would ask the Minister, in the summing up, to define suspected case. Because, frankly, I think there's an element of the Salem witch trials about this. What is a suspected case? I would like an answer at the box before I'm asked to vote for this, please. I said yesterday in the House that these regulations, in and of themselves, are relatively mild. The face coverings, I've talked about that. My concern is the chilling effect that is having on the rest of our society. The fact that we have got number 10 Downing Street, the centre of government in this country, taking to the national newspapers today to ask head teachers not to cancel nativity plays because of the announcement that we made on Saturday night. What on earth are we doing, Mr. Deputy Speaker? The effect that this is having on confidence, on society, on hospitality, who have put, in a moment, hospitality have put everything into this Christmas to survive, to save their year. Now, there's nothing in these regulations that says you've got to cancel Christmas parties, unless Dr. Harry's, of course, is in charge. But there's everything in the language and the narrative that's coming out of government right now that is causing Christmas parties to be cancelled left, right and centre. And I've seen organisations in my constituency cancel events that were due to happen within the next few weeks on a just-in-case basis. So it's a chilling effect of these regulations, and we shouldn't underestimate that just because it's not written in black and white and give way.
I'm most grateful to my honourable friend. And does my honourable friend share my concern of the fact that the business sector should have been involved in these decisions? I've had several emails from travel companies in my constituency who have seen their potential bookings drop off a cliff because of the PCR testing, the cost attached to that. And my honourable friend's comments of the chilling effect goes deeper than what he's saying. It's actually got a huge business impact as well. And if these are being brought forward, it's got to be hand in hand with the Chancellor and the Business Department, surely.
Well, look, I mean, having been a Minister of the Crown, I know, and obviously these regulations will have been, you would hope, have been through the right round process, albeit an accelerated right round process. But my honourable friend is absolutely right. The travel industry will be concerned that the regulations that haven't been moved today are not being debated in this House. And yes, I am greatly concerned. And I have to say that I do agree with the opposition on departure testing, because I think that other countries, Netherlands, for instance, have done that. And I think that I don't think that the opposition have had an answer, actually, from the government, from the Treasury bench, about why they've chosen to not do that. And I'd like to hear that in wind-ups too.
Just before we move on, I'm very grateful. You touched on an important point there about the process within government to make sure all aspects are considered. And what normally happens is regulations are thought about, there's a right round process which, for the benefit of those listening to the debate, means all government departments have the opportunity to input. One of the things we discovered on COVID regulations was that right round process does not operate in the normal way. So one thing through him I would ask the Minister to clarify in the wind-ups is, as these regulations were being drafted, were other government departments consulted and have the usual opportunity to input, or was it purely done in the Department of Health and number 10 Downing Street?
Yeah, and I thank my right honourable friend from the Forest of Dean for that, and that will have been heard on the Treasury bench. Just a couple other points, Mr Deputy Speaker. I don't understand the timing here. What will we really know in 3 weeks' time that we don't know now? And that then calls me into question the 3-week rule. South Africa does not give us the insight into the progress of the virus under this variant that we were able to take, say, from Italy, with a broadly similar European population, this time last year. It is a much, much younger population. It is, sadly, a greatly under-vaccinated population. And as the lady speaking for the SNP said, it was spreading like wildfire among students who, of course, are younger and fitter and therefore less susceptible to serious illness from this variant. So last time to the gentleman from the DUP.
Giving way has been generous. And would you accept that the evidence from South Africa so far is that there have been very few hospitalisations as a result of this, yet we're introducing regulations in the United Kingdom which are causing economic disruption, which are causing people to further anxiety, and which in fact are going to disrupt all of Christmas for a variant which we don't even know whether it's going to have a severe impact on the UK anyhow.
I would accept that, but I would also accept that the scientist that discovered this variant and has said on the media this weekend that it often is a less serious disease than Delta variant. But I think notwithstanding the point I just made about the people that it has infected in South Africa, younger, unvaccinated, it's not... My point being is that given that numbers are so small in this country, I fail to see, and maybe the Minister can illuminate me through an intervention now or a wind-up, I fail to see how in 3 weeks' time we will be any the wiser, and maybe that explains why the isolation regulations go through until next March. So I am concerned about that, Mr Deputy Speaker. And then finally, I just wanted to return to my Winchester constituency, and I've raised this in the House now twice, is that I spoke to the City PCN, Primary Care Network in Winchester this morning, which is responsible for some 62,000 people on roll. If you are a patient within the Winchester City PCN, then you will have been contacted as one of the JCVI groups 1 to 9, or anybody who is clinically extremely vulnerable, and you will have been offered a booster. And they expect that to be complete by December the 17th. As for all over 50s as well by December 17th. Once we then move beyond that through until the middle of January, they will then start to offer others, and then from mid-January onwards will be the 18 plus will be offered the booster that was announced by the Secretary of State, very welcome, yesterday during his statement. Lots of my constituents don't live within Winchester City Primary Care Network, and they are able to access through what's the Badger Farm Vaccination Centre. They are being offered, if they go on to the NHS website, to go to Salisbury, to go to Portsmouth, to go to Southampton. This is not easy access for the booster, Mr Deputy Speaker. There is no easy walk-in access for the booster programme in my constituency, and I am inundated with constituents asking that there is why they cannot easily access the booster in Winchester today. The difference between what's being said on the television and by ministers from the box and the reality of what they're able to access at the front line is growing and is a problem, and the Minister has very kindly, because I know she's looking into this for me, and we haven't teed this up, Mr Deputy Speaker, but is kindly going to intervene on the subject.
Thank you, Mr Speaker. I would like to reassure the honourable gentleman that I heard what he had to say yesterday, and I've already asked my office to look into this further for him, and as soon as I can, I'll get back to him on the matter.
And I greatly appreciate my honourable friend, the Minister, for doing that, because I know she's a good friend, and I know that she is sincere in doing that. And I've sent her correspondence this morning between myself and the head of the new ICS across Hampshire, where we're trying to move this forward. So if boosterism works in the sense of COVID-19 and this variant, which is where it probably does work, then all to the good. But let's get those boosters and let's make it easy for people to get those boosters. So, in conclusion, Mr Deputy Speaker, I'm ambivalent about the face coverings regulations today, but the isolation regulations concern me greatly, both in the timing, the conclusion of them, the chilling effect that they have, and unless I hear a very good answer on defining suspected, I won't be supporting them tonight. Thank you.
Daisy Cooper.
Thank you, Mr Deputy Speaker. The Liberal Democrats will support these regulations, but we have got very grave concerns that the government is not doing enough to protect people, to protect the NHS, and to buy scientists the time that they need to learn more about this new variant. We know that masks are effective. We know that they reduce transmission, and they are a small price to pay to guarantee all of our other freedoms. They also allow for the clinically extremely vulnerable to leave their homes, because many of them haven't left their homes for a very long time, and they continue to shield, cut off from society because they do not have the confidence to even go into a shop or onto a bus. I am worried about the Secretary of State's pledge that he will abandon masks in a few weeks' time if Omicron proves to be no more dangerous than the Delta variant, because the Delta variant is still dangerous, and the NHS is already on its knees before we go into the worst of this winter. I do support, I wish there was more support for those in self-isolation. We know that for too long, the support has been too stingy and too hard to access. We must create this sense that if you are asked to self-isolate, it is your civic duty to do so. And if you are asked to self-isolate by the government, then the government must step up and provide proper financial support. I'd also like to see the reintroduction of a working from home, if you can, encouragement from this government. And ventilation. Other colleagues have mentioned ventilation. The government has been far too slow. In schools right across England, people have been crying out for ventilation for months and months and months, and the government has been dragging its heels. It has still failed. I think honourable colleague wants to intervene.
Grateful to the honourable lady, and just to pick up on her comment about working from home, and I do say this gently to the honourable lady, great many of my constituents have businesses which thrive on the footfall in the city centre of Leeds. And the working from home encouragement actually has a devastating impact on their ability to earn a living. And so I just, in terms of people just saying, let's just work from home again, I just want to recognise that there is actually a very large economic impact to a great number of my constituents if that was to happen.
Thank you, Mr Deputy Speaker. I take that point. There are many of these measures are often lose-lose, and we know that. One of the things that I think has been a real problem over the last 18 months is the way that people have tried to frame it as public health versus the economy, because actually public health and having a strong workforce and a healthy workforce and the economy, for me, are two sides of the same coin. Notwithstanding that, what I'm encouraging is for the government to say work from home where you can and to get that right balance, because that would reduce levels of transmission, not a blanket mandatory everybody stay at home, but encouraging working from home where people can in a balanced way. I will.
I'm grateful to the honourable member, listening very carefully to what she has to say. Would she agree with me that the group in society that's really borne the brunt of the past 18 months are young people, and they have been particularly affected by so-called work from home, and their mental health in particular, which I know her party takes a very close interest in many cases has been devastated. Can I commend to the honourable lady best available evidence as published last week, which suggests, as the honourable lady, the member for Central Ayrshire, pointed out, that two interventions, that's to say mask wearing and cleaning your hands properly, may well have some impact on this. But to be honest, the evidence for social distancing is pretty thin, and therefore would she like to perhaps reconsider the sort of swinging measures that she appears to be recommending? Be liberal.
I thank the honourable member for his intervention, and I will respectfully disagree. I think what we've learnt over the last few months from public health directors in particular is the more measures you take, the greater protection you have. It's not either or. If you have a mask, and if you wash your hands, and if you limit the amount of time that you spend in close proximity to somebody else, then you limit your overall chances of either catching COVID or passing it on. And the more measures you can take, the better. Notwithstanding that, when I was talking about working from home, I was not referring to children studying at home. I was talking about those who have the working population. I do recognise that there has been enormous impacts. Sorry? Oh, you about university students? Okay. I thought you were mentioning schools and young people. Anyway, the point of it is, on young people, yes, of course, there have been major issues. But when I'm talking about working from home, I'm talking about the working population. If he wishes to talk about students at universities, then of course there needs to be a balance. And I think that many universities got it wrong during the pandemic, and I said so at the time. I was utterly appalled when some universities put railings around some student accommodation. But actually what we need is to have a balance. It's about reducing your contracts of transmission. So there's nothing to stop university students from going in to study, if that's the point I believe he's trying to make. I will.
Does she think you can mandate for wards, suggest you're going to work from home, and yet expect students to tip up? The point about university is to be taught. Being taught requires people to go to work. Or have I missed something?
Thank you, Mr Deputy Speaker. I think we appear to be lost in translation here. I'm not entirely sure whether the honourable member is referring to students or to the academics that teach them. What I'm talking about is a work from home where you can. There are, of course, examples where people will need to go into work and they can change the way that they work. But, of course, I do think that is a measure, and it's been proven that it can reduce levels of transmission. Mr Deputy Speaker, I'm very concerned that we're talking solely about the new variant, and the mantra around taking restrictions to protect the NHS appears to have stopped. and I worry that the government appears to have lost its tongue. At the moment, ambulance services across the whole of England are in their highest alert level, level 4, code black. That means there are people in the back of ambulances that cannot get into hospitals. The NHS 111 line has had more than 1 million calls abandoned so far this year after 30 seconds, when they should be answered within 20. We have GPs who are reducing their hours or resigning because of the workload and the abuse. And some of them are now saying that they are really worried that they may not take on the extra contracts to deliver the booster jabs. And I hope the Minister might respond to this point. But some GPs are saying that they will not take on the contracts to deliver the booster jabs because the expectation is that they will still have to do the same amount of work in terms of seeing their patients. And if they are required to do the booster jabs, there will be longer waits for other appointments, and they are not getting the support they need in that regard. We have record backlogs, Mr Deputy Speaker, and I will on that point.
Mr Deputy Speaker, I'm very grateful to the Honourable Lady. Can I just say how much I agree with her comments, and actually wish that she'd amplified them more with regards to the ambulance service. Representing a large rural constituency like North Dorset, as many colleagues do, the wait for people for an ambulance because of those queuing at the acute sector because they can't discharge is going to lead to a huge amount of problems during these winter months. And that's something we should also keep at the forefront of our minds. Yeah.
Thank you. I'm incredibly grateful to the Honourable Member for raising that point. It is an issue that I have been trying to raise as often as I can in this House through various means, and I believe that's probably all I can say on the matter. I had tabled a written question back in October to the Government to say how many ambulance services were in code level 4. It took me a couple of attempts of chasing that before I got a response, and I believe that Honourable Members would benefit from having time in this House to debate that issue. I know that in my own constituency of St Albans, there have been some incredibly tragic cases. A woman in particular who lost her baby because she was stuck in the back of an ambulance for many hours without being able to get into the local hospital. Another constituent who lost their partner because they were stuck in the back of an ambulance for 12 hours and then died a week later because they couldn't get that emergency treatment.
The Honourable Lady, important as this matter is, does seem to be straying, so I think if she could please get back to the regulations that we're discussing at this moment.
Thank you, Mr Deputy Speaker. The point that I'm trying to make is that the Government is framing the introduction of these specific restrictions in terms of whether or not there is extra transmissibility from the new variant. My concern is the Government is not talking about whether we need these restrictions and perhaps others in the future because of the pressures on the NHS in its broadest sense.
And she's making a very important and very relevant point. But would she not accept that these restrictions place a burden on businesses, on people's individual freedom, and on the operation of the education system, etc., all to deal with a problem which is not going to go away as long as you have GPs who are not seeing patients so they go to accident emergency, as long as you have patients stuck in hospitals not going into care and therefore taking up beds. So this will not be solved by simply introducing more regulations, putting the burden on private industry for the failures of the health service.
Thank you, Mr Deputy Speaker. I disagree with some of those points. I mean, as a Liberal, I believe fundamentally in giving people the absolute most personal freedom they can have until the point at which it interferes with the personal freedom of others. And whilst we hear a lot in this House, particularly from opposition benches, on personal freedom, there is very little discussion about our broader responsibilities to others. And that is the challenge that we have as legislators in this House. It is about getting the balance. And I do not think it's about putting restrictions on just on business because of the failures of our health service. What we are seeing is that GPs in particular are struggling with their workloads. They're struggling with the abuse because of campaigns being led by national newspapers against them. And if we had a stronger workforce to deal with these issues, if the NHS hadn't been run into the ground, then we would have more frontline health workers able to deal with these problems right now. But I'm mindful of the entreatments from the Deputy Speaker to stick to these particular regulations, to which I want to return. Mr Deputy Speaker, as I said at the start, we will support these regulations. I agree it's vitally important, as other members of this House have said, that we have full scrutiny of any decision to repeal them, extend them or renew them in any shape or form in the coming weeks. But I do implore the government to take action and look at these restrictions, not only in the light of this new variant, but in terms of the overall pressures that we have across our NHS, whether it's GPs or ambulance services or more. Thank you, Mr Deputy Speaker.
Mr Cho.
Mr Deputy Speaker, it's a pleasure to follow the Honourable Lady. I agree with her absolutely when she says that she wants to maximise personal freedom. Unfortunately, most of her speech seemed to be talking about quite the reverse. So I don't really understand the lack of consistency, or perhaps I do, because I've been familiar with the Liberal Democrats over so many years. But can I say that I think the Honourable Lady there's a fundamental fallacy in her argument about masks, which is brought out in paragraph 7.4 of the explanatory memorandum, because there it says, evidence demonstrates that face coverings are effective when worn correctly at reducing virus transmission. And Mr Deputy Speaker, very few people do wear their face masks correctly. If one looks at the World Health Organization advice, it is that as soon as you take off your face mask, you should wash your hands and you should discard your face mask if it is of temporary nature, and that you should wash your hands again when you're putting on a fresh face mask. And I was having a discussion actually with Mr Speaker on this subject some months ago now, and while we were having this discussion, one of our colleagues came into the tea room wearing a mask, took it off and put it on the breakfast table. And I said to Mr Speaker that really makes my point. And frankly, if we're talking about public hygiene and public health, then first of all, the government should be saying, if you think you want to wear a mask, then go and wear a mask, but for crying out loud, make sure that you don't contaminate yourself and others by not wearing it correctly. Mr Deputy Speaker, I cannot support these oppressive, authoritarian and dictatorial regulations. They're neither necessary nor desirable. They will have an adverse effect upon lives, livelihoods and the mental health of our constituents. The Secretary of State considers that the requirements imposed by the regulations are proportionate to what they seek to achieve, which is a public health response to the threat. But where is the evidence? My honourable friend, the Minister, adduced no evidence whatsoever. There is no regulatory impact assessment, the excuse being given that these regulations will be in force for less than a year. Why is there no regulatory impact assessment? Why are we being asked to support a policy for which there is no evidence? If there was a regulatory impact assessment, then there would have to be a requirement upon the government under the regulation rules of the Cabinet Office to put forward what possible alternative solutions there were to the regulatory proposals being put forward. Because we need goal-setting requirements, in my view, rather than prescription. And it's just prescription, and more prescription, which seems to be the government's recipe. To take an example, why isn't a shopkeeper allowed to permit shopping by people without face coverings, provided those people have had a proper vaccination? Why isn't a shopkeeper allowed to keep the front door open, a small shop, and allow people to go in and out without the need for wearing face coverings, because there's adequate ventilation, perhaps like some of the small shops in my constituency, one in, one out rule, so there's only one person with the shop assistant in there at the moment. Why aren't we allowing the shops to have that freedom? And if we want to have a consistent policy, why are we treating those who have been fully vaccinated in the same way as those who have not been fully vaccinated. It seems to be wholly inconsistent with the regulations brought in by the government in relation to people who work in care homes, and it's proposed to bring in similar restrictions for those working in the health service. But if we're saying that having required those people to be double vaccinated, that they are in no privileged position when it comes to going into the local shop, then what's the point of depriving those who haven't been double vaccinated of their right to work? It doesn't seem to me that there's any consistency there. Of course I give way to the Honourable Lady.
The right honourable member not accept that the major incentive for getting the vaccination is to reduce your own chances of hospitalisation and death, not just so that you can go to the local pub or a shop or anywhere else.
Well, obviously, I hope the Honourable Lady accepts what I say, which is that people should be free to make their own decision as to whether they wish to be vaccinated. And I'm extremely nervous, therefore, about proposals which are almost backdoor proposals to require vaccine passports. Because I don't believe that it should be made conditional upon people's freedom, that they should have to have taken some compulsory medication. And that's why I'm against the bit provisions in the Health and Care Bill dealing with compulsory fluoridation, because I'm not in favour of compulsory medication. So to that extent, I'm probably on the same side of the argument as the Honourable Lady, I think. But so there is a concern that I've got about this. But can I also just, Mr. Deputy Speaker, refer to one other aspect of this, and that is the mood out there, which is of increasing intolerance being engendered towards those who have a reasonable excuse for not wearing a face covering. Paragraph 7.8 of the explanatory memorandum makes it clear that people do not need to show proof of a reasonable excuse, but that's not being promoted by the government. We've got paragraph 5, or section 5 of these regulations says, for the purposes of regulations 3.1 and 4.1, the circumstances in which a person has a reasonable excuse include, and this is the important thing, they include those where a person cannot put on, wear or remove a face covering because of physical or mental illness or impairment or disability, or without causing severe distress, etc., etc. So that is one of the reasonable excuses, but there's a whole lot of other reasonable excuses, and the government seems to be rather conflicted or muddled about this, because in paragraph 7.8 of the explanatory memorandum, they say nobody who has a reasonable excuse and is therefore not wearing a face covering should be prevented from visiting any setting because of the requirements of these regulations. Furthermore, people do not need to show proof of this reasonable excuse under the regulations. So, in other words, people don't have to show that they've got a face covering exemption certificate, perhaps one like this one from Hidden Disabilities. And one sees quite a lot of people wearing these. But as soon as people have to wear those, then people ask them questions. Well, what are your disabilities? And Mr. Deputy Speaker, most of my disabilities are very well hidden, and I intend to keep them hidden. I think it's unreasonable that we should be creating an environment in which people are being challenged and being encouraged to be challenged in relation to their own personal and private health. Which brings me on to the conflicting content in paragraph 12.3 of this explanatory memorandum, because there it says, and it may just be a misprint, Mr. Deputy Speaker, but it says, the department has also included a range of exemptions to ensure that this policy does not unfairly discriminate against those with protected characteristics. Furthermore, the policy will be supported by a communications campaign that will make clear that some people are exempt from these regulations and people should be challenged by members of the public for not wearing a face covering. Surely that should mean should not be challenged for wearing these regulations. I don't understand this, because looking at the end of this explanatory memorandum, the Parliamentary Under-Secretary, paragraph 15.3, it is said that the Parliamentary Under-Secretary, who's on the front bench today, can confirm that this explanatory memorandum meets the required standard. It seems to me that if that is indeed a misprint, then it doesn't meet the required standard. If it isn't a misprint, then it's a serious contradiction within the explanatory memorandum and seriously undermines the freedom of people to go about their business without having impertinent remarks and questions put to them by busybodies acting on behalf of enforcement authorities. Of course I will.
Most grateful to my honourable friend. My honourable friend's been a member of this House far longer than I have. Is there a mechanism where that could be clarified before today's vote?
Well, the mechanism is for the Minister to be able to intervene on me. I'll happily give way to the Minister, and for the Minister to say that it is indeed a misprint or it's a deliberate confusion in order to confuse the punters. And so we can have it both ways. Perhaps that might be the response of a Liberal Democrat, were there a Liberal Democrat on the front bench. But I hope that the Minister will be able to respond to this serious point, because obviously there will be people out there who will be wondering about exemptions and reasonable excuses. And the honourable gentleman, who I think still chairs the Levelling Up Select Committee, in his interventions earlier, he was drawing attention to the fact that young people are going around in shopping centres saying that they've got a reasonable excuse for not complying with the regulations or for not wearing face masks. Well, what's the problem with that? If people have got a reasonable excuse for not wearing face coverings, then let's get too fussed about it. And that's why I think that these regulations are part of a sort of scaremongering propaganda campaign on the part of the government, which is really designed to try and stop social or restrict social interaction between social animals who happen to be living in the United Kingdom. And that, Mr. Deputy Speaker, I think is potentially the most damaging aspect of these regulations before us today. They're designed to suppress freedom of the individual and suppress social contact, and they're doing that through unreasonable fear-mongering.
Merriman. Mr. Deputy Speaker, yesterday when I intervened on the Secretary of State, and indeed, as he mentioned during his statement, he repeated to me that we will not keep measures in place for a day longer than is necessary. And it was with that assurance in mind, Mr. Deputy Speaker, that I thought I would come and listen to this debate, speak on behalf of the transport sector as relates to my Select Committee, and be willing to support these measures as a proportionate measure, a set of measures in circumstances where we do not know if this new variant will have an impact on transmissibility and indeed on our vaccine effectiveness. And so when it comes to the regulations 1340 with regards to face coverings, I can get there with that regard because they expire on the 20th of December. They are well set out. I do have concerns where it comes to the way that the transport sector is somewhat singled out, albeit in this instance with retail as perhaps being an unsafe setting, whereas hospitality is marked differently. And the point I make there is that if we put £10 billion into the rails network alone just to keep it going, then sending out a message that it's a less safe setting than perhaps walking into a pub or restaurant is not really going to be the way to give people confidence to get back on to that network, which we need very much to survive. So I have concerns as far as that goes. And I also have concerns, as I witnessed today on the bus, albeit it may well be because people hadn't tuned into this debate, they didn't realise these regulations already come into force, that people are still getting on board without the face covering, and indeed, despite the powers given to the driver to ensure they don't, there's no questioning, and on they go. And that not only winds people up, it also leaves others thinking, what's the point in them bothering? Because if not everyone is wearing a mask, then what's the purpose of anyone wearing a mask? However, I can get there because of the unknowns that we need to deal with. Where I have grave concerns, and one of the wonderful things about coming into this chamber is to be educated, and I would perhaps make the point that the Honourable Member for Winchester has made, that perhaps more of us can come here and be educated, are the issues around Regulation 1338. Because if the impact is again for us to be covered just for a moment that's no longer no longer than necessary, then why is it that there is no end date to these and they default therefore to the 24th of March? And the impact for this, I'd say, is even greater than having to wear face covering for longer periods of time, because, as has been mentioned, we could well be back to pingdemic territory. Because to just emphasise, this means regardless of the vaccination having been given, one has to self-isolate for the period of time if there is a suspicion that one has been in contact with someone who has the Omicron variant. Right now, and maybe for the period up to the 20th of December, I could understand that the suspicion would perhaps be linked as the transmission rates, one would hope for the next few weeks, are slower to build. You would need to know perhaps if one had been in connection with somebody who'd been in South Africa or something along those lines. If, however, we move forward towards the 24th of March, and this does become the variant that has spread, and it does spread fast, but actually it doesn't have the same negative impact against the vaccine that we hope, then it means that we could see the default option being, well, I've come in contact with somebody else who has COVID. I didn't know if they had Omicron or not, because that doesn't tell me that. But therefore I must be cautious, as we're always told, and therefore I must self-isolate. And then we could see the whole country pinged again in the same way that it has been before. And actually it could be even worse, because if it turns out, as is currently being talked about in South Africa, that this strain, whilst it may transmit quickly, it may not have the same impact, perhaps as even the Delta the Delta variant does, then actually it could be worse to stop people being out and about because they won't get the antibodies that we want. And surely the front bench are aware of this, because when you look at the Beta variant, as it was a variant of concern, regulations were brought in, which were known as the Amber Plus regulations, because there was a concern that Beta would have been worse against the vaccine than the Delta variant. It turned out that one dose of AstraZeneca was more effective against the Beta strain than 2 doses of AstraZeneca against Delta. So very quickly, variants of concern can turn out to not be a concern at all, which is why we must make sure that our legislation acts to then stop and is flexible and is nimble. But what we have here is legislation that will roll on until the 24th of March. And that, for me, Mr. Deputy Speaker, is what our job in this place is. I can agree in principle that there is a need to take measures, but what I can't do is vote for legislation that doesn't actually do what I believe the government intended it to do. So there are options here, and it could be used right now. The Minister could stand at the dispatch box and find a way to reassure those of us with the same concern, or the default option for me is that I will vote against this legislation, not because I disagree with the principle, but I disagree with voting for legislation I know to be poor, I know to be badly drafted, I know not to meet the intention, and surely we shouldn't be stubborn and pig-headed when legislation doesn't work. We should fix it, or we should vote against it. One last point, Mr. Deputy Speaker, relates to a motion that I thought would be here and isn't, and that relates to the restrictions on testing, travel, the introduction of PCR testing. Yesterday, the Secretary of State also reassured me that PCR testing would not be expensive. We would not be at the mercy of unscrupulous providers, as we saw during the summer. A very wise person, Mr. Deputy Speaker, just gave me an instance of a 3-hour PCR test, which many will need to take in order to not self-isolate, which is good for the economy, was costing over £200. So again, why are these regulations not being laid? There's a negative consent motion, as I understand. We need to be discussing that legislation, discussing the pitfalls, finding the pitfalls, as we have done. And I applaud my colleagues for doing so this afternoon. And yet, we're not even bringing them forward at all. I'll give way once, and then I'll sit down.
I'm grateful to my honourable friend, and going back to the point I made earlier on, does he share with me this genuine concern? And as he said, we've come about today because of a variant's been discovered. Well, more variants are going to be discovered. And this cost of the PCR test is going to make people really think carefully about going abroad, and that is going to have a devastating impact on the high street with travel agents and holidays. Does my honourable friend agree with me that this has to be taken in all. It cannot just be separated out, saying every time there's a variant, we've got to shut everything down.
Thank you, Mr. Deputy Speaker. I do agree with that. I think it's a good point for me to end, because looking at not just the consumer, but those that work in aviation, 5,000 jobs have been lost on a monthly basis going back to February 2020. This has been an absolute disaster for the aviation and international travel sector, and for those that want to trade around the world. And we had just started to see the footsteps, the easing of restrictions, with no damage in terms of public health at all. And he's absolutely right. We need to learn lessons from this. It's okay for us to make tentative steps, perhaps this once, for a limited basis, but we cannot keep shutting down parts of the economy every single time there may be a variant of concern. Otherwise, and to quote the Prime Minister, we will never live with this virus.
Craig McKinley.
Speaker. Now, I do understand the dilemma that the government is facing and the dilemma it's in. Because there are two main questions that we need to be asking, and questions we all want to know the answers of, and I'm sure the government as much as anyone. Number one is, does the Omicron variant, what is the state of its resistance to the vaccine programme that we've had? That's number one. And obviously number two, if you become infected, is that illness weaker or worse than the Delta that we've got used to? I mean, in some ways, it doesn't matter what it does with the vaccine, if it doesn't cause bad illness. If it doesn't cause bad illness, then, you know, frankly, I don't care about this thing at all. And I think, as my honourable friend from Bexhill and Battle has just said, a very interesting point. We are potentially making, if as we all hope, that the Omicron variant is actually weaker than the Delta variant in terms of its illness and effect, we're actually going backwards a long way, because we'll all have to lock down when we get that text, email or phone call that we've been close to somebody with this new variant. So that makes little sense at all. But let's just take the proposals in front of us in some order. I mean, as my honourable friend from Winchester, I don't have too many concerns about the face mask. It's an extension of rules that we've pretty much got used to. It's very little different from what I've been doing on public transport. I've been wearing them religiously. But, you know, I still am a little bemused about how a fairly flimsy mask with a sort of filter size that's far greater than the size of a coronavirus can somehow be the salvation. But anyway, so be it. I'm not terribly concerned. But we are left with the gross absurdity. And, Mr. Deputy Speaker, let me give you this absurdity. And it's an absurdity I think perhaps all in this House will face over the next few weeks. When going to the off-licence on the way to a party later, off-licence might only take 45 seconds to get whatever your tipple of choice is, but you'll have to wear a mask on pain of a fine. So you then make your way to a house party of 100 people, perhaps more, perhaps an infinite number of people, where it'll be closed, it'll be warm, it'll be cosy, it'll be friendly. And you can take that same face mask off. I mean, really. This is it's an infantile proposal. And it's in danger of going down the same absurdities that we fell down before, with that madness of the couple who could walk across their golf course, but they dare not play on it. I mean, this is just the absurdity that I voted against before, and I'll vote against again. Now let's move on to the self-isolation requirements. I'm afraid we're going to fall into a new pandemic with these proposals. There's nothing in these regulations, or anything the Minister has said, or anything else I've heard to date, that the testing regime will be backed up with proper genome sequencing at the right rate, so that we can get back to the situation that, no, your contact wasn't Omicron, you're fine. We have this very, very dangerous phrase in here, and it's been picked up by my honourable friend from Winchester. And that phrase is suspected of. Now, I don't know what that means. I know what confirmed as means, because that has to be confirmed as through a proper genome sequence test. But suspected of. Are we now going to have, when you get that phone call or that text or that email or the ping, if you've been daft enough to have it on your phone, from NHS, that just by adding those words, suspected of, thou shalt be held indoors for 10 days. Now, this is where we end up with the mission creep, where we end up with, I think, the chilled effect, I think my honourable friend from Winchester said. I'm going to be somewhat concerned going to that Christmas party, going to that pub, because I've got friends and family around for Christmas Day. This is going to have a dangerous ping-demic effect, either proper ping-demic or just a fear effect. I asked the Honourable Lady, the member for the SNP, who is knowledgeable in these areas, whether we may be able to get a new lateral flow test that is particularly specific to Omicron. I think the answer is possibly no. But no, we're in a confused state. I'm concerned this is going to shatter business that is getting ready for Christmas. But anyway, with obviously the support of opposition parties, these are likely to sadly go through. Now, on travel, I'm somewhat confused, as many other members are, that those regulations are not being considered today. It seems somewhat bizarre. A new PCR test within 2 days. I'm afraid we've seen far too much what I would call Wild West behaviour out there in trying to obtain the test, when we have a well-established, well-working, accurate, fast PCR network that has stood up across this whole country. For instance, I can go onto the NHS website and get a PCR test probably within a mile or two of where I live tonight, and I will get a result back probably tomorrow. It works very well. I mean, that's to the credit of the government. But we went down a stage for good reason, and we said, no, LFT tests for people travelling in are fine. We're back to that confusion. Do lateral flow tests work, or do they not work? If they work, then surely that will do. If they don't work, then why on earth have we spent billions of pounds over these last few months, and why has everybody's drawer and cupboard full of these things that are handed out by like candy on the street if they're not reliable? It's, again, something of a nonsense. So we haven't discussed the regulations yet for the travel restrictions, so perhaps we've got a chance of changing those for the good. We're introducing these new requirements, so I'd say it's only fair that we offer those requirements within the NHS testing PCR system, either for free or at a minimal cost, so that we don't have these situations of what I've described as the Wild West companies that have not served us very well. We're allowing ourselves, sadly, to go back into a rabbit hole again, and I'm concerned that we'll never get out. Mr. Deputy Speaker, last year, before we had the big vaccine rollout, there were reasonable reasons. I didn't support them, but there were reasonable reasons for the levels of restrictions, because we were waiting for the cavalry of the vaccinations. We wanted to protect the NHS from being overloaded. We did that, and it all worked. And we got back to a semblance of normality. But we have a new variant, and we introduce new measures. And then we await a new vaccine formulation, and then we wait another few months to get that into people's arms. And then we might be able to go back to a normality. And then we'll find another new variant, and we'll do it all over again. This has to stop. We have to live with this ever-changing virus. Enough is enough. It's done.
1, 2, 3, 4, 5 people are standing. And this debate, please resume your seats, has to finish at 3:58. Now, we all want the Minister to be given sufficient time to be able to respond to the number of important questions that have been asked during the debate. So can I just ask people to be mindful of the length of the contribution? Mark Harper.
I'm grateful, Mr. Deputy Speaker, and I will endeavour to do so, and I'll try and put some of those questions on the record for the Minister. The first thing I'd say is, as many members have said, COVID is going to be with us forever, as has been agreed by the Chief Scientific Advisor.
And variants are going to be with us forever. And this actually is the first test that we face, the government, the House and society, about how we deal with it in a post-vaccine world, in the world where we have vaccines and where we've vaccinated most of our population. So it's very important, Mr. Deputy Speaker, that we don't mess this up and we don't fail that test. So it seems to me we do need to respond calmly and proportionately. So I am going to give the government some credit for resisting the calls for what would be the very economically damaging measures in Plan B. Working from home, for example, does have significant economic consequences, as we saw from the Treasury's own analysis, and vaccine passports are both illiberal and, as we've seen from the evidence, or I should say lack of evidence from Scotland, ineffective. So they're the worst of all worlds. They're an ineffective and illiberal policy, and we certainly don't want them introduced here. So let me deal with the measures before us. Just before I do, though, I do want to just pick up the point made by the Honourable Lady for St Albans, the Deputy Leader of the Liberal Democrats, about the NHS. She's absolutely right. The NHS is facing significant pressure, but it's not facing pressure from the number of patients in hospital because of COVID. That's around 6% of total bed capacity. The NHS is under enormous pressure dealing with the significant number of patients who are both unable to be treated but also scared away from the National Health Service during the pandemic. And what we've got to be very careful of is that we don't repeat the mistake and scare a whole new set of patients away that the NHS will then take another very significant period to deal with. So, and there's nothing about the measures that she suggested that will deal with those pressures. They'll make it worse. Of course, I'll give way.
I'm grateful. Whilst I recognise the Honourable Member's assertion that it's 6% of patients in hospitals, I would urge him to think about the impact that COVID inpatients have in the hospital setting. So we know that for every one patient that can take out an entire ward because it has to be cleaned. If a staff member catches COVID, then they go off. I have asked the government to produce an assessment and to provide this House with the details of the impact of COVID patients on the availability of beds, staff and elective procedures. I wonder whether he might support me in asking the government again to provide that assessment so we can take an informed decision in this House as to whether these restrictions are necessary and how they may or may not help.
I do support her general call for transparency, but I would say this. My point about the numbers isn't an assertion. It's looking at the data and seeing how many patients are in hospital because of COVID. That information is published. It's not an assertion. It's a fact. And secondly, if Hospital Trust do what my trust does, I mean, it puts patients who are in hospital because of COVID together, and I think it currently has around one ward full of patients. So it clearly has an impact, but it is not the thing that's causing the biggest problem. The biggest problem in my trust is that they've got at least 3 or 4 times the number of patients who aren't able to be discharged because of inadequate social care, and that's the point I've made several times in the House. Now, Mr. Deputy Speaker, mindful of your admonition to be relatively brief, let me touch on the regulations in front of us. On the issue, the regulations about face coverings, they are relatively economically not damaging, but I listened very carefully to the speech, amongst others, from my honourable friend, the member for Altrincham and Sale, and I do agree with him that it is disappointing that we've moved away from a model where the government lays out the evidence and the arguments and allows people to make their own decision. That was a big choice the government made last year, and I'm very disappointed it's moved away from it. The thing I think weighing against that for me, and this was set out very clearly by the chairman of the Transport Committee and my honourable friend, the member for Winchester, a distinguished former public health minister, is that at least those regulations have quite a tight expiry date, and they will expire in 3 weeks' time. So although I don't like the fact that we've moved back to mandating, I think for me, balancing up the pressures, because there's an expiry date, I am prepared on this occasion to not oppose those regulations. I'm not going to support them, but I'm not going to go out of my way to oppose them. I'm afraid to say on the self-isolation regulations, however, I'm much more concerned, as was my honourable friend, the member for Winchester, for this reason. 2 things. First of all, ministers have been clear that these regulations are going to be reviewed in 3 weeks. And I'll press the Minister in a minute on what we might learn in 3 weeks. But these regulations are not time limited. They amend another set of regulations which don't have an expiry date till March next year. And I'm afraid, although the Minister tells me they won't be enforced for a day longer than necessary, she must recognise that particularly the events of the last few weeks and how ministers handled, amongst other things, the standards measures, mean, as I said yesterday, there has been a diminution in trust between backbenchers and ministers. And ministers have got to work hard to, I think, rebuild that trust. And having open-ended statutory instruments that don't expire for many months, when they're telling us that the measures only need to be in place for a few weeks, isn't how you build that trust, I would say respectfully to the Minister. So that's one thing. The second thing is the other point my honourable friend made. The regulations are, if we remember what we're doing here, we're making the law. And I think the law should always be clear and precise and specific so that people know what their legal responsibilities are and what they're not. And I'm afraid the references in here to people who are suspected of having an Omicron variant or confirmed as, with no detail about what that is in the regulations, I'm afraid is simply not good enough. And I did intervene on the Minister, and I was genuinely trying to be helpful to give her the opportunity to set out for the House in her opening remarks, and I hope she now does so in her closing remarks, to set out in detail how the government determines whether someone has the suspected Omicron variant, and also what measures have been taken in terms of the scripts that are used by NHS Test and Trace, the information provided to people they contact, and the training that the staff undergo, and indeed if the app is being changed, to deal with this new regulatory approach. And I'm afraid nothing in the regulations that I have seen gives me any confidence that these matters have been thought through properly. And in fact, despite what the Minister may or may not say at the box, I think the law should be clear on the face of it, and I'm afraid it simply isn't. And I'm afraid on that basis, and on the way these regulations are drafted, I'm afraid I'm going to oppose them. Just a couple more points, Mr Deputy Speaker, mindful of your instructions. When I made the point that I was worried about these regulations may trigger a new pandemic, and that was picked up in a number of publications, in Politico's London Playbook, which is much read in the Westminster Village, a government insider has said, trying to allay concerns about the pandemic, that saying that because people no longer check into restaurants or pubs, they're not going to be contacted by NHS Test and Trace. And contact tracers are really only interested in catching contacts of cases coming into the country on planes. Now, if that's true, I would suggest that the 30-odd million pounds we're spending on Test and Trace isn't terribly useful. So I'd be grateful if the Minister could confirm at the box whether what this government insider has said is the government's policy or not. And it's also been reported in the Financial Times that officials in government, in the Department of Health, are drawing up contingency plans to require masks in many indoor settings with a possible work-from-home order over Christmas. And apparently these are being worked on by officials. Can I ask the Minister to confirm whether officials are working on such contingency plans, if they're working on them under instructions from ministers? If they're not working on them under instructions from ministers, can she, as a minister, instruct them to stop working on such contingency plans and focus on the government's actual policies? And then the final point you'll be pleased to know, Mr Deputy Speaker, is this one, which is the one I made yesterday. Ministers have said they're going to review these measures in 3 weeks' time, as of yesterday. That will be the 20th of December, when this House will have risen for the Christmas recess. And I touched on this in my intervention on the opposition spokesman. If any of these measures are going to be extended, or further measures are going to be brought in, it will be unacceptable for ministers to do it by decree, which is effectively what the Minister at the box did with these two orders. They should be brought forward to this House for a debate in advance of them coming in. And if that means we have to sit in the days running up to Christmas, so be it. Many people in this country work over the Christmas period in many industries serving the public. We are better paid than most of those people, and if that means we have to come here and do our jobs working on behalf of the public to scrutinise the laws that affect their lives, then I, for one, am very happy to do so. And it will be a failure of the responsibilities that ministers have if they don't seek to keep the House sitting or recall it if they wish to take those powers. Ministers are accountable to this House, to our constituents through us, and ministers would be wise never to forget it.
Steve Baker.
Mr Deputy Speaker, I refer to the declarations I've made relating to the COVID recovery group. I'm especially pleased to follow my right honourable friend for Forest of Dean, with whom I agreed. I want to try and elaborate some of the arguments which my right honourable friend for Altrincham and Sale West made, and also my honourable friend for Winchester, I thought, made a particularly brilliant speech. My starting point is that today's debate is not really about the incremental inconvenience of mandating face masks. I chose to wear one on the train repeatedly when it wasn't mandatory. That really is not the point today. As my right honourable friend for Altrincham and Sale West said, or as he implied, and as I would say, the issue here today is that we are taking away the public's right to choose what they do based on flimsy and uncertain evidence. We don't know the extent to which this new variant will escape the vaccines. We don't know how harmful it would be. And this, though, goes to the heart of the nature of the society that we are creating. The Honourable Lady for the Liberal Democrats was talking about the harm principle earlier, and I entirely endorse the idea that our liberties should be constrained by the harm that we do. But again, in an intervention, my right honourable friend for Altrincham and Sale West made the point about flu. Now that we have got the case fatality rate down to a comparable level to flu, we should be living with coronavirus like we live with flu. And again, my right honourable friend made the point, are we going to manage other diseases like this? The point that really I want to flesh out is this. The government's approach seems to be to say, better safe than sorry. You can't be too careful. The trouble is you can be too careful. You really can be too careful. There is a problem which I would call tunnel vision, which my friend Professor Paul Dolan from the LSE calls situational blindness. We end up looking only at the disease. We've already heard brilliantly set out by my honourable friend for Winchester the harm that will be done to children. I can't begin to understand what the harm will be to children psychologically of being in masks all the time, what that will be, and you can't go back and repeat the experience of a nativity play missed, and so on and so on. The economic cost of the coming pandemic will be, I think, huge. And we only saw on the front page of the Telegraph today, fleshed out in the business section, the problems that Virgin Atlantic will have. This is the problem. If the government keeps going down this path in these circumstances where, as my right honourable friend from Forest of Dean said, the disease is going to be endemic and we have to learn to live with it. If we panic every time there's a new variant, when there will be new variant after new variant, we are going to make entire sections of our society uninvestable. Things like airlines and hospitality and tourism, many of the things which give us joy, which give us hope, which give us something to look forward to. And that is a key point. Where's the hope from the government? I know young people who are demoralised and depressed and have been telling me that we would go back into lockdown, and I've been saying no because the vaccines are working, and I don't believe that Conservative ministers will do this to us. But now we've already started to see the scope creep, the mission creep, the goalposts perhaps being slightly unshackled from the ground, ready to be moved. So in this situation that we face, in today's debate, it's not really about face coverings. To me, it's not really about this issue of the coming pandemic through the self-isolation. It's about how we react and the kind of nation and civilization that we are creating in the context of this new disease. I mean, really, what is the relationship between the state and the individual? Are we to be empty vessels, mere automata, things to be managed as if a problem? Or are we free spirits with, for want of a better term, a soul? Yeah, free spirits with a soul. People who deserve the dignity of choice and the meaning in our lives which comes from taking responsibility. It's possible that meaning in our lives comes from little else. This is a fundamental choice, I would say, between heading towards heaven and heading towards hell. If we continue to react to these fears and uncertainties by taking the authoritarian course without impact assessments, because they're only temporary, you know, then we are embarked on that downward course. Well, Mr. Deputy Speaker, even loneliness shortens lives. Again, Paul Dolan's very clear with me. Loneliness cuts short lives, and yet we find an official going beyond government policy to say we shouldn't have unnecessary socialisation. It's the most extraordinary set of choices that are being taken because of this overwhelming, narrow focus on the one issue of the coronavirus. It falls upon ministers to provide the lead and the breadth of thinking and the vision and the values to set out what broad kind of society we are trying to create. Where are we going as a society and a civilization? Where will be our redemption and our salvation? How will we provide that hope for our future? I believe it will be by having faith in one another, that the public are not fools. We're not here to govern idiots. I have faith in the British public. I have faith that they can choose for themselves to do the right thing, to wear a mask when it's sensible, to pay attention to the level of cases, to choose for themselves whether or not they go to a restaurant, and so on and so on. Indeed, to choose whether they go and visit vulnerable relations in care homes. There's a sad story I could tell about that. Absolutely. But I do just need to put on the record, before I finish with my final thought, just one constituent case, because I've got a 75-year-old constituent stranded in South Africa, with flights out of the country cancelled. He's got a pre-existing anxiety disorder, and in a matter of days he's going to run out of medication. He's struggling to find accommodation, and he now has to find a local source of new prescription medication. Now, if that man is suffering for the greater good, Mr. Deputy Speaker, let my honourable friend the Minister say so. Let her say so. Because actually I think the rights of these individuals really matter. I think justice is about how individuals are treated. And yet, of course, we should care about overall social outcomes. But it really matters what the rights of the individual are and how we treat those people. And that man matters. He shouldn't be stuck in South Africa in the way that he is. He planned to go there to come back, and his plans have been cut short, causing him immense suffering. I believe that there is no plausible path set out before us which leads to a genuine public health emergency, and yet the government is choosing to react in the way that it has. So I think, as a result, the government, I'm afraid, once again, is choosing that downward path towards, frankly, hell. The hell of minute management of our lives by edict, with nothing we can do about it, and not even a say in advance in Parliament. And incredibly, a clear majority of this House is going along with it. Some of us today have got to take a decision to vote no to everything, because I, for one, intend to chart a course towards heaven, and I hope honourable members will come with me.
Dr. Spencer.
Thank you, Mr. Deputy Speaker, and it's always a pleasure to follow such a powerful speech from my honourable friend, the member for Wickham. I think today's debate is fundamentally about uncertainty. Uncertainty over Omicron. It looks spooky. It seems to be outperforming other variants in Africa. Why? Who knows? We don't know if it's going to be more harmful, less harmful. We just don't know. So we are facing the uncertainty around what's the situation going to be with Omicron. But the problem with these restrictions today is also uncertainty. Now, in terms of their direct effect, they are certainly not trivial. They're going to batter the international travel sector, which has already taken an absolute battering over the past 2 years, and yet again have a disproportionate impact on children. When we see the collapse of bubbles at schools because of Omicron, when we see that it's our children who are having to wear face masks, disproportionate high rates in terms of what they do, compared to adults. So yet again, children are going to be the most affected. And sadly, I think this has been the story of the pandemic thus far. But the real harm from these restrictions is the, here we go again. And that's how I felt when the 5 p.m. press conference on a Saturday was announced again. It was in a click of a finger, I was back to 2020. And I think everyone at home, watching, everyone at home, seeing what was happening, was starting to worry. What's going to come next? Here we go. Is this the start of the ratchet again? Moving monotonously, inexorably to higher and increasing restrictions. And it's that chilling effect which my honourable friend, the member for Winchester, said. I think he puts it exactly right. It's that chilling effect that does the most harm and is doing the most harm. Immediately, I started thinking, right, well, you know, should we hold off from ordering the booze in for my 40th birthday party in a couple of weeks? Should we just wait to see what happens? And you know, the stories of countless events that we are already and we anticipate going to be cancelled. Let's hold off from making clear arrangements about seeing our parents for Christmas. Let's just hold off from ordering the goose or the turkey for Christmas. And all of this has an impact and a snowballing impact. And I remember, I think many people remember, when it was just 3 weeks to flatten that curve. Just 3 weeks. And God forbid, heaven forbid, that people at home, because of this chilling effect, are saying to themselves, you know what, actually, that lump I found, let's not bother those GPs. Yeah, they're too busy. Too much to deal with COVID. And I think this is a serious and severe concern. But I would argue that there is a final uncertainty, and one which gives me the most trouble. It's how much we will really know in 3 weeks' time. We know from infection, it takes 3 weeks to get to hospitalisation. From hospitalisation, it takes 3 weeks to get to death. We've only just started finding our domestic Omicron cases. Are we going to know from our domestic data, really in 3 weeks' time, what on earth Omicron is doing, what it looks like, how transmissible it is, and the impact on our NHS? Can we really compare international data to us? We've had a phenomenal vaccine rollout. We celebrate the impact of our vaccine rollout and the booster dose far better than many other nations. Are we really comparable in terms of that, whatever data ends up coming out across the world? So I'm really uncertain that we will know in 3 weeks' time what's going to happen and what our next steps, if anything, should be. Now, in the face of this uncertainty that all of us are feeling, where can we find confidence? And I would argue here. Here is where the public find confidence, because they see us standing here, debating and scrutinising, raising their points, raising their concerns, chewing over to the most minute detail the SIs that have been forward, challenging the Minister on why we are doing what we're doing, having a great debate across the House on these issues. They see this, and they have confidence that whatever we're doing going forwards, whatever impact we're having on people's day-to-day lives, we have scrutinised it. We are here representing them, and we are making sure we make the best possible decisions. And we've got some big decisions to take in 3 weeks. And I do worry about what's going to happen then. Will the data from Omicron be bad? Will it be good? Or will it be not sure? Parliament must be able to debate this, being recalled if necessary, or better yet, not going into recess until we have the data so we know what our next steps should or shouldn't be. And in terms of ending uncertainty for me, I'd be very grateful if the Minister, in her summing up speech, could give certainty that Parliament will have its say, whatever happens in 2 or 3 weeks' time, in terms of response to the Omicron or whatever variant that may pop up between now and then.
Thank you very much indeed, Mr. Deputy Speaker. And I want to develop one point and one point specifically. But before I do, thank you very much. It was a pleasure to follow. It's a pleasure to follow the previous two speakers, and especially I want to thank the members for Wickham and the Forest of Dean for their fantastic leadership on this issue. I believe, Mr. Deputy Speaker, that government must take a balanced view, and I accept that the argument laid out by various people, including the Honourable Member for St Albans, that the precautionary principle is good. And I think we can be criticised at the beginning of this pandemic 2 years ago, whenever it was, for not acting potentially quickly enough. But I do think overreaction is not good, and I think we have had an obsession, damaging obsession, with a very narrow view of what we perceive to be health. And the poorer you are, and the younger you are in this society, the higher price you have paid. And I don't think that is acceptable. I look at this debate and this motion today in the context of some dreadful forecasts and some dreadful assessments which have driven government's nervousness. And I want to explore them and put them on the record because I believe it is in the public interest, but I'm doing so, sir, within this motion. And I want to look at one or two in particular, Imperial and Professor Ferguson, who I have a great deal of respect for, and I will be careful how I phrase this. But I am concerned that some of the forecasting we've had has had a track record in, frankly, getting it wrong repeatedly. Professor Ferguson, in 2001, he predicted 150,000 human deaths from foot and mouth. Under 200 died. In 2002, between 50 and 50,000 deaths from BSE. In the end, 177 died. In 2005, 150 million people could be killed from bird flu. 282 died. In 2009, government estimate, based on his advice, a reasonable worst-case scenario for swine flu would lead to 65,000 British deaths. In the end, 457 people died. I'm happy to be corrected on any of those points, but that is the publicly available information. Coming forwards to COVID, he predicted 85,000 deaths in Sweden, which round the Swedes up. In fact, 6,000 Swedes had died at the time. Angus Tegnell, Sweden's chief epidemiologist, said in 2020, September 2020, we looked at the imperial model and we could see that the variables that were put were quite extreme. Why did you choose the variables that gave extreme results? I love experts, don't get me wrong, Mr. Deputy Speaker. I know we sometimes have our issues with them, but it is helpful if they are right, if only very occasionally. Johan Gisek, Sweden's former chief epidemiologist, said that Ferguson's models were, quotes, not very good. The Washington Post quoted Gisek as saying that Imperial's forecasts were, quotes, almost hysterical. And this is the forecasting that has been part driving government action. Oncology professor Angus Dalgleish in this country described Ferguson's modelling as lurid predictions. He said that Ferguson and his colleagues were getting it, quotes, spectacularly wrong. And I quote Dalgleish, unfortunately, we have a SAGE committee advising a government that is devoid of any scientific expertise on speculative concepts such as the R number, which we now all know is a reproductive rate, etc., and the need for everyone to stay indoors, even though the evidence strongly suggests that people are less likely to catch COVID-19 outside. So some of the scientific evidence may have actually driven the rise in COVID rates in the same way that going into hospital may have actually been the place that you caught COVID and died from it. Viscount Ridley has criticised Ferguson's modelling. Lund University has applied Ferguson's models and found a massive difference between his predictions and what actually happened. Professor Michael Thursfield from Edinburgh said of Ferguson's previous modelling of foot and mouth that it was, quotes, severely flawed. I give way.
Thank you for giving way, and he's absolutely right in highlighting the predictions which are wrong. But the unfortunate thing is that politicians then jump onto those and quote them. And the Health Minister in Northern Ireland, for example, on the basis of Mr Ferguson's predictions, talked about deaths of biblical proportions and scared the life out of people.
You make my honourable friend makes the point most eloquently. Politicians then become fearful. What if? What if the worst-case scenario is right and they lose faith in more balanced predictions? John Ioannidis from Stanford University said of Ferguson's modelling, major assumptions and estimates that are built into the calculations seem to be substantially inflated. He's a serious customer, Professor Ferguson, and Imperial has an impeccable reputation, and I pay respect overall to their work, and I do not seek to criticise for the sake of it, but to highlight that bad forecasting and bad modelling drives bad government decisions, which then become illiberal and intolerant of other people who have more balanced views. Coming more recently, Mr Deputy Speaker, Ferguson predicted 100,000 cases in July 2021. He said it was almost inevitable, and yet we got nowhere near there. The US forecaster Nate Silver, who's very good at predicting US elections, said, I don't care that the prediction is wrong. I'm sure this stuff is hard to predict. It's that he's consistently so overconfident. The political scientist, Professor Philip Tetlock, also agreed with Nate Silver, adding, I expect even top forecasters make lots of mistakes, but when smart forecasters are consistently overconfident, he said one should start suspecting other factors in play, publicity or policy advocacy games, and I make no such allegations. More recently, I understand that this summer, Professor Ferguson predicted upwards of 100,000 cases. they topped at just over 30,000. And in an interview with The Times, the good professor said that his prediction was off because the football messed up his modelling. And that, for me, Mr. Deputy Speaker, comes to the essence of the problem with forecasting. When you can predict 100 million deaths and nobody dies but somebody gets a sore thumb, you can say mitigation effects, there were mitigations taken by government. But when you actually have a forecaster whose work then becomes verifiable because he predicts and he gets it wrong, when that forecast comes up to reality kicks in and makes a fool of the forecast and sometimes, sadly, a fool of the forecaster. And every time his forecasts have been verifiable, they have been seen to be very, very badly flawed. And this is a serious man and a serious university. And so forth. Just to sum up, Mr. Deputy Speaker, I would say that if we look at the forecasts that have been made about COVID, just like the forecast for so many other things, reality changes those forecasts and very often undermines their credibility. So we need another set of factors by which to guide us. And the honourable members over there and on this side of the House said we need principles. We need a precautionary principle, but we need a sense of balance so we do not overstep the mark, we do not damage our society, damage our young people, damage the poorer people by seeking to control when actually we need to learn to live with this. So my final question to the Minister, will the government look into forecasting, maybe an inquiry into the success of forecasting and maybe what we can learn from forecasting, so how to do it less badly in future? And finally, on a point related to the Isle of Wight, if I may, and going from the theoretical to the very practicable, we're not getting the boosters in the Riverside Centre, so in the same way as my honourable friend from Winchester raised a specific point about his constituency, would the Minister please look at getting more booster jabs to the Isle of Wight and to our Riverside Centre? Thank you.
And the last contribution before the Minister responds, Dr Andrew Morrison.
Mr Deputy Speaker, I record my interest as a practising doctor. I agree with my honourable friend, the member for the Isle of Wight, in that there does appear to be a problem with the availability of slots for vaccinations, and that's now and before the government's announced this week that we were to expedite the booster programme. I am concerned about this, and I hope the Minister, who's commented briefly on this already, can confirm that she has a cunning plan in order to ensure that people who need to be vaccinated are vaccinated, and particularly that those vaccines reach the elderly and the vulnerable. At the moment, I have severe concerns about the availability of those slots, if not the vaccines themselves. I shall be supporting Regulation 1340 today on face coverings. I am mindful of the fact that we've got to rely upon best available evidence. The evidence for a lot of these non-pharmaceutical interventions are more, I suppose, commonsensical than actual. But it does seem to me a minor imposition to ask people to wear a face mask, particularly given the evidence published by the BMJ last week on this matter, which we've referred to already, and the Honourable Lady, the member for Central Ayrshire in particular, spoke about. I'm more concerned about 1338. I'm concerned about it for two reasons, because whilst 1340 expires on the 20th of December, or at least ministers can decide whether to continue it or not on the 20th of December, there is no such luxury contained within 1338, and that seems to be illogical. And when pressed earlier, I regret to say the Minister, who was very good at taking interventions from right honourable and honourable members earlier on, did not address this point. She needs to explain to my satisfaction and other members' satisfaction why it is that, on the one hand, 20th of December stands in 1340, but it's 24th of March for 1338. And it seems to me that there is an appetite in this House to return here, if necessary, in order to reconfirm the need or refute the need for these issues to continue into the new year. And I hope the Minister has heard that loud and clear. I, for one, be more than happy to be here well past the time at which we rise, right up to Christmas if necessary. And the reason for that is this. The things we've been discussing today touch very heavily on the liberties and livelihoods of our constituents. These things aren't trivial, they are of vital importance, and all actions have consequences. And I'm worried about things like this because of the messaging that it gives off. It's going to be very difficult for businesses deciding whether to invest or not, looking at this lot, thinking, oh, good gracious me, this is going to go on and on and on. And whilst they've been happy to go along with some of the impositions that we've had over the past 18 months, they're now coming to the point where they're thinking this could be basically the new normal. This is going to go on, and on what basis are we going to continue to invest in our businesses if every few months we're going to have these kinds of things and goodness knows what else that may follow? So I'm worried about that. I'm also deeply worried, as other honourable members have pointed out, about this suspected of bit. That seems to me to be rather clumsy. I'm not comfortable with that. Anybody, presumably, showing any coronavirus symptoms could be suspected of having the Omicron variant. There actually is potentially a solution to this, and it was touched on by the World Health Organization at the weekend, and that has to do with the Thermo Fisher PCR test, which I assume relies upon a detection of the S gene dropout that's been referred to, which of course could expedite the diagnosis of Omicron as opposed to just straightforward coronavirus C19. I wonder if the Minister might reflect upon that and say whether her understanding would be that such a test would be the basis on which we would decide whether somebody indeed is suspected of having this or not, because that would shorten potentially the length of time that people are required to be out of action, and might just make this slightly more palatable to those of us who have concerns about 1338. I disagree with some of my colleagues in the matter of what will change in 3 weeks' time. Actually, I think a very great deal will change in 3 weeks' time, and a number of authorities internationally have made that very clear indeed. The doctor that found this thing in the first place, Angelique Kutzi, in her rather upbeat assessment, I think, of the way this is affecting her patients, seems to be of that view, as does Dr. Stephen Forsey, the advisor to the President of the United States. They are all saying, a lot of the international authorities are saying, that in 2 weeks' time we should be a lot further along the journey in understanding how this particular variant is going to be behaved. And that will sort of make sense. Because in 2 weeks' time we will presumably see, if this is a problem, an uptick in hospitalisation at least amongst the vulnerable population. It's just wrong to suggest that everybody in South Africa is young and vibrant. Of course, it has its fair share of elderly, vulnerable, frail people, people with comorbidities. And I would expect in 2 weeks for there to be some indication at least as to whether this is going to be a problem or not. We should always keep in mind, of course, this actually might be part of the salvation rather than the problem, because we don't know how this virus is going to behave. Some viruses mutate downwards, some viruses mutate upwards. We must hope for the former and not the latter. And at the moment, we simply do not know, which is the basis of my support for 1340. But another point I would just like to ever so gently make, and this is an assumption that perhaps Southern Africa is not sophisticated in healthcare terms. Well, the Republic of South Africa certainly is sophisticated, and I would just say to honourable members that South Africa has been the victim of its own generosity in the sense of having invested heavily in sequencing. It's a bit like the UK in relation to the Kent variant, isn't it? If you look, you will find. And I think we just need to be ever so slightly careful about suggesting that other healthcare economies perhaps are not quite up to spec. I don't think that is necessarily the case in respect of South Africa. I would also observe that yesterday there were 25 deaths attributed to C19 in South Africa, and the 7-day average was 35 deaths. If you look at the graphs, and many of us are sort of captivated by those graphs relating to COVID, I certainly check them on a daily basis. Although I have to confess I don't obsess about South Africa generally speaking, but recent events has made one focus on its graph particularly. But if you do look at it, it is bumping along the bottom. And in no way are we seeing a wave as yet. We may yet do so. But I think we need to be ever so slightly careful, as Angelique Coetzee and others have been, about suggesting this is going to be a major problem. The government is right to be cautious, of course it is, but I think we also need a sense of proportion. And we need to understand that everything we do in this place with regard to regulation has a consequence, not only for liberty and livelihood, but for the economy more generally, and also for young people in particular, a point I made in connection with the suggestion by the Liberal Democrat spokesperson about apparently suggesting that this was a no-cost measure. I just think we need to be very careful, particularly about the impact all of this is having on young people and especially on mental health. I give way to my honourable friend.
I think my honourable friend, does he share my frustration that we've had all these charts about COVID, but we've never had it in context? How many people are born? How many people die? How many people die of flu? How many people die of other illnesses? And so we've become fixated by something when there are many other causes of death in this country that frankly claim many more people. And by taking it out of context, you create unnecessary fear.
Yeah, I absolutely agree with my honourable friend. And the point about that, of course, is the National Health Service at the moment is running very fast in order to catch up, because over the past 18 months, necessarily, it has not been doing a lot of the elective work in particular that it would want to have done. That's going to be a problem, I think, for years to come, actually. And what I would say is there seems to me very little likelihood in our National Health Service being overwhelmed this winter. There are always pressures at this time of the year, and an overwhelmed National Health Service was the absolute cornerstone of government's policy towards this particular public health emergency at the start. Those things are not there now, and I just think we just need to contextualise a lot of what's going on. Of course we need to reduce the number of admissions, and particularly to ITU for COVID-19. The National Health Service is a huge burden to the National Health Service, and it prevents us doing other things. But we are certainly not in the position now that we were in this time last year. So whilst I will certainly be supporting 1340 this evening, I will, I'm afraid, not be able to support the government in respect of 1338 because of the lack of a similar sunset provision that is enjoyed by 1340, and also because I'm very concerned about this suspected of and what that might mean in terms of a chilling effect on schooling, the economy and liberty and livelihood.
Minister Maggie Throop.
Thank you, Madam Deputy Speaker, and I'm pleased to bring this wide-ranging debate to a close. It's now almost 2 years on from when this virus first emerged in Wuhan. Since then, science and disease have been locked in a battle for ascendancy. For the last year, science has been on top as the global effort on vaccines has dramatically reduced the risk of hospitalisation and death for those who catch COVID-19. But we know from the history of previous diseases that they mutate and change so that vaccinations and treatments become less effective. That is why only one disease, smallpox, has been eradicated, although we are close to eliminating polio too. The virus is fighting back and we must respond. To those who say that the regulations we have debated here, the reintroduction of face coverings in some settings and self-isolation requirements for close contacts are an imposition on our liberties, I agree. But they are necessary imposition to slow the spread of the new variant and allow science to catch up. However, there is a balance to be struck. Too many restrictions have a crippling effect on social and economic life, as well as adding to the burden of mental illness. So for those who say that the regulations we have debated here are not enough, I say that they will buy us time to understand this new variant better. That is why they will be reviewed in 3 weeks' time. We will continue to closely monitor all the emerging data on the new variant. We have committed to review all of the measures in 3 weeks' time ahead of the face coverings regulations expiring. Restrictions will not be in place any longer than necessary. We do need to learn to live with this virus, but it is right in the face of a potential threat to take balanced and proportionate measures. We will continue to closely monitor all the emerging data on the new variant. Overall, I would like to reiterate that this will be a moving picture over the coming weeks. We will get a better idea of its nature in the next couple of weeks, its transmission advantage, vaccine escape and severity of infection are some of the options that we're looking at as how is effective. And as we observe how the variant develops in Southern Africa and the rest of the world too. Alongside that, scientists will continue to study it in the lab, but it will be several weeks before we get a clear picture. The most important thing is that the world keeps sharing its information and findings as new cases emerge. I would like to thank my honourable friend for Christchurch for raising an inconsistency in our explanatory memorandum at paragraph 12.3. And for clarity, I would like to read out this section as it was intended. Furthermore, the policy will be supported by a communications campaign that will make clear that some people are exempt from these regulations and people should not be challenged by members of the public for not wearing the face regulation. I trust that this reassures my honourable friend on this matter and on the seriousness the government takes supporting those who are exempt from these requirements, and I'll be working with officials to rectify this. With respect to Omicron positive cases, NHS Test and Trace will work with the positive case and or their parent to identify close contacts. Contacts from a school setting will only be traced by NHS Test and Trace, where the positive case and or their parent specifically identifies the individual as being a close contact. This is likely to be a small number of individuals who would be most at risk of contracting COVID-19 due to the nature of the close contact. I'd like to reiterate that there'll be direct contact will be by NHS Test and Trace rather than via the COVID app. My honourable friend, the member for Winchester, and my honourable friend for South West Wiltshire talked about suspected cases. And my honourable friend for South West Wiltshire hit the nail on the head. That many of the laboratories that are processing the PCR tests will be able to test for the S gene dropout. And this will give a very good indication that the cases of the Omicron variant, whilst it doesn't provide 100% confirmation, we can get this information very quickly, and at the same time the test result is reported, and that's ahead of any genomic sequencing. I do want to continue because there's lots of points raised. I was very generous when I opened the debate. And the debate on this subject would not be complete without the opposition spokesman asking about financial support for those in self-isolation. I would like to reassure the opposition spokesman that anyone who is legally required to self-isolate as a contact or positive case will be able to apply for a test and trace support payment or practical support, such as the Medicines Delivery Service, if they meet the normal eligibility criteria. And the latest figures show that almost 363,000 people have received a test and trace payment since the scheme began, and over 180 million pounds has been paid out. The help is there. We have set out proportionate and balanced measures which do not include limiting socialising. It is the government that sets policy and guidance, which is what the public should follow. The Secretary of State updated the House yesterday on the changes to the JCVI guidance for boosters, and the NHS will be issuing instructions on how this guidance should be operationalised shortly. Madam Deputy Speaker, these regulations are precautionary and proportionate, helping to safeguard the gains made by our fantastic vaccination programme, a programme that has seen already almost 18 million people across the UK get a booster jab. The government has acted rapidly and reasonably to ensure that science retains the upper hand in the struggle with the virus, and I commend these statutory instruments to the House.
Order. The question is motion number 3 as on the order paper. As many as that opinion, say aye. Aye. Of the contrary, no. No. Division. Clear the lobby. Order. The question is motion number 3 as on the order paper. As many as that opinion, say aye. Aye. Of the contrary, no. No. Tellers for the ayes, Marcus Jones and Rebecca Harris. Tellers for the noes, Philip Hollowbone and Craig McKinley. Lock the doors. Order.
The ayes to the right, 434. The noes to the left, 23.
Thank you. The ayes to the right, 434. The noes to the left, 23. So the ayes have it. The ayes have it. Unlock. And we now come to motion number 4. Minister, to move formally. The question is motion number 4 as on the order papers. May I have opinion say aye. Aye. Of the contrary, no. Division. Clear the lobby. The question is motion number 4 as on the order papers. May that opinion say aye? You have to shout aye. You have to shout aye. Of the contrary, no. Tell us for the ayes, Andrea Jenkins and Amanda Soloway. Tell us for the noes, Philip Hollowbone and Craig McKinnon. Lock the doors. Thank you. Order! Order!
The ayes to the right, 431. The noes to the left, 36.
The ayes to the right, 431. The noes to the left, 36. So the ayes have it. The ayes have it. Unlock. Thank you. We now come to the Opposition Day motion in the name of the Right Honourable Member for Ross Skye and Lochaber. Before the debate begins, I have to remind members that, as Erskine May says, good temper and moderation are the characteristics of parliamentary language. And parliamentary language is never more desirable than when a member is canvassing the opinions and conduct of their opponents in debate. The reason why this matters in this particular debate, which doesn't really occur in other debates, is that this debate is on a substantive motion directly relating to the conduct of the Right Honourable Member for Uxbridge and South Ruislip. So, in this particular case, because it is a substantive motion of this kind, arguments intended to criticise or defend that conduct are in order. Therefore, things may be said which the chair would not normally permit in other proceedings. However, those speaking in favour of the motion should set out their arguments clearly. Intemperate abuse is as out of order on this motion as much as on any other. And I'm quite sure that the Right Honourable Member for Ross Skye and Lochaber will already have borne in mind all that I've just said. Call to open the debate, Ian Blackfoot.
Thank you, Madam Deputy Speaker, and thank you for the guidance that you've given to the House of the conduct in this debate. Before I begin, I'm sure you will want to join me, Madam Deputy Speaker, in wishing everyone a happy St Andrew's Day. Happy St Andrew's Day to you and all honourable and right honourable members. Madam Deputy Speaker, the Scottish National Party is bringing forward this motion of censure against this Prime Minister because we believe in a very basic principle and believe that the public does too. Those in power deserve to face consequences for their disastrous actions, and they need to be held to account. And the charge sheet against the Prime Minister is indeed damning. In the last few weeks alone, he ripped up anti-lobbying rules when one of his own was found guilty. He is attempting to restrict the right to judicial review, and he is seeking to undermine the independence of the Electoral Commission. But it didn't start there, and it definitely doesn't end there. Because since coming into office little over 2 years ago, the Prime Minister has been up to his neck in scandals involving cash for honours, cash for contracts, texts for tax breaks, and even cash for curtains. And as this motion states, this is a Prime Minister who is constantly breaking the sixth principle of public life. The duty, Madam Deputy Speaker, to be truthful. Madam Deputy Speaker, month after month, scandal after scandal, the charge sheet gets longer and longer, but not one single person is held to account. If the public is to have confidence in this place, then that needs to change. And it needs to change today. Because unless the Prime Minister faces consequences, unless he is censured, he won't just think that he's gotten away with the mess he's made over the last few months. You think he'll be able to do it over and over again. And let's be clear, if the Prime Minister isn't properly censured today, it will also be final proof that the Tories really do believe that it's one rule for them and one rule for everybody else. And, Madam Deputy Speaker, I would remind members opposite that we've all been witness to events over the last number of weeks. They might want to forget what has happened, but the public definitely haven't. The Tories marched through the lobbies, in due course, the Tories marched through the lobbies to undermine our parliamentary standards process, to tear up the rule books, all in order to protect the friend of the Prime Minister who was found to have broken the rules. This whole sorry episode showed Parliament at its very worst. And trust me, that's saying something. The Government Chief Whip and the Leader of the House are easy scapegoats. But we all know that this was orchestrated by a Prime Minister who thinks he's untouchable, who thinks that he can do as he pleases, a Prime Minister who thinks that he can change the rules at will, who believes that if the rules become inconvenient, they can simply be changed. So the question stands today: how much does it really take for Tory MPs to say enough is enough? Madam Deputy Speaker, it shows how far the standards have fallen, that the charges that I have made against the Prime Minister are not even in dispute. They are all matters of public record. The Prime Minister has even admitted in managing these scandals that he personally crashed the car into the ditch. It tells you all that you need to know, though, that he didn't even have the decency to admit this in the House of Commons. He only felt the need to admit his mistakes and apologies to the backbenchers of the Tory 1922 committee, and only because they were muttering about mutiny. I'm not sure that apology counts, as if he only did it to try and save his own skin. But no matter how much the Prime Minister tries to publicly wash his hands of responsibility for his actions, the public has already cast their verdict. The Tories may be sliding in the polls, but it's nothing compared to the hammering the Prime Minister is taking in the court of public opinion. In the last week, his approval ratings have hit an all-time low, and there's only one simple reason behind it. The public knows that the Prime Minister is at the rotten core of all these scandals. Madam Deputy Speaker, a natural comparison has been made with the major government in the early 1990s. But even that comparison fails to properly get to the scale of the corruption that has occurred, much of it in plain sight. But the difference between this Prime Minister and John Major was that Major took action to address the sleaze and the corruption. This Prime Minister is at the centre of the sleaze and the corruption. He is orchestrating much of it. And I'm afraid that corruption is the only proper word, the only honest word for what has been going on. As I said at the weekend, the Leader of the Opposition, and I do wonder where they are, is now often very fond of repeating the line that when it comes to the Prime Minister, the joke isn't funny anymore. But in truth, it was never funny. And we all now living with the consequences of having a man like this in Downing Street. Madam Deputy Speaker, I think it's also important to reflect on just how damaging in recent weeks and months have been in terms of the public's faith in politics. Because each and every one of these scandals erodes standards, erodes trust, and ultimately erodes democracy itself. In the middle of the Owen Paterson scandal, the Prime Minister said, and I quote, "I genuinely believe that the United Kingdom is not remotely a corrupt country, and I genuinely think that our institutions are not corrupt." Well, you know, the problem for the Prime Minister is that the public disagrees with him. A recent Savanta Comrades poll found that 54% of those asked thought that the UK government was corrupt. And if he wants to know why, the Prime Minister only has to look in the mirror. In the eyes of the public, this is a UK government that has normalised sleaze and is now trying to normalise corruption. This is the Tory government's attempt at a new normal, where no one is held responsible, no one is held to account, and no one ever, not ever, resigns. But that is exactly why consequences are so important, and it's why this censure motion matters. Because it can only ever become a new normal if we all put up with it. You know, this is a debate that matters to people in the United Kingdom. And we can hear the behaviour and the catcalling of the members opposite, and it sums up this attempt to shut down democracy, to shut down our right to raise these important matters in this House. But of course that new normal is only become possible if we don't hold this government to account and we don't make them answer for their actions. So I would genuinely ask from members across the House, if they have any interest in maintaining some dignity and decency in public life, they should finally hold this Prime Minister to account and censure him for his abuse of power. Madam Deputy Speaker, let's take one example of that abuse of power. The Cash for Honours scandal. 15 of the Tory party's main treasurers, who happened to hand over £3 million to the party, were somehow, Madam Deputy Speaker, given life peerages to the House of Lords, as if by magic. 22 of the Tory party's top financial backers have all happened to have been given peerages since 2010. In total, this group have stuffed Tory party coffers with £54 million. And let's just look at one here. You know, this sums it up. The Conservatives see it as a virtue, that if you give multi-million pounds to the Conservative Party, then you end up in the House of Lords. My goodness, Madam Deputy Speaker, what price democracy? Let's take Lord Cruddas, a leading donor to the Vote Leave campaign, who bankrolled, let's not forget, bankrolled the Prime Minister's Conservative leadership bid. He personally gave up to £4 million in donations to the Tory party and affiliates. His reward? An ermine robe and a seat in the House of Lords. And what's worse, the Prime Minister personally overruled the House of Lords Appointments Committee, who advised against his appointment the very first time that the watchdog's recommendations have ever been ignored. 3 days after he was introduced to the House of Lords, what happened? Lord Cruddas handed £500,000 to Conservative Central Office. Now, I will gladly give way to anyone on the Tory benches who wants to stand up and justify that level of sleaze.
Order. I hesitate to interrupt the right honourable gentleman, but I just... I hope that he will be very careful about precisely what he says about any member of the House of Lords, who is also, of course, a parliamentarian, any member of the House of Lords. And while it is, of course, in order for him to examine the conduct of the member who is the subject of this motion, that doesn't extend to other members of Parliament, which includes the Lords.
Deputy Speaker, but what I am reflecting on is the behaviour of the Prime Minister that puts members in the House of Lords when the House of Lords Appointments Committee has ruled against their appointment. And of course, I've given the opportunity for anyone on the Tory benches that wishes to rise and defend the actions of putting Tory donors £3 million for a peerage in the House of Lords. What a price to be able to undermine our democracy. I will happily give way.
I thank my right honourable friend for giving way, and since none of the members opposite wish to intervene on him, I wonder if he might agree with me that is it not somewhat ironic that the members of the SNP on these benches demonstrate more probity and more respect for the rule of democracy than does the current Prime Minister? And is this not yet another compelling reason why Scotland should be an independent country, so that we can have a system of governance which is fair, democratic and transparent?
I thank my honourable friend for that intervention, and of course he's absolutely correct. You know, we're speaking about the House of Lords. The House of Lords is the second largest parliamentary chamber in the world. The only chamber that's bigger is the Communist Congress. My goodness, what an advert for democracy. And the fact is that these unelected lords that have a say over our democracy, and the juxtaposition, the point that's made by my honourable friend is an important one. Because, of course, today we're discussing the behaviour of the Prime Minister and why he should be sanctioned. But in Scotland just 7 months ago, the people of our country were given the right to have a say in their government. And crucially, they were given a right to have a say on the future of our country as an independent country, because the SNP made it very clear in that election that it was about a mandate for an independence referendum. And indeed, Madam Deputy Speaker, the Conservatives made it clear that a vote for the Conservatives was a vote to stop Scottish independence. And what happened? You see, we're talking about democracy, and we're talking about respecting democracy. So let's tell the Conservatives a few harsh truths. Because in the 4 elections that we have fought to the Scottish Parliament that we have won, we've increased our vote at every election. We received just short of 48% of the popular vote in that last election. Madam Deputy Speaker, a higher share of the vote that any party has had in any election in the United Kingdom for the last 50 years. And if we're on the topic of respecting democracy, of respecting the people's sovereignty, then Boris Johnson must recognise that the Scottish Parliament, where there is a majority for Scottish independence, has the right to call that referendum.
Would the right honourable gentleman please refer to the Prime Minister as the Prime Minister and not by his name? If he could just re-say that last sentence, I'd be so pleased.
Thank you, Madam Deputy Speaker. But the point is, the Prime Minister has to respect democracy. He denies democracy when he stuffs the Lords with his Tory donor friends. But he must respect democracy when people in Scotland have voted for a Parliament that has a right to call a referendum to take us out of this toxic union and find a way back in for us as an independent country in the European Union. I will give way.
I thank the honourable gentleman for giving way. He understands, I think, that a debate tends to be a two-way thing and not just a diatribe delivered to the House. Could I suggest that if he wishes to restore confidence in this House, could I politely suggest that he maybe could have chosen a subject for debate today that was actually of relevance to the people of Scotland? Absolutely right. Global warming, education, health, where so many issues there. Not this rather lame subject, which I suspect is something of no consequence whatsoever to most people working very hard.
Really, Madam Deputy Speaker, what we're talking about is corruption and sleaze. We're talking about a Prime Minister that forces Conservative MPs to go through the lobbies to get one of their own off a charge against parliamentary standards. We're talking about a Prime Minister who rewards those that give money to the Tory party. I can say to the honourable gentleman that's exactly a subject which is of importance to the people of Scotland.
I thank the honourable member for giving way. Not only is it an important subject, it's actually fundamental to our democracy and how Parliament works, to how the Prime Minister behaves. If we have a Prime Minister that comes to this House and fails to tell the truth, that is fundamental to how our democracy works in this country. So actually, it's more than important, it's fundamental.
I agree with my honourable friend, and the subject of truth and honesty I will come on to later on in my speech. But it's noticeable, Madam Deputy Speaker, that when the honourable lady who speaks with some authority on these matters is trying to speak, that once again the Conservatives try and shout us down. What a look this is to the people that are watching this debate. I'll give way one more time before I make progress.
He's incredibly kind in giving way, particularly on this, on this subject. I just wondered if you might take the opportunity to update us on the missing donations and the fraud investigation into the First Minister's husband, your party's chief executive.
Order. Don't shout at the right honourable gentleman. We all have to hear his answer, and while I'm on my feet, I'd be grateful if the honourable gentleman who's just intervened would in future use the word he, not you, when he's referring to the party opposite him. Mr. Blackford.
Madam Deputy Speaker, let me respectfully say to members opposite that all monies that are raised by the Scottish National Party for the purposes of fighting an independence campaign, I will give you a guarantee, I will give you a promise, I will give you a commitment right here and now, that every penny which is raised will be spent on independence campaigning, because that's what we are about. And there's a big difference. There's a big difference to those that fund the SNP and fund the independence campaign. Because I'll give you another promise. Not one single member of the SNP that gives to us willingly will end up in the House of Commons. What they will be doing is they will be funding the SNP and the independence movement to make sure that we deliver on our promise of taking Scotland out of this union. The House. Mr. Speaker, there's another important point to be made about how deeply damaging all of these scandals are. Every day that the Prime Minister spends concentrating on how he will somehow avoid scrutiny is a day not doing the basics of what his job demands. And it's also becoming clearer just how damaging and dangerous it is that a chaotic governance now defines Downing Street. That would be bad enough in normal times, but it's totally unforgivable in the middle of a pandemic. Because in the real world, away from the shambles in Number 10, people are not only suffering from the pandemic, they are suffering from a Tory cost of living crisis. Inflation is running at 5%. Rising day-to-day costs and rising household bills is the main focus for families. And whilst all these political stories on sleaze have been going on and taking up time at Downing Street, the political decision to cut universal credit is hitting homes hardest. That shameful cut to universal credit wasn't just the wrong policy, it came at the worst possible time for families this winter. So we are left with a UK government not only up to its neck in sleaze, but hitting families at the same time. Madam Deputy Speaker, in Scotland, I am proud that we have a First Minister who understands the pressures that family finances are under, and a government that listens and responds. I am proud that at the very same time that the Westminster government is cutting universal credit by £20 a week. The Scottish National Party, Scottish Government, is raising the Scottish child payment by £20 a week. Madam Deputy Speaker, I think one of the public's real angers about these scandals is the deep dishonesty that has been so openly on display. The truth and the Prime Minister have always been strangers, and I say that in sadness and not in any anger. And let me just take a few examples. On the 4th of March 2020, the Prime Minister said, "We have restored the nursery's bursary." Completely and factually untrue. On the 17th of June 2020, the Prime Minister said that there were 400,000 fewer families living in poverty than there were in 2010. Both the Office of National Statistics and the Children's Commissioner have confirmed that that is false. On the 7th of November 2019, the Prime Minister told Northern Ireland businesses in person that the protocol would mean no forms, no checks, no barriers of any kind. Once again, completely untrue. Now, Madam Deputy Speaker, it is right to be careful in terms of the language that we use in this House. But when it comes to language, it is also right to be accurate and honest. And on the basis of all the evidence, I can only conclude that the Prime Minister has repeatedly broken the 6th principle of public life. I can only conclude that the Prime Minister has demonstrated himself to be a liar. Mr. Speaker, Madam Deputy Speaker, let me finish on this point. I think there is a misguided sense on the Tory benches that they have gotten past the scandals of the last few weeks. No way. The Prime Minister thinks that if he blunders on, people might not forgive, but they will forget. Not for the first time. The Tories are badly wrong and badly out of touch. Because they just don't get the depth of anger amongst the public is very real and is not going away. I know that people in Scotland are looking on at a broken Westminster system that has never felt more remote, more arrogant and more corrupt.
Would my right honourable friend give way?
I will give way here and then
I am very grateful. I wonder, does he appreciate, and do the members on the opposite side appreciate the damage that has been done when to be able to use the word liar in this place is now passed as fair comment and accepted, and the damage that that is doing to our democracy?
Order, order, let us just be clear about that. It is preferable that such words should not be used in this place. But, as I said before the Right Honourable Gentleman rose to his feet, this is a very specific and particular motion. And the Right Honourable Gentleman is examining the conduct of a member of this House, indeed the Prime Minister. Therefore, I cannot stop him from using the word that he has just used. I would prefer it if he put things in different terms, but I don't think that the Right Honourable Gentleman has strayed past the rules. I think he is perfectly in order, but it would be better if other members did not make comments such as those just made by the Honourable Lady, because what she said is not actually quite correct. But please, let us just keep it as moderate as possible. Mr. Blackford.
Thank you, Madam Deputy Speaker. And I was dealing with the 6th principle in public life. And what I've done for the House is lay out 3 examples, and I could have given many more, where the Prime Minister hasn't told the truth. Now, I regret, in the context of where we are, that I had to make the point that I did, because it's important. Because if we undermine honesty and truth in this place, then what are we left with? And that is why we have brought the motion that we have tonight. And that's what I'm asking honourable members right across this House to reflect on. Because there is overwhelming evidence that the Prime Minister has broken that principle of public life, And I'm asking each and every member in this House, particularly on the government benches, to examine their conscience on the basis of the evidence and think very carefully before they go through the lobbies tonight. Because the public are angry at what has happened in this place. Public are angry that the member that I mentioned earlier, who had been sanctioned by the Standards Commission, that the Prime Minister sought to get off. And there will come a time where the public will judge this House. And this House tonight should reflect very, very carefully on that.
I thank the member for giving way, and I wholeheartedly agree that this is an issue about conduct, but this is also a question of leadership. We have a Prime Minister in the middle of a pandemic who has failed to learn. At the beginning of this crisis, he boasted about shaking hands with COVID patients. Now he's maskless in a hospital and too weak to tell members of his own party to put on a mask. What we desperately need is not just an improvement in conduct, but an improvement in clear communication and leadership from this Prime Minister.
I have to say I agree with the honourable member, and let me say, and perhaps maybe we should just calm down, because there will be opportunities for people to participate in the debate. But this issue of leadership and conduct is important, and it saddens me that when we're facing a new variant, and we don't know what the scale of that challenge will be, but the obvious thing for everybody to do is to seek to protect themselves, but more importantly, to protect others, to lead by example, to show leadership. And let me commend colleagues across the House that are sitting here wearing masks today. But my goodness, there are far too many that still don't get this, that still don't accept the responsibility that they have for each other, and they're even laughing about it just as I say this. And this comes from the Prime Minister. But let me also say, because let me just carry on for a second, because this is important. The way that we conduct ourselves, the way that we interact with others, and I will commend the previous Prime Minister, the Right Honourable Member for Maidenhead, for the courtesies that she always showed to opposition parties, the protocols that were showed, the way that we had a relationship with Number 10. And it grieves me, Madam Deputy Speaker, that I can tell you that ourselves as the third party of this House, and I believe the Leader of the Opposition, has no relationship with Number 10. We're disrespected and disregarded by a Prime Minister that doesn't understand his obligations in public life, and that is yet another example. I will give way one last time and then I'll conclude.
Thank my right honourable friend for giving way. Isn't it telling about how complicit those benches opposite are? That when my honourable friend was reading out the list of untruths peddled by the Prime Minister, there was deathly silence. Exactly. The only time they were animated was when my right honourable friend called it for what it was.
I thank my honourable friend for that, and I would ask members opposite to reflect. Most people in this House are decent people. People come here in order to provide a public service, and I say to honourable and right honourable members opposite that they are being let down. We've been let down. These islands are being let down by a Prime Minister that quite simply doesn't know how to behave. And on that note, let's just say that it will be very interesting to see how the Scottish Tories vote tonight. And we will be watching. A group, of course, who never fail to see conspiracy at Holyrood, but somehow always fall deathly silent when it comes to sleaze and corruption overseen by their own Prime Minister. But in truth, this isn't about the Scottish Tories. I'll leave them to explain their own hypocrisy. It's about what the public expects when standards and rules are so clearly broken by their political representatives. They expect consequences, and they expect the censure. But let's also be very clear about this. If we fail to censure this Prime Minister today, we have failed that public duty for accountability. And not only that, it will reveal something very telling. It will show a Westminster system that is broken beyond repair. It will show a Prime Minister who believes himself to be above the law of the land. The only comfort that I take is that fewer and fewer people in Scotland can possibly look at the broken, corrupt, self-serving Westminster system and conclude that it produces a secure basis for the future of Scotland. Because we all know that Scotland can do much better than this. We can do better than this broken Westminster system, and we can do better than this Prime Minister. We will do so much better when our country chooses independence. Madam Deputy Speaker, I propose the motion in the name of myself, right honourable and honourable colleagues.
The question is, as on the order paper. Michael Ellis.
Well, thank you very much indeed, Madam Deputy Speaker, and it's a pleasure to start by wishing the honourable members opposite, and indeed the whole House, a very happy St Andrew's Day. Always an auspicious occasion in the Scottish and British calendar. And I must confess, Madam Deputy Speaker, some surprise when the Right Honourable Member for Ross and Skye and Harbour, with this rare opportunity to engage in serious debate with the government. I mean, I haven't been to a pantomime in quite some time, Madam Deputy Speaker, but instead he opts to launch pantomime season in the month of November, complete with an over-the-top characterisation of my right honourable friend, the Prime Minister, who clearly he wishes would disappear in a puff of smoke. But the reality is, when it comes to fanciful fairy tales, Madam Deputy Speaker, the Scottish National Party are expert. And I venture that neither this House nor the people of this country will appreciate the over-the-top performance, nor recognise, I have to say, the absurd depiction of the Prime Minister, a hugely popular Prime Minister of this country, who returned this House with an 80-seat majority and is getting on with the job of building back better. And to take one element of today's rather long-winded and unfocused motion, improving standards in public life, my right honourable friend, the Prime Minister, has made positive and constructive proposals on this topic, Madam Deputy Speaker, in a bid to find cross-party consensus and a way forward. And to take another point, the reform of the Electoral Commission. There is nothing in the government's plans to reform the regulation of the electoral system that will allow ministers or Parliament to interfere in the outcome of particular complaints or investigations. So in that regard, their motion is also in error. And there is a courtroom, in a moment, if I may, there is a courtroom tactic in some jurisdictions, Madam Deputy Speaker, not in this country, of course, which is known as throw enough mud and some of it might stick. Well, I think we know that when we see it. For my part, I think I'll give way more than her right honourable friend has done, but not just yet. For my part, I relish this opportunity, but to set a very different scene for this House. What my right honourable friend, the Prime Minister, is achieving for the people who returned him to number 10, many of whom voted Conservative for the first time. And at the election, he made a clear commitment to spreading opportunity more fairly, uniting our country, higher skills, higher wages, higher productivity. That's the United Kingdom that my right honourable friend, the Prime Minister, promised to create and is creating, and they know it. He got Brexit done. And since then, he has been using our freedoms outside of the European Union. And the catastrophists opposite don't want to accept this, but he has been using those freedoms, those hard-won freedoms, outside the European Union to serve the interests of the whole of this precious United Kingdom. I will in a moment, with policies that encourage innovation and growth throughout the whole of the United Kingdom and deliver for the whole United Kingdom. And I'll give way.
Very grateful to the Minister who's making a good case. And does he find it strange indeed that the SNP posed tonight as defenders of democracy when they wouldn't accept the result of the Brexit referendum in the UK and they wouldn't accept the Scottish referendum on staying in the Union?
they are, Madam Deputy Speaker, fair weather friends to democracy. They support clearly only when it goes their way. The Prime Minister, Madam, well, I'll give way, but perhaps he could say why it is that the SNP didn't choose to debate the vital topic of education in Scotland.
The Minister is speaking dutifully and gushingly about his Prime Minister. He's setting a picture which nobody in the country recognises. I wonder, for the sake of completeness, if he might like to explain, if things are going so swimmingly, why his colleagues on the back benches sent letters of no confidence to the 1922 committee.
Well, he disproves his own statement by the fact that, of course, this Prime Minister won an 80-seat majority, the biggest Conservative government majority since the early 1980s. So that is obviously disproven. The fact of the matter is that he, the Prime Minister, is taking care of the people's priorities, not focusing on the polemics of the party opposite. He's looking at what the people care about most. Keeping his... Well, I will give way, but perhaps she could answer why it is that the SNP hadn't chosen to speak about health and the National Health Service in their precious parliamentary time.
I'm grateful to the Minister for giving way. I'm not sure what he was asking me, because over the noise of his colleagues barracking, I couldn't actually hear him. But he may have been asking me why we weren't choosing to debate devolved topics in this chamber. And I think that that somewhat answers itself. The Minister was speaking about what the people's priorities are, and I have to say to him that the people's priorities are not stuffing the House of Lords with unelected donors and cronies, but they are worrying how they're going to put food on the table because of the cuts his government is making to universal credit.
Well, this Prime Minister, of course, takes care of the people's priorities, looking after what they care about the most, keeping his promises to them, while I have to say the opposition plays political games, Madam Deputy Speaker, and not very good at them either. More nurses this government has created. More police officers this government is responsible for. More money for schools. More money for pupils in those schools. Because people care about their health. They care about their safety. They care about their children's educations. And my right honourable friend, the Prime Minister, is focused on improving our infrastructure too. He's boosting public services to get us on the road to recovery from the pandemic. And what does that look like, Madam Deputy Speaker? What exactly does that look like? It looks like this. It looks like £3.7 billion to build 40 new hospitals, 3/4 of them outside London and the South East. And it's 50,000 more nurses. It's 20,000 more police officers. It's a further £4.7 billion in the core school budget by 2024-25, meaning a total cash increase of £1,500 per pupil by that date compared to 2019-2020. So it is actually delivering. It's not the polemics of the party opposite, it's not the pantomime, it's delivering. It's not just talk, it's £36 billion package to reform the National Health Service and social care, tackling the issues that successive governments have ducked for decades. And thanks to my right honourable friend, the Prime Minister, this government will deliver around £12 billion a year in extra funding for our health and social care services over the next 3 years. This is in addition to our historic 2018 settlement for the NHS, which will increase its budget by £33.9 billion a year by 2023-2024. It is, Madam Deputy Speaker, rolling out the fastest vaccination programme in Europe, allowing us to live with the COVID virus without significant restrictions on our freedoms. And I'll give way, and perhaps she can answer why she's not talking about matters that are more important to the people of this country.
Thank you, and I really do thank the Minister for giving way. Can the Minister confirm that he actually understands what devolution means and what matters are devolved to the Scottish Parliament and are debated there, and those matters that should be debated here, like the motion in front of him?
Well, this government has proven it knows what the people want of this country, and it does so by the 80-seat majority behind me. It's rolling out the fastest vaccination programme in Europe, allowing us to live with the COVID virus, allowing us without significant restrictions on our freedoms. Almost 9 in 10 people aged 12 and over, almost 9 in 10, have now received a first vaccine dose. That is a huge achievement, with 8 in 10 having also received a second dose. And the latest data shows that vaccines have saved almost 130,000 deaths and prevented over 260,000 hospitalisations. And what else? This Prime Minister has launched our plan for jobs, helping people to get back into work, earn more money, gain the skills our economy needs. This includes our £2 billion Kickstart scheme, which has already got 100,000 young people into work, our £2.9 billion Restart scheme, helping over 1 million long-term unemployed people find work, and our Lifetime Skills Guarantee, offering 11 million adults a free qualification. And it's cutting taxes. It's boosting wages. She should listen. The Honourable Lady should listen. The fact of the matter is, it's cutting taxes, it's boosting wages, it's helping working families.
Order. Order. Point of order, Mr. Owen Thompson.
Mr. Speaker, I'm just slightly confused here because I'm really struggling to find which points the Minister's making here are in any way relevant to the motion in front of us in the order paper today. Could you guide us?
Noise. Would the honourable gentleman give me the second part of his point of order again?
I'm struggling to understand what points the Minister's making are in any way relevant to the motion on the order paper today, and would seek your guidance as to how we could actually focus on those issues.
No, I see what the honourable gentleman is saying, but I have absolutely no responsibility whatsoever for the content of the Minister's speech. The Minister is constructing his argument, and I'm sure that he will come to his razor-sharp points very soon. Minister.
Oh yes, Madam Deputy Speaker, because of course the motion that they put is about the conduct of my right honourable friend the Prime Minister, and I'm telling the House, and I'm telling the party opposite what the Prime Minister has achieved, his conduct. And it is, Mr. Speaker, let's look at the infrastructure uplifts. £600 billion into transport and broadband upgrades, including £96 billion for the railways, the biggest investment in our rail network for a century. That's one of the multitude of things that this Prime Minister has delivered to reliable, faster railway journeys across the North and the Midlands. And thanks to the Integrated Rail Plan, we will build 3 new high-speed rail lines, electrify or upgrade 3 existing main lines, improve local services and integrate them properly with HS2 and the Northern Powerhouse Rail, all bringing benefits to passengers 10 to 15 years sooner than under previous plans. And my right honourable friend the Prime Minister is investing in our local streets so that we can all feel proud of where we live. And again, let me remind right honourable and honourable members of where the money is going. £4.8 billion via the Levelling Up Fund to help regenerate town centres and high streets, upgrade local transport and invest in cultural and heritage assets. £2.4 billion for 101 towns deals investing in local economies. And I gave away last time and it really wasn't worth it. And the £150 million Community Ownership Fund to protect valued community assets. Mr. Speaker, in getting Brexit done, my right honourable friend the Prime Minister and my right honourable friend the Home Secretary have turned their attention to immigration. And the Nationality and Borders Bill will break the cruel business model where criminal gangs exploit. I'll give way to the right honourable gentleman.
I'm grateful to the Minister, and I have to say he knows I have some affection for him, and he's doing a marvellous job at deflection. And it's noticeable, Madam Deputy Speaker, that there's no attempt to defend the behaviour of the Prime Minister, because quite simply there isn't one.
Well, the feeling is mutual, Madam Deputy Speaker, but I am defending the behaviour of the Prime Minister, the conduct of the Prime Minister, and it is this achievement, it is this large litany of achievement that he knows he has no answer for. In getting Brexit done, my right honourable friend the Prime Minister and the Home Secretary and have... Yes, I'll give way.
I'm grateful to the Minister for giving way, and he accuses members on this side of the House of not having an answer. Well, it's very interesting that the Minister's got to his feet and he's going through the Conservatives' programme for government, he's going through the Conservative manifesto, and he's making some fairly ambitious claims about what's been achieved. We're not debating that. We're debating the character of the Prime Minister. Could he focus his remarks on that, please?
The conduct of the Prime Minister is the subject of the debate. The conduct of the Prime Minister is the maintenance of this government and the running of this government, and that's what he's been achieving. And we've seen, going back to the point on immigration, we've seen the tragic consequences in the recent incident off Calais, and our thoughts are with, of course, the families and loved ones.
Order. Just for the sake of clarity, we're not debating the character of the Prime Minister. We're debating the conduct of the Prime Minister. That is the subject of the motion. Minister.
Yes, exactly, Madam Deputy Speaker. Thank you. And the principle behind the bill is that access to the UK's asylum system should be based on need, not on the ability to pay people smugglers to leave safe countries like France and Belgium. These are the things that are being delivered, and we've always been clear of the need to do everything we can, of course, to prevent people risking their lives and embarking on these perilous attempts to cross the sea. Now, our United Kingdom, Madam Deputy Speaker, is the most successful political and economic union the world has ever seen. The foundation of it, it's the foundation of all our businesses, and our citizens are able to thrive because of it. Since 1707, this government is committed to protecting and promoting its combined strengths based on those hundreds of years of partnership and shared history. And I'd like to remind the benches opposite that this government is committed to investing and levelling up across Scotland. And I'll give way.
I thank my honourable friend for giving way. He's giving lots of examples of where the conduct of the Prime Minister is helping the lives of the British people. One such recent example affecting Scotland in particular was the COP26 summit held in Glasgow in Scotland. Does my honourable friend agree with me that this is one such example of where the Prime Minister is putting the priorities of the people first, and why this debate is a missed opportunity for the Scottish National Party to have today discussed what matters to the people of Scotland?
My honourable friend is absolutely right. It is yet another missed opportunity by the Scottish National Party. And I'd like to remind the benches opposite that this government is committed to investing and levelling up across Scotland. We are delivering, after all, an average funding boost of £4.6 billion a year through the Barnett formula over the spending review period. And this will enable investment in transport, schools, housing, health and social care. And this takes the total funding Scotland receives in Barnett-based funding to £41 billion per year. That is an increase of 2.4%. To spend on public services, Madam Deputy Speaker, boost growth and support families with the cost of living. In fact, current public spending per person in Scotland is £1,828 higher than the UK average, while revenue per person is £382 lower. And that means that... I'll give way, although I'll have to make progress.
I thank my right honourable friend. One thing he's failed to mention, I'm sure he'd want to take the opportunity to celebrate, of course, is the government's Borderlands deal, which sees people from Scotland and the true north, Carlisle and Cumbria and Northumberland, coming together to invest together across the borders in their community. And as the Minister who had the privilege of negotiating that deal, I was refreshed that in fact the border is of no relevance to many people because they have friends and family and businesses that cross it. And they celebrated with this government and the devolved administration in Scotland that partnership along the borders that strengthens not just our United Kingdom but England and Scotland as well.
My honourable friend is absolutely right, and of course, and he speaks with the authority of an expert on the subject, and the expertise shows. And what it means, the numbers that I've been quoting, is that every person in Scotland benefits from over £2,000 in extra spending than the UK average. And I'd like to remind my right honourable friend that we have confirmed that we will be providing over £170 million through the Levelling Up Fund for 8 Scottish projects, including the new futuristic aerial roundabout in Falkirk and the redevelopment of Inverness Castle. And not to mention the £1.5 billion of funding for 12 city and growth deals. They don't talk about that, Madam Deputy Speaker, including over £500 million for Glasgow, backing a deal worth around £1.2 billion, one of the largest in the Kingdom, and set to deliver 29,000 jobs over its lifetime. This government has been levelling up every part of the country since the day we took office. Indeed, the pandemic has shown clearly that we are at our strongest when we work together towards a common goal. Through both the furlough scheme and the self-employment income support scheme, we protected over 14.5 million jobs and livelihoods across the United Kingdom. And thanks to the Prime Minister, almost 1.1 million Scottish jobs were protected through the peak of the pandemic, supporting livelihoods across Scotland. The UK government has supported nearly 100,000 businesses in Scotland, but they don't talk about the businesses. Over £4 billion in loans through the Bounce Back Loan Scheme and the Coronavirus Business Interruption Loan Scheme. And it goes without saying, Madam Deputy Speaker, that the UK government has secured access to the COVID-19 vaccine for Scotland, saving lives and stopping the spread of the virus. So, in conclusion, Madam Deputy Speaker, we continue to make sure that we will use the broad shoulders of England, Scotland, Wales and Northern Ireland as a platform to unleash and deliver opportunity across the whole of our precious United Kingdom.
Before I call the Honourable Lady for the opposition, it might be helpful for colleagues to know that there will be a time limit of 4 minutes on backbench speeches. Annalise Dodds.
Thank you very much, Madam Deputy Speaker, and a very happy St Andrew's Day to all in the Chamber. Now, I take no particular pleasure in debating this motion, but it is, of course, a pleasure to follow on after the Minister and indeed the member for Ross, Skye and Lochaber who opened today's debate. I have to say, I do find it strange to see massed ranks of Conservatives in the Chamber for this debate when they appear desperate to flee the Chamber no less than 2 weeks ago for the debate on publishing Owen Patterson's contract. If the member is just about to justify why he was not here for that debate, I look forward to hearing from him.
Talking of mass ranks, where are they all?
Yeah.
I saw on Twitter yesterday. A graphic which said Labour were back in business. I'm not too sure what business, but it's not the business of this House. Is it not the case, Madam Deputy Speaker? The reason why they're not here is because they've got no plan, no vision, and no credibility to run this country.
Yeah. Thank you, Madam Deputy Speaker, and I regret the member seems terribly confused. I'm sorry about this. This is an SNP Opposition Day debate. And as I'll go on to explain, sadly, it is his government which lacks a plan, which lacks, in regard to this motion, the competence and indeed the credibility against corruption that is necessary. And if he could answer on those subjects, I would be very grateful, because he was not in the Chamber for that debate on those contracts. Well, he certainly did not speak. I suspect he was not willing to do so. Indeed, I must say, Madam Deputy Speaker, it seems easier for some to defend the indefensible, it seems, than to stand up for transparency, probity and the public interest. And all I can say is I really hope that those in charge of junior ministerial appointments are watching carefully for the sake of the members across the Chamber. Yes, of course.
I thank my honourable friend for giving way. And my honourable friend is absolutely right that on this side of the House we believe that the ministerial code should be followed and that ministers should be compelled to come to the House and tell the truth, and that if they don't tell the truth they should be dealt with as the ministerial code states that it should. But unfortunately they're led by the Prime Minister, who is chief liar in charge.
Thank you, Madam Deputy Speaker. I'm grateful to my honourable friends. I will come on to that issue of the ministerial code because, of course, it is highly relevant, sadly, to this debate, given the appalling way in which it has been treated by the Conservative government. Indeed, the overall Conservative attitude that rules simply don't apply to this Prime Minister or his government is genuinely dragging our politics through the gutter. And I have to say, while I see that today's motion references the 6th principle of public life, honesty, I would have referenced also the other principles too: selflessness, integrity, objectivity, accountability, openness and leadership, where, unfortunately, the current Prime Minister is falling short, where the Conservative government is failing to get a grip, and where working people in our country are paying the price. I'm happy to give way.
She talks about honesty and integrity. Could you please confirm how many Labour MPs have ended up in the Nick over the past 10 years?
Thank you, Madam Deputy Speaker. Well, the major difference, as I will explain to the honourable member, between my party and his is that wherever we see in the Labour Party rules being broken, inappropriate action, we act against it. We don't try to change the rules and try to stitch up the system for our friends. That's the major difference. Now, as I was reading before this debate, I came across quite a curious piece, which I'm sure many members on the benches opposite will have seen. The Prime Minister's foreword to the Ministerial Code. It commits the government to upholding, and I'm not making this up, the very highest standards of propriety. The principles of public life are lauded as precious things that must be honoured at all times. That, from a Prime Minister who tried to rip up the standard system to save one of his friends who was found to have engaged in an egregious case of paid advocacy by the Committee on Standards. The foreword also states there should be no bullying. That, from a Prime Minister who refused to sack his Home Secretary after an independent advisor on standards found she'd broken the Ministerial Code because her approach to staff had, and I quote, on occasions amounted to behaviour that can be described as bullying. It says there should be no harassment. That, from a Prime Minister who imposed a 3-line whip to keep one of his MPs in Parliament after he was found by an independent panel to have sexually harassed a member of staff. I'm happy to give way.
I'm grateful to Honourable Lady for giving way. I'm hoping she'll use this opportunity to apologise to my predecessor, Ruth Smith, for being the bullying and harassment she faced from Labour Party members simply for being Jewish.
Madam Deputy Speaker, and I won't give way. Madam Deputy Speaker, I, of course, will respond to the member's comments because, just as I said to his friend one moment ago, where the Labour Party finds action that is inappropriate, we act. We have changed our systems. We have made sure that we comply with what is required of us. And if he wishes to defend his party happily allowing a member who has been found to have engaged in sexual harassment being back on their benches, that is up to him. It's his decision. Now, within the foreword to that piece on standards, again the Prime Minister says there should be no misuse of taxpayer money. That, from a Prime Minister who gave us the VIP lane for PPE contracts, £3.5 billion of taxpayers' money to party donors and Conservative cronies who were recommended by Conservative ministers, MPs and Downing Street officials. Contracts which so often failed to deliver while our nurses and care workers struggled and while many British firms' offers of help were passed over. Happily give way.
Is she really denigrating the efforts to get hold of PPE? And does she not also know the history, which is that the Labour Party also put forward proposals and Labour Party members and Labour donors also helped in that huge effort to get PPE?
Madam Deputy Speaker, I'm slightly surprised to hear the Right Honourable Member wish to draw attention to what took place in this regard. No, because I will respond to his point. He said, was I aware that Labour MPs and others were making recommendations? I'm absolutely aware, because we were all trying to do that to ensure we had the best response. But the difference was they were not entered into that VIP lane, and one can see this in the list of firms which was recently published. So if he wants to state that amongst that list there were Labour MPs' names rather than those of his Conservative colleagues, he must have been looking at a very different list to me.
I'm grateful for the opportunity to set the record straight on this, and I hope that after I speak, she will withdraw these comments and the Labour Party will no longer use this argument. Because the contract with Excalibur Healthcare, which is run by a Labour donor, was introduced from a Labour MP through me. And the man, a very good man who runs Excalibur Healthcare, in fact, helped launch the Labour Party Science Manifesto in 2005. So now she can withdraw the allegations, and what she should say is a big thank you to everybody who helped get PPE when it was so badly needed.
Madam Deputy Speaker, I really regret that rather than taking responsibility, stating that the system will be changed for the future, instead we see an attempt ultimately to rewrite history. It's not myself stating that Conservative-related actors were more likely to obtain contracts. It's the National Audit Office which pointed this out. And yes, as I mentioned one moment ago, Labour figures were making recommendations to have a better response. But in doing so, we were focused on those who could genuinely aid our response. We were not focused on, for example, pub landlords, others who had no experience in this field before. I don't want to upset the House. I'm very happy to take another intervention if Madam Deputy Speaker doesn't mind.
Straight on one further, if I may set the record straight on one further point, because I've heard this point about this pub landlord, and I just want to tell her and the House and put it formally on the record, and after this I hope the Labour Party will also stop this slur, that the man in question, the gentleman in question, never got nor applied for a contract from the government or the NHS at all. It is a fabrication pushed by the Labour Party. It's a load of rubbish. What was happening, though, was a huge range of people helping out in the national effort, including members of the Labour Party.
Madam Deputy Speaker, no, I won't give way, and I'm most certain...
Order. We have had a perfectly... We've had a perfectly reasonable exchange between the Right Honourable Gentleman and the Right Honourable Lady. We don't need to have shouting about it. We are dealing here in facts and good argument, not shouting. Annalise Dodds. Point of order, Don Butler.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, I just wonder if the government has lost every court case that it's been taken to court on in regards to procurement contracts and corruption, does that mean that the member opposite needs to apologise for what he's just said and withdraw?
No, that is not. That I appreciate what the Honourable Lady is saying. It's not a point of order. It is a point of debate, and perhaps she might like to address it later in the debate. Annalise Dodds.
Thank you, Madam Deputy Speaker. And indeed, it is the case that facts have been laid out in courts of law. They stand for themselves. And I have to say that at a time when we see yet again our National Health Service, our care workers, volunteers up and down the country supporting that COVID effort, I think it's incredibly important this government is transparent. I will not withdraw what I have said, but I do hope that the Conservative government will withdraw what it has said about not being transparent, a point I will come onto in a moment. Now, finally, the foreword says, written by the Prime Minister, that there will be no actual or perceived conflicts of interest. But we know there have been so many, sadly. Peerages, apparently handed out to anyone who can meet that £3 million entrance charge and agree to a stint as Conservative Party Treasurer. David Cameron and Lex Greensill given the run of Whitehall to beg for access to hundreds of millions of pounds of taxpayers' money, and over £500 million in testing contracts handed over to a company advised by a Conservative former minister without competition and behind closed doors, dishing out a second contracts to Randox Laboratories after they'd failed to deliver on the first. And I'm grateful to the Right Honourable Member for those comments that he just made. If he believes in that transparency, I do hope he will be, and in fact, indeed, well, transparency reveals facts, does it not? Therefore, I hope he will be encouraging his government to do what indeed this House stated it must do only 2 weeks ago, which is publish the minutes from that meeting between Lord Bethell, Owen Paterson and Randox over the award of money-spinning contracts. Parliament decided this must happen 2 weeks ago. The Deputy Speaker reminded ministers to do so in a timely fashion last week, and yet they're still dragging their feet. They say that they can't possibly make them public for another 2 months. That seems like a rather long time to establish the facts, does it not? If those vital minutes simply don't exist, ministers should do the right thing and come clean about it now, here today, not pretend to spend the next 2 months looking for them. So I offer the minister opposite, and indeed those on his benches, the chance to do that right now. Let us know, do those minutes exist or not? Intervene and let me know whether they exist or not. Well, no one's meeting my gaze there, so it appears clear that we will have to wait until the end of January to know what is taking place with those minutes. Yes, happy to.
I'm grateful to the Honourable Lady for giving way. I wasn't planning on speaking in this debate, but I wanted to draw. She's been talking about conflicts of interest and timely wait. And also she said earlier in her speech that when the Labour Party sees people breaking the rules, they act. I note that I have written to the Honourable Lady twice. I've written to the Leader of the Opposition on a number of occasions throughout the last few months relating to her former flatmate, Ruth George, who has an atrocious record when it comes to anti-Jewish racism. She's the one who, when Luciana Berger quit the Labour Party, came out and said that they were funded by Israel. Will she respond now to that conflict of interest and agree that she should not be in the Labour Party anymore?
The gentleman should resume his seat. He should not be attacking personally in that way. Anneli.
Thank you, Madam Deputy Speaker. And just for the record, as the member indeed stated in his own letter, those issues have been dealt with, have been taken up and proceeded. Well, he stated it in his own letter, so perhaps he needs to go back and reread it. Now, we cannot sit idly by, surely, and allow this situation around cronyism to continue. The current regime of standards and rules on the conduct of ministers relies too much on convention in these unconventional times. It gives the Prime Minister the power to act as judge and jury even when his own conduct is in question. And that's why my party, the Labour Party, has brought forward a 5-point plan to clean up our politics, to strengthen and uphold standards in public life, and to protect taxpayers' money from the egregious waste and mismanagement that we've seen during the pandemic. We'd start by banning second jobs for MPs, with only very limited exemptions, to make them focus on the day job, not the one on the side. We'll stop the revolving door between government and the companies that ministers are supposed to regulate, banning ministers from lobbying, advisory or portfolio-related jobs for at least 5 years after they've left office. We would stop Conservative plans to allow foreign money to flow into British politics and create strict rules to stop donations from shell companies. We'd end the waste and mismanagement of taxpayers' money with a new Office for Value for Money and reform of procurement. And we would establish a new, genuinely independent Integrity and Ethics Commission to sit across government with the power to investigate ministers, take decisions on sanctions for misconduct and ban former ministers from any job linked to their former role for at least 5 years after they leave office. Happy?
I find all the giving away, but I'm very confused on what she said, because I'm under the impression that 3 current front-bench parliamentarians in the House of Lords work for lobbying companies in the Labour Party. How can you claim what you say at the dispatch box, yet they're...
Just not refer to the Honourable Lady using the word you, because that's me. OK? Alexander Stackett.
I apologise, Madam Deputy Speaker. How can we talk about these aspects when current members of the Labour Party, the current Labour front bench, work for lobbying companies? This is just hypocrisy of the highest order.
Madam Deputy Speaker, I regret that the member is confused. We appear to have quite a lot of confusion this afternoon. Of course, Labour has set out those measures for MPs going forward, and we're very clear we would not stand back, as his party appears to be doing. We would take that action because we are determined to clean up politics for the future. Indeed, those measures are urgent and necessary because the current system relies on a Prime Minister who respects the rules and understands there must be consequences for breaking them. Now, Labour have set out those radical proposals for reform because it's so urgently needed. And when it comes to cleaning up crony contracts, we're insisting on transparency because we have to learn from the mistakes made by the Conservatives, not least during this crisis. And I'm afraid we've also got to learn from mistakes where they've been made by any party, including also the SNP. And here I regret that the Honourable Member for Ross Skye and Lochaber, for whom I have a huge amount of respect, wasn't more reflective on the actions of his own party. The SNP government had already been criticised for treating journalists and politicians differently in its responses to freedom of information requests. When the SNP's Health Secretary tried to have freedom of information requests suspended. Disturbingly, it's been revealed that an SNP cabinet minister then directly intervened to try to prevent the publication of statistics on care home deaths before the Holyrood elections. And the Financial Times newspaper has had to battle to force the SNP government to reveal the true cost, total cost of its guarantee to Sanjeev Gupta's businesses, which appears to be to the tune of over £500 million. Now, Labour believes that sunlight is the best disinfectant in Whitehall and in Holyrood. And rules are there for a reason, to regulate our Parliament and its elected representatives, to uphold standards in public life and to protect our institutions from the cancer of cronyism and corruption. As the Prime Minister has discovered in recent weeks, ripping up these rules is thankfully easier said than done. But while he fails to take action to strengthen the system, working families in our country continue to pay the price. And they've been paying the price in response to what the Minister tried to set out before. They've been paying the price with the longest squeeze on living standards in this country since Napoleonic times. They've been paying the price with rising fuel prices and no plan to tackle them, with life expectancy falling in many parts of our country and 5.5 million people on NHS waiting lists. And they're paying the price with rail in the north scaled back. They'll be paying even more of the price with the Conservatives' working class dementia tax as well. And the Minister tried to claim his government was delivering what the people of this country want. Well, they don't want the Conservatives picking their pockets, they don't want their incompetence on public services, and they don't want their sleaze, graft or corruption either. Thank you.
Matt Hancock.
Thank you very much, Madam Deputy Speaker. And I wish you also and the whole House a happy St Andrew's Day. And I've come to this debate today because it strikes me that the SNP motion today is pitiful politicking. And the people of Scotland, frankly, deserve better. And they want to see real solutions to real problems, and unfortunately it's part of a pattern, Madam Deputy Speaker, with the SNP, that they put ideological purity ahead of the interests of the people of Scotland. And we've heard it, and we in fact heard it from their lead leader here on the front bench, who argued that independence wasn't the most important thing on the minds of the people of Scotland. But we know why they brought this debate today. It's merely so that they can find another way to make the argument for independence, which they lost so comprehensively when it was put to the people of Scotland 5 years ago. Now, today they call for censure of the Prime Minister. And what they should be doing is working to improve the lives of the people of Scotland. I think the flop of a speech from the front bench opposite demonstrated that they are losing this argument. He reads out a list of allegations that were comprehensively demolished by the Minister in his excellent speech. At the heart was that the Prime Minister is ignoring advice. But the problem with the SNP is that they ignore not just the advice, but the decisions of the people of Scotland and this country in every referendum that they've seen. The problem is that they don't see a referendum result that they've liked, and so they ignore them and ask for a rematch. And on the substance of it, I won't go into their failures in education, for instance, where Scotland once had the finest education system in the world. He didn't even mention COVID-19 in his comments. I won't dwell on the huge economic cost of independence. But what I will say is this. There is one piece of evidence from the Prime Minister's tenure that demonstrates that what he has done completely undermines the SNP's case, and it's the vaccine programme. And I just want to mention it for a second. Because they're losing the argument on the substance, they focus instead on politicking. But conceived through a UK-funded scientific work involving researchers from universities across the UK, indeed the whole world, the Oxford vaccine was a UK success, is a UK success, and shows Britain at her best. Critically, we bought for the whole of the UK, so everybody across Scotland and the whole of the rest of the UK could get access to vaccines first in the world. But even better than that, it was a joint effort. Because if you're Scottish and British and in this union, you get the best of both worlds. A UK vaccine delivered locally by the NHS in Scotland, working with local councils, where we could bring in the British Army when we needed reinforcements. It was a huge team effort. All 4 nations rolled out the vaccine together. And I would just pay tribute to my Scottish opposite number at the time, Jean Freeman. She deserves plaudits for putting pragmatism ahead of ideology. The only problems for Jean Freeman were when the First Minister of Scotland would get involved and cause all sorts of problems by trying to politic with the programme instead of delivering the programme. And finally, Madam Deputy Speaker, why do I, as an English MP, care about this? It's because our union brings together the best for Scotland and for the United Kingdom and for England and for my constituents too. We should get away from this politicking and concentrate on the things that really matter.
Stuart Hosey.
Deputy Speaker, it's a pleasure to follow the Right Honourable Gentleman for West Suffolk. If he carries on reading out his briefing notes like that, he might get a job in government one day. There's an old adage in politics, Madam Deputy Speaker. It's not enough to simply win a vote, one needs to win an argument as well. This government, though, is rather different. It will use its majority to win votes, although sometimes it will try to avoid those votes, but it rarely puts in the effort to actually win an argument, other than by blunt force and soundbite. And this has led to a catalogue, not just now, a catalogue of nasty, unnecessary and deeply undesirable decisions, a whole procession of decision-making based on half-truths, anecdote and inaccuracy. Let's take the election bill, or more accurately, the voter suppression bill. Up to 3.5 million people may not have suitable ID, and the government's own pilots indicated around 325,000 people could be denied a vote in a GB election. The government have persuaded nobody of the necessity to do this, but are bashing on regardless. Consider the changes proposed to the... Of course I'll give way.
I thank the honourable gentleman for giving way. He's talking about winning an argument and winning a vote. Is the 2014 Scottish referendum not an example where the SNP won neither, but despite that continues to bash on regardless, as he says?
I can say to the Honourable Lady, we're here. We didn't declare UDI. We haven't rushed into a second referendum. What we have done is won another mandate, another mandate, another mandate, and we will hold the referendum in line with the wishes of the people, because that's what democracy actually means. Let me, as I say, consider the changes proposed to the Electoral Commission. They will give this government unprecedented and unchecked power by allowing ministers to set the agenda and the purview of the Commission, enabling them to change which organisations and campaign activities are committed a year before an election. That is executive interference in the electoral process that we should be deeply concerned about. And on a related topic, we have a boundary review. It will reduce the number of MPs from Scotland and Wales. It will increase the number in England. And if every single vote was cast the same way, it wouldn't affect the SNP. The polls say we would still return 48 members. But in England, the Tories would go up and everyone else would go down. So it's no wonder, looking at the failure to tackle dark money, the boundary changes, the evisceration of the Electoral Commission, the voter suppression bill, that the public smell a rat. And then there's cash for honours. When my honourable friend from the Here and Near asked the Prime Minister whether such practices should end, he seemed to defend it. And rather bizarrely, he said, until you get rid of a system by which the trades union barons, whoever they are, fund other parties, we have to go ahead. There's a world of difference between organisations coming together to campaign for things they believe in and selling honours for cash, which is illegal. And of course, the Tories always defend their own by trying to get Owen Paterson off the hook, conflating his issue with a general change to the standards process. That was never going to wash, Madam Deputy Speaker. Yes, I will.
Grateful for my honourable friend for giving way. He's talking about illegality. We should never forget that it's this Prime Minister's government that introduced the phrase into the lexicon, into this House of Commons, that it's okay to break the law as long as it's in a limited and specific way.
Limited and specific law-breaking is still law-breaking. I was also struck that they almost boasted about their intention to break international law, not in the little Britlander exceptionalism that we're used to, but in a way that would have made the UK an international pariah. I could also add, Madam Deputy Speaker, this government lost a key battle in the Tory COVID cronyism row when the NAO ordered it to name the VIP lane firms given public contracts. I could add the disgraceful but apparently use of WhatsApp and Signal messaging systems, which have options to make messages disappear, which it appears have been used to avoid scrutiny of decisions made during the COVID crisis. Or the fact that the High Court granted a judicial review into the rules regarding the retention of records. But my favourite, Madam Deputy Speaker, was when the Supreme Court ruled that the Prime Minister's advice to the Queen that Parliament should be prorogued for 5 weeks at the height of the Brexit crisis was unlawful. Defeats in the courts, judicial reviews, trying to get Owen Paterson off the hook, cash for honours, voter suppression, weakening the Electoral Commission, ignoring dark money, unlawful prorogation. This is a pattern of self-serving, self-seeking behaviour, an approach to governance which is grubby to say the least and smacks of dishonesty. The rot, no I won't, the rot starts at the top. The fish rots from the head down. That's the Prime Minister. The buck should stop with him, and the process to end this should end today with support for this resolution.
Hear, hear.
Thank you very much, Madam Deputy Speaker. And I wish you and all right honourable and honourable members of this House a very happy St Andrew's Day, by far and away the best saint in my humble opinion. But it hasn't been a very happy St Andrew's Day for many of my constituents, because as we sit here debating this today, thousands of my constituents remain without power, without lights, heating or internet connectivity as a result of Storm Arwen. Hundreds remain without water. Thousands more are, but only. I will give way on that point.
Doesn't he think, Madam Deputy Speaker, that it would be a better use of time, frankly, to debate that rather than this mention?
I think I thank my right honourable friend for asking that question, because I do actually, and I'm actually quite angry that whilst constituents of mine, well, the SNP might heckle and make light of the fact that Scots are freezing in their homes, have no access to services at this time. But I am quite angry that we are here debating this when people in Finghan and Strawn and Kincardine and Neil and many other places in West Aberdeenshire and Kincardine are dealing with a catastrophe and a crisis, and it was not out with the realms of possibility for the right honourable member, the member for Rossgar and Lochaber, to table a motion today. So maybe we could have debated how the Scottish and the UK governments might work together to support all those across the United Kingdom that have been affected by Storm Arwen. But we're not. We're here debating this, and indeed, actually, as of early this afternoon, the First Minister of Scotland, Scotland's most prolific social media activist, it would seem, has yet to post any comment on. She may have now, but that was before I came into the chamber. On what I will not give way, because before I came into the chamber, she had not. The power went off on Friday. Today is Tuesday, and the First Minister of Scotland had not made one comment in relation to the fact that 72,000 Scots were without power over the weekend. The Prime Minister, I would like to thank my right honourable friend, the Prime Minister, for last night expressing his concern and offering the Scottish Government any support that the UK Government could give to support my constituents and indeed constituents across the rest of Scotland. But, Madam Deputy Speaker, when the right honourable member for Rossgar and Lochaber announced with his typical understated fashion at the weekend that this was going to be the motion that was being tabled today, he said that he was doing it to be the real opposition and hold the government and my right honourable friend to account for our disastrous actions. Well, I have to admire the brass neckery, if nothing else. One might suggest that if the SNP did not spend so much time playing politics down here at a time of crisis in Scotland, they might have noticed that at home in Scotland, they are supposed to be a real government. Yeah. For if we are going to talk about disastrous actions by government, and I just wish I had time to go into them all, let's look at the record of their party in government in Scotland over the last 14 years. Drug deaths, failure, 1,264 deaths in 2019. 15 times worse than Germany, 35 times worse than France, 3.5 times worse than the rest of the United Kingdom. Education, failure. Scotland and the SNP has fallen in the science rankings, in the reading rankings, in the maths rankings. We have the lowest scores in maths and science since Scotland started participating in PISA 20 years ago. Literacy and numeracy rates declining, the attainment gap widening, and now you are more likely to go to university if you come from a deprived background in England than you are in Scotland. That is a shameful record. Scotland's NHS, 25% of GP practices have unfilled vacancies. 500 consultant posts vacant in Scotland's hospitals, and I could go on. In the northeast of Scotland, of course, Madam Deputy Speaker, not failure, just abandoned. North Sea oil workers told they have no future by the SNP's partner in government. The First Minister declaring there should be no more exploration in the North Sea and that Cambo is a bad idea. Reneging on their plan to drill the A96. Failure to deliver money for improved rail journey times that they promised twice in a manifesto, and a broadband rollout that is going to be 5 years late. Not so much disastrous SNP action, it's missing inaction when it comes to the northeast of Scotland. And all of this, whilst over 50,000 Scots were without power at the weekend, many without water. Whilst the nation recovers from Storm Arwen, whilst many people worry about this new strain of COVID, whilst businesses recover from the last 2 years, whilst teachers work hard to support those kids that have been left behind, whilst doctors and nurses slog away to deal with the backlog and support all of our constituents, whilst Police Scotland does more with less, whilst the oil and gas workers worry about their future, what does the SNP choose to do today? Point scoring, petty politics, and frankly a stunt that is wasting all of our time. Little wonder the First Minister's popularity ratings are in free fall. Support for independence is on the decline, and independence now ranks as eighth in the priorities of the Scottish people. Today's motion is on the conduct of the Right Honourable Member of Oxford and South Wales, my right honourable friend, the Prime Minister. I just wish I had any confidence in the conduct of the Scottish Government and how they're running my country.
Stephen Bonner, it's important.
Thank you very much, Madam Deputy Speaker. 2 weeks ago I was standing in this spot speaking about how parliamentary time has been wasted as the Prime Minister wanted to save one of his own former corrupt MPs. And today we have the opportunity to stand here and consider why we should put up with this. We are living, and people are living outside, in a society of staggering inequality. We have thousands relying on food banks with wages pitifully low and the cost of living extremely high. Yet we have a Prime Minister who oversees a consistent approach of raiding benefits, keeping wages low, increasing taxes for the working poor, yet rewarding big business and those with accumulated wealth while turning a blind eye to wealthy tax dodgers. A Prime Minister in his own agenda. A Prime Minister, a democracy denier, stood on a hill of sleaze. That's exactly why it is right that we have brought forward this motion today in the name of my honourable friend for Skye, Locharborough and Ross. The Prime Minister's government and his leadership have failed. From Brexit lies on buses to gleefully telling of handshaking with COVID patients lying stricken in hospital beds. Cash for honours, cash for contracts, text for tax breaks, cash for curtains. I'm trying to fit all this in. Handouts for wallpaper. Time and time again, we see who he really is. A nattiform metaphor for corruption, collusion and institutional sleaze ingrained in this Tory party. We need always remember that those who do hide vast sums of money or hoard their wealth in offshore accounts aren't hiding it from the authorities. Oh no, Madam Deputy Speaker, in the UK they are the authority. The Prime Minister himself registered on his interest. His stay in a luxury Spanish villa has been provided free of charge by the family of Lord Goldsmith, by who, of course, mere coincidence, the Tories will claim, have been handed a peerage and a ministerial job after an electoral defeat. Yet at Cabinet questions last Thursday, the Minister had the temerity to claim, and I quote, that there is no link between Tory party donations and nominations to sit in that House of Lords. In the same session, in relation to the contributions or lack of the Tory Treasurer in the Lords, the Minister said it was about quality, not quantity. This is apparently our democracy in action. Well, let me make this clear. It is my opinion that there is nothing noble about the men and women who are sitting through there in that place. Nothing, and even less so when they buy their place in there and their ermine robe with...
The honourable gentleman should not be directly criticising members of the House of Lords, so I want him to readdress that in his speech. He mustn't continue to do that. Move on to his next subject.
Just clarify, Madam Deputy Speaker, I'm speaking about the whole House of Lords and not any individual within it. Anybody who has to buy an ermine robe with £3 million, anybody who has to buy an ermine robe with a £3 million backhander, I think that says it all. Where is the democracy in that? What happened to true and honest representation? Does anybody really, with any credibility, truly think that we get that from this Prime Minister? He may argue, as is his right, that to appoint members to the House of Lords, and in this excuse for democracy, indeed it is. But when will it start being convention to stand up for those in dire poverty? When will it be this place's convention to effectively tackle homelessness? When will it become convention of those places sitting over there that have to earn the place in merit, based on the number of votes they receive, not the number of notes in their pockets? And I hope that this motion today is the first step in doing so.
Coutinho. Madam Deputy Speaker. At a time when we're dealing with the aftermath of an unexpected global pandemic, with a booster vaccine programme to deliver, and an economy to keep firmly in recovery, I really do find it astounding that the SNP have used their parliamentary time today not to further the interests of the Scottish people, but to play party politics with their base. The leader of the SNP in this place, the member for Ross, Skye and Locharborough, has exposed what his main priority is, which was getting a news headline for his party conference this weekend. And at a time when we have seen the emergence of a new COVID variant, all the tragedy that we saw last week, or the people who have been left without power after Storm Arwen. Imagine this being your first choice for a debate. It is nothing but political theatre designed to further an obsession with independence. And all that they have achieved today, Madam Deputy Speaker, is exposing what the Scottish people already know, that the priorities of the SNP could not be further removed from the priorities of the Scottish people. If you take, just last week, YouGov published a poll which found that the 3 most common priorities for the Scottish people, and indeed these were in line with the priorities of the British people, were the COVID recovery, healthcare and the economy. Yet what did we see at the SNP's annual conference this week? The Right Honourable Member for Ross, Skye and Nakaba spoke for over 15 minutes. How many times did he mention the NHS? Not once. How many times did he mention failing standards in Scottish schools? Not once. Yet how many times did he mention independence? 7 times. And I noticed in his opening speech today, I think he made double digits. It's a little surprise that the eye of the SNP tilted so firmly away from their own delivery of public services that under their leadership, schools have plummeted down the international league tables. A&E waiting times are near their worst level on record, and Scotland has the highest drug death rate in the whole of Europe. All of these issues are devolved to the Scottish Parliament and have been under the SNP's stewardship for 14 years. Yet instead of focusing on these issues or the other important issues that we could be focusing on for the Scottish people, again, they are simply trying to drive us further apart from one another. And in fact, I will give way.
I thank my honourable friend for giving way. I heard our opposition bench saying not true, but they didn't intervene on my friend, the member for West Aberdeen to Kinnacardine, and they're not intervening on her. Do they have any answer to the charge sheets that she is making?
I thank the honourable member for his point. But the point that I would want to make is this. We have seen during the pandemic, and I think actually members on the benches opposite will agree with me, we've seen the strength that our family of nations working together can achieve, from the procurement of vaccines through Kate Bingham's much lauded work with the Vaccine Task Force, the British Army deploying personnel to help with ambulance services and provide mobile testing units in all different nations, and of course, the full financial power of the UK Treasury, pooling and sharing all of our resources to stand shoulder to shoulder with the British people across all 4 nations to support their livelihoods through the UK furlough scheme. But let's briefly talk about the SNP's single issue, their single issue they focus on to the detriment of all others, dividing our family of nations. My parents were so pleased to have been welcomed to Britain when they moved here in the 1970s. Like many others, they viewed these islands as a shining city on a hill, a beacon of optimism and opportunity. And with a mum who still works for the NHS in England and a cousin who works for the NHS in Scotland, I know firsthand how the people of Britain are woven together. Our bond is more than constitutional. It's emotional. It is shared family ties. As we emerge from a very difficult couple of years, I think that is what we should be focusing on this place, supporting the people of this country, supporting those families and dealing with their priorities, not the endless obsessions of the Scottish National Party.
Anam Kassar. Thank you, Madam Deputy Speaker, and it's a pleasure to follow the Honourable Member for East Surrey. I commend her for reading her briefing notes so very well. She says that we in the SNP don't know the priorities of the Scottish people, and I gently remind her that the Tories don't win elections in Scotland. Over the course of the pandemic, Madam Deputy Speaker, the UK's economy shrunk at the fastest rate for a century, and unemployment rose to one of the highest rates. And at the exact same time, Britain created a record number of billionaires, and there are now 171 billionaires in this country. Whilst the rich were getting richer, the poor were getting poorer. And when this Tory government should have been lending a hand to the most vulnerable in society, on the opposite benches, some chose to line their own pockets and the pockets of their rich mates, and the Prime Minister did nothing. So let's be absolutely clear.
The policies that this Tory government have introduced and continue to implement are none other than an attack on working class communities. My constituents of Airdrie and Shotts are in continual contact with me, Madam Deputy Speaker, outlining how Tory policies are impacting their day-to-day lives, and genuine concern has been raised that the Prime Minister simply does not understand the hardships that people face. I will give way in just 1 minute. Rather than looking after his mates, the Prime Minister should be listening to the public. And he's not here today, but I want to put it on record how the Prime Minister's policies are impacting my constituents. One wrote to me, I'm going to make progress, one wrote to me and said, I'm a single woman that has learning difficulties. A £20 per week cut in my income would have a huge impact on me. I have struggled with my bills till the pandemic. The extra money has helped me out a lot. So the Minister is in his place, and I've got a few questions for him. How many people does the Prime Minister know that are on universal credit? None. And how many people does the Prime Minister know that that have donated money to the Conservative Party and subsequently joined the Lords? I'll quickly give way.
My honourable friend's making a powerful speech, and the members opposite seem to forget what the subject matter is of this debate. Those people might want to watch a Peter Stevanovic video that's got over 40 million views. That might help jog their memory. Sign my EDM 383 about the ministerial code, and also watch my Big Nasty performance where I did a little rap about the Prime Minister. Thank you.
I thank the honourable member for her intervention, and I highly encourage those on opposite benches to go and have a look. Madam Deputy Speaker, I have previously spoken in this very chamber on the Nolan principles, the principles of public life by which we are bound, and the Prime Minister's actions has potential to bring shame on this House. Scandal after scandal risks bringing this very House into disrepute, yet there has been no independent investigation to hold those responsible to account. And Madam Deputy Speaker, the deception and dishonesty of this old boys network is entrenched in government and the Lords, and I simply cannot comprehend that in the Scotland office we have a government minister who in May this year was rejected by the Scottish electorate but handed just months later a peerage in a government role. How is this democratic?
It's not.
Since it's not. Since the Prime Minister arrived at the dispatch box, he has created 96 peers in less than 2 years. So the unelected House of Lords is bigger than the elected House of Commons. I ask again, how is this democratic? The Prime Minister has frequently violated the 6th principle of public life. His attention instead should be on creating policies that help the most vulnerable in society. And that, I'm going to make progress, that starts by retaining the universal credit uplift and scrapping the 2-child limit, along with scrapping the national insurance hike. And Madam Deputy Speaker, I conclude by stating this. The pandemic has worsened household finances, and so this UK Tory government needs sustainable and long-term solutions to prevent a generation of people failed.
Anthony Higginbotham.
Thank you, Madam Deputy Speaker. It's a pleasure to follow the honourable member, and can I wish honourable and right honourable members on both sides a very happy St Patrick's Day. St Andrew's Day. Madam Deputy Speaker, it was a slight surprise to see on the order paper a motion in the name of the SNP that didn't mention independence in it. But the honourable member for Edinburgh East, in his perfectly scripted intervention, the first intervention that the leader of the SNP took, managed to get it in there. And I do understand why they've chosen this topic today. I understand why they want to keep making the case for independence, because it's brilliant for their social media clips. It allows them to stand up here today, express their faux outrage, and post those clips on Facebook and Twitter and Instagram and TikTok and all of the others. But it doesn't improve the lives of their constituents. And call me old-fashioned, but that's what I came here to do. I came here
to represent my constituents of Burnley and Padiham and to make their lives better. And I think the honourable my honourable friend, I think my honourable friend, the member for Aberdeen, made the point crystal clear when he explained what his constituents are going through right now. And the honourable members opposite had the chance to talk about those issues, and they chose not to. They chose not to table an urgent question. They chose not to have a debate in the House today. They chose to ignore what is happening to people up and down Scotland and up and down the rest of the country. The honourable members opposite also spoke about the election bill. The member for Dundee East said that we hadn't made the case for the changes being made to the elections bill. That's not true. If anyone reads the Conservative manifesto that delivered the majority on this side of the House, they will see that we propose changes to ID for elections. I'll give way.
For giving way. I served on the Elections Bill Committee, and the evidence we heard from Tower Hamlets, from Peterborough, from all over the country, does make that case. It makes it very clearly, and we took on the arguments made by the member for Glasgow North in that committee, and we defeated them.
I'm very grateful to my honourable friend for the intervention, and I think it highlights perfectly that faux outrage point that I made at the start of the speech, that actually all the SNP come here to do is to click for social media. They don't want to be here, and I get it. I get why they don't want to be here. I understand their claim, their desire for independence. But given you are here, given members of the SNP are here, I think they've got an obligation and a responsibility to represent their constituents to the best possible way. And I think we could have focused this debate on a much better subject. But they pulled forward a number of examples of conduct about the Prime Minister. They sought to highlight about his conduct. But they were very selective in doing it. So let me just give them some other examples. Why don't we talk about the vaccine rollout, led by the Prime Minister, the quickest in the world? Why don't we talk about the fact that the Prime Minister decided he was going to be the first Minister for the Union? Why don't we talk about the fact that the Prime Minister launched the Union Connectivity Review? Because he actually cares about linking up all four corners of the UK. Why don't we talk about the UK Shared Prosperity Fund? Why don't we talk about the fact that our armed forces are growing, and as a result of the plans announced by the Defence Secretary, for the first time they are growing in Scotland too? Madam Deputy Speaker, I think we could have focused this debate on far bigger issues that matter to people in England, in Scotland, in Wales and Northern Ireland, and it's a shame that they didn't.
Owen Thompson.
Thank you very much, Madam Deputy Speaker. And I have to say it's fitting that we're holding this debate on St Andrew's Day. It's not just the patron saint of Scotland, but a fisherman. Yet another broken promise of the Prime Minister, who swindled and betrayed them. After the Brexit deal, which he barely seemed to have read, let alone understood, it was claimed that the UK was an independent coastal state with full control of our waters. The truth is, as always, sadly, very far removed from the rhetoric, and the fishing industry was a very convenient tool for charlatans to sell Brexit before they were sold out and stitched up. Now, I find it very interesting, Madam Deputy Speaker, that there has been a defence of a kind of the Prime Minister in this debate this afternoon from the bench opposite, but I've not yet heard a single member on the opposite benches challenge one single point raised in the motion that we have brought today. Not one single line has been challenged by a member opposite to say why it is inaccurate, which can only bring me to conclude, Madam Deputy Speaker, that their desire to change the terms and to talk about anything but what's in the motion in front of us only tells me they agree. If they disagreed with it, if they could challenge it, they would be doing so, and that simply isn't happening. We all make mistakes. I think anyone can see that and accept that, and where genuine errors occur, they need to be put right at the first opportunity. But we don't see that from this government. Instead, we've got an ever-increasing timeline of misinformation and languishing on the record, a record of failure to stand up for the best possible standards in public life, and a Prime Minister who will seemingly do anything he can to adjust the rules to fit the narrative that he wants to achieve. There are channels through which the government should be held to account, and in this place, it is this place. But this Prime Minister is doing everything he can
to avoid that, including up to illegally proroguing the House. Under the leadership of this Prime Minister, we've got a government that's been mired in sleaze and corruption and cover-up. Colleagues have listed a litany of such failures, and again, the opportunity has been there to challenge these points by members opposite, and it's not been there. Even Peppa Pig could see the clarity that's there in front of them, regardless of how much of their speech they might have missed. As Burns has said, facts are shields that win a ding. So if this behaviour of this government becomes normalised, the self-regulation of checks and balances that operate a democracy breaking down, that is the depth to which this Prime Minister seems to be willing to take us. Madam Deputy Speaker, some may say that this is not a talking point on the doorsteps, and I've heard this suggestion coming from some of the members opposite, but I have to say, in my constituency in Midlothian, the people are absolutely scunnered by the behaviour of the government, and it puts every one of us to shame that that is seen as the top standard that can be achieved. People are dismayed. There seem to be no consequences for appalling behaviour. This would not apply in any other walk of life. In no other job could the actions of the Prime Minister be failed to be held to account. Yet in this place, he can just change the rules. So this censure motion can begin to put things right. It can be a start on the trajectory to making sure that we are held in a far higher regard. But while sleaze and dishonesty continue to erode the core, the heart of this government, these are issues that are going to haunt all of us.
Thank you, Madam Deputy Speaker. This has been quite an interesting debate. It's been a fiery debate. And I've listened to it very carefully and listened to every single contribution. And this has fundamentally been a debate about the approach to governance, about the conduct, not the character, but the conduct and actions of the Prime Minister, and about the principles in public life. And when I think about the principles in public life, there are words, and members have read them out, things like accountability and leadership and probity and transparency and these things, which we all agree with in this House. What one has to then do is we have to think about how those principles get translated in one's conduct and actions. And the way that I would characterise that, first of all, and I do put this gently to members of the SNP opposite, is that working hard for people that elected you is a pretty good way to put in place principles such as accountability and leadership. Now I will make some progress, but let us look at the contrast between what's happening with this Prime Minister, indeed, and what is happening in Holyrood. We know there is a new COVID variant. We don't know how serious it will be, but I think it's right that we should be watchful. We know that the economy of the United Kingdom, and indeed the economy in Scotland, is on the brink of recovery. But in the face of that, what is it that is the priority of the SNP? Independence referendum, Madam Deputy Speaker. Is that working hard for the people that elected you when we bear in mind the challenges that are there? I give way to the Honourable Gentleman.
Grateful, and I commend him for at least trying to address the topic. But can I gently say to him that the First Minister of Scotland came to the Chamber today to address the COVID crisis, and both the First Minister and myself, in my speech to the SNP conference, made it absolutely crystal clear that our first priority is dealing with the COVID crisis. But here's the difference. The First Minister of Scotland has gone to the Chamber to answer members. We have repeatedly asked the Prime Minister to come and make COVID statements here as he should. He doesn't do that. He does press conferences. He should be accountable to members, and he's failed to be accountable to members.
I thank the honourable gentleman for his point. Where I gently disagree with him is that, first of all, it has explicitly been the position of the Deputy First Minister, Mr Swinney, that independence is the priority. The First Minister has said that regardless of what happens with COVID or the economy, she wants another independence referendum by the end of 2023. So I would disagree with him on that point. But let us look at another aspect
of working hard for people that elect you, indeed, translating those principles of accountability and leadership and the things that in public life we say we care about. The job creation in Scotland between 2007 and 2019 was about 5% increase. The rest of the United Kingdom overall was about double that. Rather than focusing on increasing the rate of job creation in Scotland, what is it that the SNP did in Holyrood? They went into coalition with the Greens, who, on their own website, and I went to check this myself, say explicitly they want universal basic income. They think that negative growth is manageable. This is not the action of a Scottish government that is concerned about working hard for the people that elect them. But let's also think of another issue. Let's think of drug deaths, which have already been mentioned by many people in this House. Scottish drug deaths are the highest in Europe. And then, what is the response of the SNP, Madam Deputy Speaker? The response is to decriminalise Class A drug possession. That is the response of the SNP. And if we think again about other ways to implement these principles, let's think of making long-term decisions in the public interest. I think we would all agree making long-term decisions in the public interest is again a good way of translating the principles of accountability, leadership, transparency, probity, all the things that we come to this House to do. And what has this government, led by this Prime Minister, done? The vaccine rollout, opted out of the EU vaccine scheme, which was a very brave decision at the time, because a lot of people were saying that would damn us to being at the back of the queue, when in fact we're at the front of the queue. The Green Industrial Revolution, the 10-point plan, being lauded internationally at COP26 for our leadership on that issue. Social care, the decision that we made on social care. Again, a subject which so many governments have ducked. And indeed, dare I say it, I suspect the Prime Minister had been given advice to say, look, this is a really difficult issue. You know, is it right that we do it? And the Prime Minister said, yes, we need to tackle social care. And we need to come up with a plan that is fairer and better for everybody in this country. That is what dealing with the long-term interests of the people who elected you is about. And just to finish by quoting the member for Midlothian in his speech, even Peppa Pig can see that this government and this Prime Minister are taking right actions and the SNP are not.
Marion Fellows.
Deputy Speaker, and I truly wish it was a privilege and a pleasure to follow the honourable member for Hitchin and Harpenden. Has he heard of the word mandate? And actually the one he knows really well is deflection, because I had hoped that when the Prime Minister would step up to the mark when he assumed high office. I tell my granddaughters that I'm disappointed, not angry, when they conduct themselves badly, but I am truly disappointed and angry, but not surprised with the current Prime Minister, given his predilection for saying what he thinks people want to hear and changing his mind and breaking promises when it suits. I wish Scotland were not part of this union, but while we are, SNP MPs like me must and should censure the current Prime Minister for dishonourable conduct, which reflects badly both on the UK, here and internationally. The Prime Minister seems to believe it's okay to say one thing and do another, or to plough ahead with policies in the middle of a pandemic which cause real hardship to ordinary families and even more so to our vulnerable communities. Woe betide any person or organisation who gets in the way of what the Prime Minister and the Conservative Party see as their divine right to govern how they like. The attacks on the Commissioner for Standards and on MPs who disagree are vile and undermine all independent checks which are supposed to protect us all from abuses of power. The Westminster system is broken, and the sooner Scotland can break free of it, the better. This Prime Minister thinks he can say or do what he likes without hindrance. We, as MPs, owe it to our constituents to challenge him and his government to disabuse them of that notion. Hence, this motion today. Port barrel politics are now the norm for this Conservative government. It's much more likely that a Tory marginal seat will receive government funding than an area which truly needs and deserves it. 7 out of 10 Cabinet Ministers were in low priority, most developed areas, but first in line for significant funding. As we say in Scotland, they don't even put a face on it. The Good Law project has mounted a legal challenge to the Levelling Up fund allocation to assess whether the funding is based on Tory ministerial bias and towing the party line on certain issues. The Prime Minister believes in helping cronies and ministers, and devil take the hindmost. He enjoys unaccountable power and can and has dismissed independent advice on alleged breaches of ministerial rules. I wanted to focus this speech on how what the Prime Minister has done has affected disabled people and families with disabled children. We're still in the middle of a public health crisis, and inflation is now running at 5%. Energy companies are failing. The cost of heating our homes is even bigger. The mortgage increase is likely. And these things worry people in Scotland and the rest of the UK. And I work hard for my constituents, and I challenge this government on a daily basis to make their lives better. But none of this seems to concern this Prime Minister. What matters to him is money and protecting those who have it. There is yet another case going through the courts raised by 2 ESA claimants who are claiming that the DWP acted unlawfully and discriminated against disabled people by not giving the uplift to those on legacy benefits. This sleazy UK government, headed by a Prime Minister who doesn't understand how disabled people struggle to live, must look to the Scottish social security system, which is based on the principles.
Order. Order. Lee Anderson.
Thank you, Madam Deputy Speaker. Now then, it's Happy St Andrew's Day. I've had haggis, I've had iron brew, and I've had an SNP debate. I can recommend 2 out of the 3 any time of day. Since arriving here in 2019, it has always struck me that the party opposite are just a one-trick pony, ignoring their own failings in health, education and the economy to put their own selfish case forward for independence. But they're losing the argument. We know that by the recent polls. So they've adopted a new technique, a new tactic, which is to besmirch the good name of our great Prime Minister. Maybe, Madam Deputy Speaker, they should tell us where the missing £600,000 is and explain why senior members of their party stood down from the NEC earlier this year. Madam Deputy Speaker, their own MPs are asking difficult questions, yet the leadership remains silent. Maybe, Madam Deputy Speaker, they should apologise to the people of Scotland for the state of their education system, which is failing thousands of Scottish children, whilst they bang on about leaving the Union and rejoining the European Union. Maybe, Madam Deputy Speaker, they should explain to the people of Scotland that despite being in power for 13 years, they have the worst health statistics in the world. Quite frankly, Madam Deputy Speaker, they should be ashamed of themselves, wasting parliamentary time on a pointless debate that will achieve nothing. And they should explain, Madam Deputy Speaker, why after 13 years, Scotland is going backward.
Order, Marion Fellows.
Can I ask the honourable member opposite to withdraw the remark about the worst health record in the world? I want to save him from embarrassment in the press.
I'm sure the honourable lady will understand that I'm not responsible for what the honourable gentleman says. I'm sure... order. I'm sure that if he feels he has said anything which is incorrect, he will want to correct the record. Lee Anderson.
Thank you, Madam Deputy. There might be a slight correction here, probably talking about the drug deaths in the Western world, which are the worst in the Western world. What we need to chat about here, Madam Deputy Leader, is the leader of the SNP, who has been very quiet about the £270,000 he has rinsed from outside earnings since he was elected to Westminster in 2015. It would take an average worker in Scotland 11 years to earn that sort of money. Yet he stands there every single Wednesday banging on about poverty when his greedy snout is firmly in the trough. And remember, this is on top...
No. I think it was made very clear at the beginning of this debate that we were going to insult each other. The motion is about the conduct of the Prime Minister. So perhaps we could take the temperature down a little. Lee Anderson.
I'm just trying to create an argument, and my closing comments will actually back up what I'm trying to say now. He's not, Madam Deputy Speaker, he's not even apologised about the drunken, loutish behaviour of his own MPs during a trip to Gibraltar just a few weeks ago. They were spotted, staggering around.
The honourable gentleman must resume his seat. I think he's straying a long way from the motion in the debate. He is also referring to honourable members who I don't know whether here or not, but he should have notified them if he was going to refer to them. I suggest that he resumes his speech and just bears in mind those points that I have made, because I would hate to think that the public were looking at us and thinking that this had just become a slanging match. Lee Anderson. Point of order, Owen Thompson.
Madam Deputy Speaker, the member is making clearly erroneous accusations against members that are simply not true. I would ask for your guidance on how the member can remove and correct the record.
I think I made very clear my views about the fact that we had to be first of all, it's very important not to make references to members who are not here if the honourable member is accusing them of something. Secondly, that I do hope we can maintain an element of courtesy in this debate. It's not going well so far with the honourable gentleman speaker. Lee Anderson.
Thank you, Madam Deputy Speaker. Now, I'm going to apologise to the party opposite, and we can clear this up straight away. I apologise about the Gibraltar comments, and I've spoken to some of my constituents who would like to see some of the MPs breathalyse next time they get off an aeroplane in Gibraltar, and that will clear it up straight away. Now, all this nonsense across here is in sharp contrast to our Prime Minister, who's got Brexit done by leaving the EU. He's delivered a £36 billion package to sort out the health and National Health Service and social care. Fastest vaccination. I will give way.
To my honourable friend for giving way. Didn't you think it was a bit rich for the honourable lady opposite to start talking about public spending in constituencies served by Conservative members, when we have some of the poorest constituencies in the country voting Conservative these days because the working people are trusting this Prime Minister?
I thank my honourable friend for his sensible intervention, and only look at my own constituency of Ashfield, one of the poorest of the country, neighbouring Bolsover, neighbouring Don Valley, Rother Valley. All these places had millions and millions of pounds worth of investment.
True fact.
I also want to speak about the Prime Minister who's launched our plan for jobs, helping people get back into the work. We're cutting taxes, we're boosting wages, we're helping working families. And I'm going to stop picking on the SNP at the moment because I want to talk about the mass ranks of the Labour Party. And I'm struggling to see them at the moment. But they can't be bothered to turn up today, despite pretending they bother. They can't be bothered to turn up today. And they seem to think that there's a war raging in France at the moment, and it's acceptable for thousands of illegal migrants across our channel every single day. And they really need to get a grip, Madam Deputy Speaker. Now, another sign that the Labour Party has lost the plot is they want to replace our armed forces with human security services. A shift from the classic armed forces to a gender-balanced, ethnically diverse human security services tasked with damping down violence. Imagine that, Madam Deputy Speaker. A peace-loving British tank.
Order, order. I think we've actually, this is a motion about the government. I'm afraid the honourable gentleman needs to bring his remarks to a close. I want him to resume his seat, and I will call Wendy Chamberlain.
Thank you very much, Madam Deputy Speaker. Several weeks ago, when the SO24 emergency debate on standards was brought forward, the Speaker said that he wanted to see the House at its best, and sadly I don't think we're seeing that today. But we have had an afternoon of listening to a list of poor conduct instances committed by the Prime Minister, and that is the focus of the debate. And in terms of that list, I do find I have little to add. Like many members of the House, I have had correspondence from people who just want this government and this Prime Minister to behave properly on a variety of issues, and I agree with them. And I know that campaigners in North Shropshire on the doorsteps are hearing similar. Yeah. Previously, I have talked about my children, the difference between saying sorry because you have been caught and actually apologising for wrongdoing. The fact that we're here yet again just shows this message hasn't got through. It is not enough to change the subject when you have made an error of judgment. You must make it right, and not simply because it is politically opportune to do so. True contrition involves not doing the same thing again and taking the right actions. And what actions are those, Madam Deputy Speaker? Let's start with full support for the Standards Committee recommendations relating to the Code of Conduct, which were published yesterday. Let's talk about proper enforcement of the Ministerial Code. Let's talk about a willingness to support procedural changes to make this House modern, relevant and democratic in its workings. Turning back to the motion, Honourable Member for Ross Skye and Lochaber at the weekend said that in bringing this debate he would be acting as real opposition to this government. But this isn't a formal motion of no confidence, and it will sadly have no meaningful outcome. Real opposition means taking real action and demanding real answers. And I would point out it was not the SNP but myself and Liberal Democrats who secured the debate on parliamentary standards, welcomed by his party, I acknowledge, that was taking place immediately following the initial standard vote. And that is what forced answers to be given to this House and actions to be taken in relation to those matters. And I do think we could have debated this topic today in a manner more likely to bring those on the government benches who have expressed displeasure at recent events into a position where some kind of consensus could have been reached. That would have been a way at chipping away at the government majority, which I'm sure will be in full force this evening. Digesting the Standards Committee report would be a clear way forward for this House on an issue that affects all of us. And there are vital issues that the Honourable Member for Ross Skye and Lochaber could have chosen to debate with his party today. His colleague in the Scottish Parliament, the Cabinet Secretary for COVID recovery, was just this weekend arguing that their party are the only ones who care about devolution. And if this was the case, why are we not discussing that, given how vital his counterparts in Holyrood believe it to be? Is it partly because the reality is that the SNP aren't really all that fussed about devolution at all, when all they want to do is end it and cut Scotland asunder from the rest of the UK? Devolution means devolving powers to where they can be yet best utilised and to the maximum benefit of the public. The current Scottish Government, led by the SNP in coalition with the Greens, like to centralise power just as much as the government on the opposite benches does. And there is no evidence of any support for real devolution from the Honourable Member's party. Now, I'm a Liberal Democrat, a Scottish Liberal Democrat, a party with a long history of supporting, in over 20 years of the Scottish Parliament, not just devolution, but federalism. Powers and funding should be national, regional or local, depending on that requirement. But perhaps I'm wrong. I hope the Honourable Member will explain, and his party will explain, if the party feels so strongly about devolution, why that is not the motion of the debate. As the MP for St Andrews, the town of St Andrews on St Andrews Day, I do think we could have used this opposition time today more productively than what has been afforded to us this afternoon.
Well done.
Alexander Stafford.
Thank you, Madam Deputy Speaker. I rise today on behalf of the people of Rother Valley to put on the record our strong and unwavering support for this Prime Minister and the transformative work he is doing for our communities and areas like ours across the north and the Midlands. There is no doubt that this Prime Minister is a Prime Minister that gets things done. Yet I've been very disappointed with the tone of this debate, with the SNP in their typical fashion, sniping from the sidelines, as they are doing literally now. They cannot do it, and making wholly unsubstantiated claims for purely political gain. However, this Prime Minister focuses on the jobs at hand, of levelling up for everyone, and it is quite clear that he is radically improving public life, and to prove this, my constituents would point to a panoply of evidence. Firstly, and very importantly for this side of the House and for the people of the country, is that this Prime Minister got Brexit done where others had failed. He achieved Brexit when we were told we could not leave, where there was no deal that we could make. However, Despite that, he overcame the gridlock and actually delivered on what the people wanted, Brexit, which is no easy feat. He's got a deal that everyone else will say was impossible and negotiated an unprecedented free trade agreement with the European Union, which no other country in this world enjoys. However, crucially, he achieved a full and complete Brexit. Not some Brexit in name only, which is advocated by many of the Liberal elite, but a full and proper Brexit motion. Of course, on Brexit, I love Brexit.
For giving way that, given that Northern Ireland now has itself access to the single market as part of the island of Ireland and voted to remain within the European Union, why hasn't Scotland been offered the same opportunity?
I thank the honourable friend for that intervention, though I'm a bit unsure about the point, because the United Kingdom as a whole voted for Brexit, including actually a large number of people in Scotland, let's be fair. I think an awful large number of people. In fact, so I think actually we should obey the will of the people. But as we've already established, when we're talking about standards, the SNP do not like listening to the will of the people, whether it's on Brexit or whether it's on independence. It's having their cake and eating it, Madam Deputy Speaker. Now, another aspect which my constituents care passionately about, and I would say even the SNP constituents, is about the rollout of the fastest vaccine programme in the world under this Prime Minister. By taking the brave choices, by backing a myriad of different horses when it comes into it. Almost 9 in 10 people aged 12 and over have now received a first dose of the vaccine, and undoubtedly this Prime Minister's action has led to the saving of thousands upon thousands of lives. Now, the PM has in place a great emphasis on inventing and manufacturing vaccines here in Britain. And we must recognise this Prime Minister's foresight to place bets on multiple vaccine options, to over-order doses, to make sure we buy boosters, and to back our British science and companies. Now, not only that, but we have used that vaccine to provide vaccines to the rest of the world, leading the way at the G20 on vaccine donation, committing 100 million doses, including the entire UK Janssen supply, and half of our Oxford AstraZeneca vaccines for those countries in need, which is something to support about. But turning to Rother Valley in particular, and how this Prime Minister has got the backing of Rother Valley, and how he's delivering for Rother Valley, is looking at his support for things like the green industries of the future, with visible government support for IT and power, and the government measures to protect Sheffield and Rotherham Steel locally. We've heard today about the Levelling Up Fund, and Rother Valley was pleased to get £11 million on it. And contrary what some of the party opposite claims, are going to well-off areas. £4.5 million of that went to a town which they may have heard called Maltby. Maltby is one of the most deprived parts in the country. In fact, it's the lowest 5% of poverty in the entire country. And therefore believe that they should be getting that, and that is quite right. This Prime Minister has listened to the people of Rother Valley and scrapped the HS2 2B arm, which is great, and throughout it has received much support for coronavirus support, loans and bounce-back loans and the like. On top of this, this government is delivering the biggest increase in police number in 10 years, which means the government funding and the police precept will mean that by 2022, police numbers in South Yorkshire will rise by 228. And despite what the other side may be chuntering, there's not many of them admittedly, is that by 2023 there'll be more police than there were in 2010. So we're over-delivering. But let's just look at the evidence that I would like to come about why the people do back the Prime Minister. And I point to the local election results that Rotherham have, or which Rotherham have, in this year. Last time we had election results, Madam Deputy Speaker, we got a grand total of 0 Conservative councillors in Rotherham. This time in May, we had 20. The biggest increase in numbers of any council in this country. The most Conservative councillors that's ever represented Rotherham. And Rotherham, that bastion of socialism from time immemorial, Labour was in 94 votes of losing their majority. 94 votes. Now, if that's not a backing for this Prime Minister, and this Prime Minister's way of doing things and getting things done, and action, I don't know what is. Because this surely is the test of all politicians, the election results. And recently, in May this year, the electorate gave a resounding support for this Prime Minister. So on that note, this House, I believe, for the full backing of the Prime Minister, Rother Valley, those areas that need levelling up, supports the Prime Minister to get things done.
Order. There have been a lot of interventions, and as a result, I'm going to have to take the time limit down to 3 minutes. I have been able to warn the next speaker of that. But I do urge colleagues, if they continue to take interventions, not everyone's going to get in. Gavin Newlands.
you very much, Madam Deputy Speaker. The fact is we're here today because we have a Prime Minister that has spent the last 2 years undermining the very institution of liberal democracy. On cash for honours, it's one thing to bestow meaningless medieval titles on people, but it's quite another when those titles guarantee a seat for life in this building, subject to zero democratic oversight, zero elections and zero accountability. But it was ever thus, Madam Deputy Speaker. In the days of Monday Gregory and Lloyd George, there was a price list for honours. £10,000 for knighthood, up to £50,000, which is £2.7 million in today's prices, fun enough for a peerage. At least it predated the introduction of VAT and kept prices down for eager customers. But when the law finally caught up with him, he was fined £50 and got 2 months in jail. He's still the only person to have been convicted of selling honours, and even then he escaped any prosecution over the sale of British honours. Instead, it was called for punting Vatican ones. That fact alone is incredible, given all we know about the last 100 years of the Lords and political honours. But his sentence also tells a tale about the establishment's attitude to someone caught in the act. They simply aren't interested. Not one single person has ever been convicted of selling British honours. If you believe that means honours haven't been sold, I have a bridge or two that I can sell you. Not a garden bridge or a bridge to Northern Ireland, because only a mug would think that they were feasible. Madam Deputy Speaker, the British establishment, with the Prime Minister at its apex, have shown over decades that the House of Lords is irreformable. Because the plain fact is, the Lords' main function is not to revise and amend legislation as part of democracy's checks and balances, because the only checks that are required for appointment to the House of Lords need to be made payable to Conservative central office. And the Prime Minister has shown himself time and time again to be unfit to decide who sits in that place. He's not the first, but he's possibly the worst. He's used his untrammelled power over honours to stuff what is supposed to be an upper chamber of Parliament full of cronies and chums. He should be thoroughly ashamed. He should be ashamed, but it's not even clear that the Prime Minister has the ability to feel shame. It's time for Scotland to rid itself of this stink and follow a different course. Because whatever challenges, and there will be challenges, whatever challenges independence would bring, we'll at least have a functioning democracy based on accountability and plurality. I should have drunk before this speech, Madam Deputy Speaker, rather than the absolutely rotten system we live under today. And we also no longer live under the Prime Minister and his open contempt for democracy.
Marco Longhi.
Thank you, Madam Deputy Speaker. I must say I find it utterly bizarre that we find ourselves here this afternoon, once again wasting valuable parliamentary time, all because SNP members opposite are so desperate to deflect their own insecurities and failures. It is laughable that when they want to accuse our Prime Minister of ignoring advice, when the policy of ignoring is precisely what their party stand for. The good Scottish people voted to remain a part of the United Kingdom, and the SNP will not take the final word of their own constituents as exactly what it is, but instead seek to overturn it. There is a policy of division. Madam Deputy Speaker, the SNP nationalists consistently let down Scottish people on healthcare, with A&E waiting times near the worst level on record. Their First Minister, Nicola Sturgeon, stumbled and floundered over her devolved nationalist government's record on the NHS, COVID recovery and the economy in a recent TV interview. All she appeared to do was to blame the pandemic. In her time as First Minister alone, the number of people waiting over 12 weeks for treatment increased 427% for outpatients and 1,590% for inpatients. So who supported the Scottish people, Scottish businesses, the Scottish Government through this pandemic? It was the UK Government led by our Prime Minister, Boris Johnson. It was the UK Government who implemented the furlough scheme supporting more than 900,000 individuals. It was the UK Government that supported 175,000 self-employed workers in Scotland, with a total claim to the UK taxpayer of nearly £1.7 billion. It was this UK Government that secured access to the COVID-19 vaccine for Scotland, saving lives and stopping the spread of the virus. And it is this UK Government who has secured the booster jabs to protect and save lives as we face the uncertainties over the Omicron variant. But I don't think the SNP care about any of that. They don't care about what really benefits their residents. They only care about holding on to their seats. For them, it's about division. They want English members of Parliament in this place to come out berating Scotland and its people to fuel their own separatist fires. I have news for them. All colleagues I know love Scotland and the Scottish people. Even Labour MPs, although they're absent today, love Scotland. Why, they even had a former Prime Minister and Chancellor who were Scottish. This personal attack on the Prime Minister is nothing more than an act of political desperation by a party that's covering up its failings. Soon we won't just have painted windows on ferries they can't build, we'll have painted images on benches opposite for a party of Christmas past. Madam Deputy Speaker, they're running out of ideas, running out of time.
Madam Deputy Speaker, the Scotch, what a verminous race. A racist poem that calls for the comprehensive extermination of the Scots. A poem that the current Prime Minister thought merited being published when he was editor of The Spectator. We know the Prime Minister thinks a pound spent in Croydon is of better value to the country than a pound spent in Strathclyde. That's his view of our place in the Union. We've already heard Honourable Member for Dudley North telling us to be grateful for what we get. Now, the Prime Minister also previously suggested it's English subsidies that pay for Scottish government policies such as free personal care, free tuition fees, and he's also called for the abolition of the Barnett formula. And it's not long ago that the Prime Minister also told Tory backbenchers that devolution was Tony Blair's biggest mistake and a disaster. So it's both bizarre and pathetic how the Scottish Tories defend this man and defend his attitudes. He tried to ooze with the Union Bridge, but we didn't need the feasibility study to tell us it was a stupid idea and couldn't be done. But meanwhile, while he could try and find money for his vanity project, the Scottish carbon capture cluster, the most advanced project, has been ditched in favour of 2 clusters in the north of England, targeted at the Red Wall seats. So yet again, that's our place in the Union, according to the Prime Minister. Now, this is also the Prime Minister that helped inflict Brexit on us, a man happy to be in a bus with the slogan that was a downright lie, a Leave campaign that broke the rules in the use of data, a campaign party funded by dark money.
Point of order, but I do feel quite strongly that I just don't want the debate constantly interrupted by points of order, that if there are matters for debate.
Madam Deputy Speaker, on a point of order, I do have to ask your advice as a new Member of Parliament. Is it acceptable in this House to say lie and accuse a member of lying?
There are particular circumstances of this debate where language that would you may not have been in at the beginning, but the Chairman of Ways and Means made very clear that some of the normal language that could be used is allowed because of the nature of this motion. Alan Brown.
Thank you, Madam Deputy Speaker. For the record, the slogan in the bus was a downright lie. This is a Prime Minister that gave us illegal prorogation of Parliament and was willing to break international law. This is a Prime Minister who clearly doesn't respect democracy and is seeking to further undermine it. We've got the voter ID being introduced, lifetime votes for expats because he thinks expats are more likely to vote Tory, giving himself the power to call an election, the attack on the Electoral Commission, the privatisation of Channel 4, the attempts to install Paul Darker as chair of Ofcom, the secret Freedom of Information Clearinghouse. All these matters are further levers to manipulate and hold on to power. And this is a man who once conspired to have a reporter beaten up, a man who was sacked from his job as a journalist for lying in a story. And of course, as we've heard, he continues to stuff the House of Lords with cronies and donors. And it was outrageous that at the Liaison Committee he suggested this was needed to be done to counteract the power of trade unions. It also explains why he rushed to the defence of own parts and overpaid lobbying. Madam Deputy Speaker, so many of my constituents ask me how I can put the antics in here, but one thing I can tell the Tories opposite, it's driving people towards independence.
Joy Morrissey. Thank you, Madam Deputy Speaker. Firstly, any member of the public that has the misfortune to stumble across this debate will be appalled that at a time of a pandemic, a migrant crisis, endless illegal crossings of the Channel, and numerous real concerns filling up my inbox, that the SNP are indulging themselves with this non-issue in a transparent attempt to generate a few cheap headlines. And I'm interested how they alighted on the sum of 41,567. Is that so that the British Prime Minister would make less than the leader of the SNP in Scotland? I'm not sure. Because in general, the job of the Prime Minister, the most responsible role in the country, is already remunerated annually for less than most and countless public sector bureaucrats and managers who oftentimes earn twice or even 3 times the Prime Minister's salary for a fraction of the responsibility. As they are so interested in fairness, presumably the SNP will be demanding a debate on this anomaly as well, or perhaps not. The only person not justifying his salary at this is the member opposite, who, instead of serving his constituents and allowing the rest of us to do so, would prefer to waste all of our time on this infantile debate, which says far more about him than it does our Prime Minister.
Liz Sarah-Roberts.
With or without invoking parliamentary privilege, it is sadly fair comment and no libel when we consider the conduct of the Right Honourable Member for Uxbridge and South Ruislip and how it has become unbecoming for a Prime Minister. And that really begs the question of how and why we've reached this point. Today's debate shouldn't be partisan, and it shouldn't be about the failings of a single man, because this place made him, and it has so far enabled his conduct. Instead, it needs to be a discussion of how far we're willing to go before we reset the course of a failing ship of state for it to sail straight. Far too long, this place has insulated itself from criticism and failure by burrowing deeper and deeper into the traditions and virtues of history. It remains entrenched in the conventions of a time when landed gentlemen indulged in debating skills, all the while legislating to protect their own vested interests, 2 sword lengths apart. You would wonder, wouldn't you, Madam Deputy Speaker, what has changed? Its chronic reluctance to overcome adversarial politics and modernise means its vulnerabilities have been easily exploited by some for personal or political gain. This place lent itself to doing that. We need to do better to remedy the sheer immensity of the challenges we face. We've all talked about that, but we've been so adversarial about it, haven't we? We've used it as a pantomime charge to throw against each other. And it is this sort of consensual rather than adversarial politics which lies at the heart of Plaid Cymru's cooperation agreement with the Labour Welsh Government, which was ratified this weekend. The conduct of this Prime Minister necessitates it. It has brought Labour on board with several key Plaid Cymru pledges, including free school meals to all primary school pupils, the devolution of the management of the Crown Estate, a commitment to take radical action to address the second homes crisis, and, yes, long-term reform of the Senedd, to name but a few. This is the politics of the 21st century and not a museum piece. And the behaviour of this Prime Minister has necessitated it. We want to work with other parties to achieve social, economic and environmental progress, and this agreement does it. It also brings about the stability, consensus and ideas needed to our political system to ensure that we rebuild from the pandemic and act swiftly to achieve net zero. And I look forward to hearing support from the benches on this side and the Parliamentary Labour Party in the only place where there's Labour holds government in the United Kingdom.
Jerome Mayhew.
Thank you, Madam Deputy Speaker. It could have been so much better today. We had a precious chance to debate the issues that are most important to the people of Scotland. And they know what those are because every single opinion poll tells them it's not independence. Less than 13% of Scots put that even in the top 3 of their issues. Actually, the top 3 priorities for Scotland are the healthcare, the economy and the education. And it's just the same, Madam Deputy Speaker, in England and in Wales and in Northern Ireland. We are together in this in our United Kingdom. But that's no good, Madam Deputy Speaker, because the job of the SNP is to sow division, is to drive a wedge. It's because they have one issue, and that's independence, irrespective of the views of the Scottish people. And if you looked at healthcare, you can see why they're so silent on it. It's because any debate on the SNP health performance over the last 14 years would be a disaster for them. Because even before COVID, waiting times for referrals in England averaged 12 days, room for improvement. In Scotland, waiting times for outpatients were 32 days, and for inpatients, 45 days. Wow. Now, that's not an accident. That is the choice of the SNP.
Shocking.
And we've already heard the drugs scandal. If we want to debate a scandal in this House today, Madam Deputy Speaker, it should be about the SNP drugs policy.
Go to Glasgow.
And what about the economy? Well, they don't want to talk about that either, because of the massive support by the United Kingdom government for millions of people and businesses across Scotland, the furlough schemes, the 99,000 Scottish businesses helped through business support, the billions of investment locally by locally driven partnerships and projects by the Shared Prosperity Fund, the Levelling Up Fund, the Community Ownership and Global Britain Investment Funds, and of course the union dividend of £2,800 for every adult and every child invested in Scotland every year. So we better not talk about the economy. And that's not even to mention the third issue, one of education. Now, they used to want to talk about that. Nicola Sturgeon said in 2015, "Let me be clear, I want to be judged on this. If you are not, as First Minister, prepared to put your neck on the line on the education of our young people, then what are you prepared to do? It really matters." And she was right, it really does matter. But a decade of devolved power, and Scotland has fallen below England on the PISA standards. On reading and maths and science, the SNP don't want to talk about that.
Come on.
So what's left? An obsession with constitutional change and a debate on how much the Prime Minister should be paid. This matters, Madam Deputy Speaker. Just yesterday, the First Minister ordered the Scottish Government to divert resources to prepare for a referendum.
Order. I have to keep people absolutely to time. Stephen Flynn.
Thank you very much, Madam Deputy Speaker. I think it would be remiss of me not to start my contribution in a debate about the Prime Minister to perhaps firstly reflect upon the characteristics of my own toddler back at home, because he's fast approaching 2 now, and he's developing this really cute personality. See, what he does is he likes to reenact or imitate the noises that cars make. He also sometimes he loses his place by complete chance. He doesn't know what he's saying or indeed what he's doing. I think it's adorable. And of course he's a massive fan of Peppa Pig, although as I understand it, he's not yet been to Peppa Pig World, and long may that continue, I might add. You can imagine my surprise that I've not had a phone call asking if my toddler can go and deliver a keynote speech to the CBI, as the Prime Minister opposite, of course, did. But on a more serious note, the veneer and the laughter that encapsulates the Prime Minister that got many of the Conservative backbenchers elected, it's disappearing, and it's disappearing like snow off a dike. And the reason for that is simple, because the Prime Minister breaks his promises, whether it's in relation to protecting the triple lock on pensions, whether it's in relation to protecting the international development aid budget, whether, of course, it's in relation to not raising taxes. And that breaking of promises breaks trust with the public. And that's the reason why his poll ratings continue to plummet. And that's before, of course, we get on to the reality of what we've seen in the last few weeks and months in relation to the corruption and sleaze, the VIP lanes for Tory friends, families and donors, the Owen Paterson scandal, the fact that if you have £3 million, you'll get yourself a seat in the House of Lords. But it's not just at home that his reputation is plummeting. Abroad it is too. When we needed leadership at COP, we got Kermit the Frog, we got cows belching, and of course we got our Prime Minister sitting beside David Attenborough without a mask. On Brexit, our relations with the European Union are a complete and utter burek. And last week, When people were dying in the Channel trying to get to this country, the Prime Minister sought to do diplomacy via Twitter. A lesson in how not to do diplomacy. So, Madam Deputy Speaker, I might break from the norm here, and I might actually agree with some Tories in this regard. I hope that the Prime Minister stays in post, because when it comes to Scotland's independence referendum, Madam Deputy Speaker, I sincerely hope that he's at the vanguard of the push to protect their precious union.
Richard Thompson.
Thank you, Madam Deputy Speaker, and I would like to be able to say what a pleasure it's been to listen to the single transferable whip speech that seems to have passed from one end of the Tory benches to the other, but I'm comparatively new to my parliamentary career and I've no wish to be hauled up for misleading the House in that respect. Plenty of criticisms can be made of policy, but this is the bit that everybody on the other side of the chamber, from the Minister to the backbenchers, seems to have completely missed entirely. This is a debate about the probity and the suitability of the current occupant of 10 Downing Street to be there and to continue carrying out his duties as Prime Minister. Now, when I first started taking an interest in politics, Madam Deputy Speaker, it was as a student during the tail end of John Major's time in Downing Street, and there were scandals aplenty then, like now, from the petty and the embarrassing through to the corruption of cash for questions and the outright duplicity of the arms to Iraq affair. And it was hard to imagine that the UK might ever again be led by a government so chaotic, so lacking in scruple, so willing to bend the truth, so willing to hawk itself around the broadcasting studios to assert that forwards is backwards and black is white than we had back then. Yet still, here we are, and while we can all no doubt highlight points along that trajectory where things really started heading for the ground, I don't think any reasonable person at all could dispute that it's the present holder of the office of Prime Minister that's taken us to this very nadir of public trust in government and politics. But it's all part of a pattern of behaviour. You want a photo opportunity in a hospital but can't be bothered wearing a mask? Just ignore the instruction to wear it. You don't like the Electoral Commission investigating who funds your party or your takeaways or your flat renovations? Emasculate the Electoral Commission. You don't like the fact that people without ready access to ID tend not to vote for your party? Try to introduce voter ID. You don't like the fact that voters in devolved nations don't elect enough of your representatives of your party to have any influence? Try and bypass devolution. Accidentally create a border in the Irish Sea? Just pretend it doesn't exist and tell people that black is white. Madam Deputy Speaker, this is a government that quite clearly thinks the rules don't apply for it. It's one rule for the government and another rule for everybody else. But it comes from the top, led by a Prime Minister who clearly doesn't think there are any rules at all, or that if there are, it shouldn't apply to him.
One more thing, give way.
Yes, I will.
Thank the Honourable Friend for giving way. And on that point, does he agree all this talk of the levelling up agenda? In terms of Scotland, it's very clear, and it's a scorched earth agenda, whether it's carbon capture in his part of the country or the Valneva contract to deliver 100 million vaccines, which we need right now. This Prime Minister is not capable of doing the very basics and telling the truth.
I thank my honourable friend for that intervention, and she says it very, very eloquently and very, very succinctly. But we have a crisis of confidence in this country. We have a crisis of confidence in the Prime Minister, who is clearly not fit for the job for which he has been entrusted. And it's even aided and abetted by the silence and the complicity of far too many members on the benches opposite. And I can't wait to see which lobby the Scottish Conservative contingent in particular chooses to go through this evening.
Order. Because of that intervention, I'm afraid the final speaker is only going to be able to have 2.5 unless the SNP spokesperson would take a little less.
Thank you, Madam Deputy Speaker. The Ministers and members opposite have been trying all afternoon to
to move this as if it's some kind of not serious debate, as if it's some kind of Westminster bubble story that's just going to go away, that our constituents are not interested. Well, Madam Deputy Speaker, that isn't the case. Because my constituents have been emailing me since I came here in 2015, observing this place and its shenanigans, practices and behaviour which would not be allowed or tolerated in the lives of our constituents or in workplaces up and down the country. Parliament led by a Prime Minister for whom rules do not apply and consequences do not exist. Grubby, manky, tawdry, lies, repeated again and again and again. And my constituents see the Prime Minister at that dispatch box saying things which are not true. And like me, they find it bizarre that this place is the only place where calling out a lie gets you in more trouble than telling one. And it's not for the Prime Minister General or for the Tory benches to tell me what is important to my constituents and what they feel is important, because constituents in Glasgow Central have contacted me to tell me that they believe the House of Lords, that repository of those who have lost their seats, the donors and the cronies, should be abolished. Constituents have contacted me on the need for an urgent inquiry into the COVID-19 scandals to get to the truth of where these VIP lanes have led. They've contacted me angry about the Electoral Commission being undermined by this Tory government, about the elections bill and about voter ID, which will suppress their democratic rights, and about the shameful behaviour of members opposite seeking to change the standards to protect their pals. Madam Deputy Speaker, my constituents care deeply about fairness and democracy. They are increasingly appalled by the behaviour of this UK Tory government and this Prime Minister, and many of them are now seeking an alternative.
Pete Wishart.
And thank you ever so much, Madam Deputy Speaker. Well, this has been some debate. I have to say at the outset, I didn't think our modest little motion that we presented today would trigger the Tory backbench in the way that it has done. There has been some amazing speeches in response to what we put forward as a very reasonable motion about the behaviour and the conduct of the Prime Minister. Now, I want to come to their speeches because some of them, Madam Deputy Speaker, were truly fascinating. I want to go into some details, but first of all, I want to congratulate my honourable friends for some outstanding contributions today. And I'll start with my right honourable friend, the member for Ross Skye in Lochaber, who was absolutely right to highlight and list that litany of sleaze and corruption, reminding us of the Nolan principles in public right. And he was right to use the L word. Now, I've been 20 years in this House. It's not become commonplace for that to be placed here, for that to be used. Today, it's the only word that is appropriate. No other alternatives can be found. And it's the only way that we could describe somebody's conduct. And Madam Deputy Speaker, the Chair of Ways and Means was absolutely right to make that ruling today, because there is no other word to describe what he has said to this House. I'm even reluctant to use it. I've been in this House so long. But lie it is. And there have been some great speeches. The member for Dundee East, the member for Coatbridge, Christen and Bellshill, the member for Agent Shotts, the member for Midlothian was a fantastic speech, Motherwell and Wishaw, Paisley and Renfrewshire North, Kilmarnock and Loudon, Aberdeen South, and I think that I would rather have the member for Aberdeen South's toddler any day address the CBI rather than the Prime Minister, and of course the member for Gordon and the honourable member for Merioneth. And then there was the Conservative speech as well. Jeez, Madam Deputy Speaker, where do you start? First of all, they come here and they tell us we shouldn't be debating this, that we should be debating something else. They said exactly the same thing last time we had an opposition day. We weren't to debate what we want. Maybe we should just go to the Leader of the House and ask him what permission we can have and to tell us exactly what we should be debating in our own opposition day. And what a hard neck they have got, because they have just pockled half a day from our opposition day today so they can discuss the wearing of face masks in England. And if you don't know what pockled means, Madam Deputy Speaker, let me tell them what it means. It means misappropriating and taking away and stealing. And that's exactly what they did today. But we've missed. I thought we were doing them a favour. I thought they would all be queuing up, jumping over each other to get to their feet, to defend the Prime Minister, to tell us what a wonderful character he was, to tell us about all his attributes, to tell us he was the most honest man in the world, that he was corruption and sleaze free. None of them did it. Not one. He said, there's one. I think there was somebody else that might have actually mentioned just how valuable to them that they are, but like none of the rest of them were even going to start to prepare to defend their Prime Minister. They wanted to talk about absolutely everything else other than what this motion was about. They tried to get us to talk about everything else other than this. But let me tell them this too. They think this is unimportant. And that's going to be their downfall. They actually believe their own rhetoric that nobody cares about Tory sleaze and corruption. It is all anybody's talking about. Why do they think their opinion poll rating has dropped something up to 8 percentage points? It's not because the SNP are debating education or health. It's because they are mired in a sleaze and corruption scandal of the scale of the 1990s. That is the reality of what people are discussing, the length and breadth of this country, and that is why they are falling. I'll give way. It's all the time I'm giving way. Quickly.
I'm very grateful to my honourable friend for Perth and North Perthshire. The Intelligence and Security Committee stated recently that Russian influence in the UK is the new normal, with successive governments having welcomed the oligarchs and their money with open arms, providing with a means of recycling their illicit finance, and then with connections to companies and political figures. That's corruption at the heart of the British government, isn't it?
Absolutely and utterly. I mean, the list of corruption sleaze, I mean, it would take all day and longer than I'm allowed to just detail it, even the scantiest of details. They are up to their necks in it. Now, they might wish, as they have been doing all afternoon, that the public could not care about this. The public care very much. And I'll tell you who they've got to blame for this. The very man that this motion mentions. It is their Prime Minister that has led them to the fall in the polls. Now, I thought they would be rushing to join us this evening. I mean, come and roam in the gloaming with us in the eye lobby as we censure the Prime Minister, because he has treated them appallingly, almost to the point of cruelty. They're having to defend themselves from their constituents. They're actually having to say to their constituents that Peppa Pig isn't a government minister. Such is the confusion that abounds them. So join us tonight. You know it's the right thing. This Prime Minister has treated them appallingly, and they should be helping us this evening. The Prime Minister has actually gone from being the brightest Brexit asset to their biggest liability. Forget about being led to the top of the hill. They've had to carve out a new gorge and mountain range for the amount of mountaineering that they've had to go up and down. So this is why they should be helping us this time. They thought they were going to saunter to their next election victory. The Prime Minister has sorted it for that. But I have to say to my right honourable friend, the member for Roskillie and Lochaber, I'm a bit conflicted by this motion. I'm not conflicted in the sense that I don't think what we have is a disgrace of a minister, somebody who shouldn't get within several feet of Larry the cat rather than the number 10 sitting room. But I'm conflicted because when we talk about a Prime Minister like this, he is the best recruiting sergeant that we have for the cause of Scottish independence. What would we do without him? It's the thing that we have got. And like they're all saying, they're agreeing with me. He has more than anybody else made sure that the cause of Scottish independence has been promoted the way that it has. And we have to thank him for this. So I have to say, my right honourable friend, I'm just a little bit conflicted. I'll back the motion because he's useless, because he's corrupt, because he's sleazeworthy, and because he lies to this House. But by God, what a job he has done for the cause of Scottish independence, and for that we have him to thank for. And when I'm thanking people in the course of a debate, it would be lax of me not to thank the Conservative backbench. Thank you for your efforts today. That was absolutely fantastic, because something they always forget when they get up and make these stupid speeches is that the people of Scotland are watching them. Now, they were enamoured by, he's not in his place, which is a real unfortunate, the member for Ashfield, a disgraceful speech that it was. And people of Scotland watch them and they're thinking, why on earth would I want to be in this minging midden with these people speaking about my nation such as this? And for that, I thank them most sincerely, and I think that they've done a stellar job today in ensuring that Scottish independence is continued. Now, there's a whole list of things. Just one issue I'll touch on, because we've been doing... I'm getting my Tory fans really backing what I'm saying today. But the one issue that we really have to touch on, because it's been mentioned so often by my honourable friends, it is that place down the end of the corridor. What a place. I mean, I believe the House of Lords is now ground zero of Tory corruption. And the fact that we can have former Tory treasurers, all but one of the last 9, in that place, for the only defining feature they have, I've looked through them all, and I was looking for philanthropy, I was looking for good causes, I was looking for charities. The only thing that unites them is this rare ability to be able to give £3 million to Tory coffers. Now, there is no way that this can continue.
Order. The honourable gentleman is veering very close to the line here. He must not accuse individuals from the Lords. And I know that he'll want to be finishing off quite soon. Pete Wishart.
I'll obviously follow your stricture, Madam Speaker. I'm not referring to individuals, I'm referring to that place down there. And, you know what I mean? And I'll say to the Labour Party, none of them turned up today, there's 2 backbenchers come along. Help us, for goodness sake, to clean that place out. Do not accept any more members of the House of Lords, for goodness sake. We've got this one opportunity with all this Tory corruption going on with the House of Lords. If we do it. Now, I was listening to the Honourable Lady, and I like her. She's one of these genuine Labour frontbenchers. But there is nobody from the Labour Party here today. What is that about? This is serious stuff. This is the behaviour of the Prime Minister. This is his conduct generally. And we need to make sure that the Labour Party are with us in order to take this on. We won't stop this. We want out of this House. Scotland will be an independent nation, and we're not going to be here for much longer. The Scottish people are observing how business is done here, and they do not like it one bit. They do not like the speeches from the honourable gentleman, the ladies at the back. They cannot stand this Prime Minister. More and more, the Scottish people are looking at this. They're deciding that what they want is a nation of their own, a country that they could decide and design in their own fashion, not determined by a Tory Prime Minister. And, Madam Deputy Speaker, they are going to get it.
Yeah. Ms. Renshaw.
Thank you, Madam Deputy Speaker. May I start, of course, by wishing you and colleagues across the House a very happy St Andrew's Day. And perhaps after this heated and charged debate, we might all enjoy a little of Scotland's national drink to toast what more unites us and divides us. And I will endeavour to reply to as many members as possible in the few minutes I have remaining, and I apologise if I'm not able to pick up on everyone's comment. But as it is St Andrew's Day, it's probably appropriate for me to start by referring to the Honourable Lady, the member for North East 5, sadly not in her place at the minute, but her seat contains St Andrews. And I think she made a couple of important points, that this debate is a wasted opportunity today. We could, for example, if the real concern for the separatists opposite was to take forward the debate on standards in public life, we could have had a debate on the committee's report and some of the related issues on that, but no, they chose not to. The Honourable Lady also suggested that the centralising power of the Scottish Government could be properly examined, issues that really matter to people in Scotland. But no, we didn't do that. So it is disappointing, but not entirely surprising, that we have spent our time today responding to the desire of the members opposite once again to engage in the divisive, splitting up policies that appeals to their fan base in the wake of their recent conference. Perhaps, Madam Deputy Speaker, it's to give them fresh, as my honourable friend for Burnley pointed out, fresh social media clips to post on Twitter and somewhere else. But I have to say, Madam Deputy Speaker, it was pointed out to me during the course of the debate that SNP Command and Control were tweeting about this debate using an old photograph of the chamber. So unless members often have had a complete costume change during the debate, perhaps this is fresh material that they need. But of course, I wouldn't expect members opposite to arrive here with a long list of the ways in which membership of the Union benefits Scotland, or the many ways this government is investing in the future of Scotland as we navigate our way through this pandemic. They want to talk of the Prime Minister's conduct. I'm happy to talk of the Prime Minister's conduct in securing for Scotland the rollout of the COVID-19 vaccine, saving lives and stopping the spread of the virus. And today, the conduct of the Prime Minister has been to set out how we are going to ramp up the booster programme to give us the best possible defence against the current variant. That is what, the Honourable Lady must forgive me, I have a lot of her colleagues to respond to in the course of this debate. We could have been debating the important issues about how we respond sensibly to this new variant. And of course, I wouldn't expect the party opposite to highlight the way that this government has supported thousands and thousands of businesses in Scotland with over £4 billion of loans through the Bounce Back Loan Scheme and the CBIL scheme. It took 13 minutes only for the reality to be revealed, when this is actually all about separation and their desire to achieve it. That's what this is all about, not the real issues that are of importance to the people of Scotland. Then we had the contribution from the Shadow Minister opposite. I do feel some sympathy for her, given the massed ranks of her. With one, marvellous, two and a half, perhaps. I'm not quite sure where they are with that. But the Honourable Lady did say something quite surprising. She said Labour aren't here today because it's an SNP debate, as if that exempts them from talking about these issues. Have Labour given up in Scotland? Does it fall solely to this party to be the defender of the Union? I really think her colleagues should take a little bit more interest in this matter. My right honourable friend from West Suffolk, I thought, made a hugely important contribution. He actually spelt out the reality amidst all the false accusations that go on about the procurement of vital equipment during the early stages of the pandemic. We were in a race against time to get that equipment, and he rightly spelt out what happened. And this nonsense that it was crony contract is just not fit for purpose. He also made the important point that our vaccine programme was UK funded using universities across the UK. That is the reality of the Union. And then the honourable member for Dundee East, who I have a lot of affection for, and we've worked collaboratively on issues affecting his constituency or nearby. He made a number of accusations which I really can't allow to lie. Firstly, he said we were engaged in various acts of voter suppression and cited the voter ID. Well, I have to reveal to him that we have this already in one part of the United Kingdom, in Northern Ireland, and there is no evidence that it suppresses voter turnout. He also cited the boundary review as if this was something unnecessary. I have to tell him, I looked up the electorate in his constituency, which is approximately 66,000. I have to tell them I've got nearly 100,000 electors, and isn't it a basic point of fairness that we each represent approximately the same number of voters? And his final point was to reference a Supreme Court judgment. He seems to have forgotten that the Supreme Court recently ruled against the Scottish Government when it tried to exceed the powers of the devolution settlement. And this is a party that talks about respecting devolution. I have to say it was off the mark. I'm not going to be able to respond to many more interventions, many contributions, Madam Deputy Speaker, but I do have to respond to the very important point that my honourable friend for West Aberdeenshire and Kincardine made. At the moment, his constituents are without power, heating and basic services. He wants to know how this government and the Scottish Government can work together to help those people in his constituency. That is what we should be debating in this, not partisan red meat to throw at the fan base to cover up internal divisions over the next steps to independence. Madam Deputy Speaker, This Prime Minister is passionate about the United Kingdom. He is setting out some of the long-term solutions to the challenges we face, like on social care, an issue that has been ducked by governments for too long. That is the conduct of this Prime Minister. It is a Prime Minister I'm proud to serve in this government, and I urge colleagues to reject this motion before us tonight.
The question is, as on the order paper, as many as are of that opinion say aye. Aye. Of the contrary, no. No!